And we're still processing the pandemic, frankly. And it is the subject of our next session is the impact of pandemics on conflict, humanitarian relief in conflict zones, trends, challenges, and strategies for the 21st century. The world is becoming increasingly dangerous in the 21st century, and the number and severity of armed conflicts, natural disasters, and disease outbreaks are consistently on the rise. Just yesterday, we saw yet another earthquake in Turkey. Climate is exacerbating these global trends. So we have a very important panel that will come up and discuss all of this for us, moderated by Mrs. Rebecca Milner. It's my pleasure to invite Rebecca Milner to the stage now, who will introduce our panelists and kick off today's session. Thank you.
Good morning. Good morning. I'd like to begin by thanking the custodian of the two holy mosques, King Salman bin Abdulaziz, and His Excellency Abdullah Al-Rabia, the Supervisor General of the King Salman Humanitarian Aid and Relief Center, for the ongoing partnership and generous contributions of more than $11 million to International Medical Corps, which has enabled us to reach millions of people in need globally. Welcome to the panel today, The Impact of Pandemics in Conflict. Thank you for coming. Today we will hear from experts across the health and humanitarian sectors to help us understand the key challenges disease outbreaks pose, lessons learned from the past several years, and to discuss how we can apply these learnings to a changing future. This conversation is being held at a critical moment. The need for humanitarian assistance around the world is rising, and as we repeatedly noted yesterday, 339 million people around the world need assistance and protection. The rising need indicates a larger issue. According to the World Bank, last year, 850 million people lived in countries facing high or medium intensity conflict. For communities in Ukraine, Afghanistan, Syria, Yemen, and the Democratic Republic of the Congo, and others, these conflicts have wide-reaching consequences as they disrupt health systems, supply chains, drive an exodus of healthcare workers, increase food insecurity, and break down social and economic systems. Climate change is increasing pressure on the availability of food, water, healthcare, and other resources, and low-income communities are bearing the brunt. Today, the Horn of Africa is facing the most severe drought in recent history, putting more than 36 million people at risk. Many of those facing severe water shortages and food insecurity in the region are also affected by conflicts. And we must acknowledge the current crisis in Turkey and Syria caused by the earthquakes, and the ongoing conflict in northern Syria that has complicated the delivery of humanitarian assistance. At the same time, communities worldwide are grappling with the impact of disease outbreaks of epidemic or pandemic proportions, which are both fueled by and complicate recovery from conflict. In Syria, more than 52,000 suspected cases of cholera were reported between August and November of last year, at a time when the civil war has left nearly 30% of the public health facilities non-functional. In Yemen, 2.5 million people have been impacted by a cholera outbreak that began in 2016 and continues to this day. The Democratic Republic of Congo has experienced repeated outbreaks of Ebola in recent years, killing thousands. And of course, over the past 3 years, we have all faced a worldwide pandemic that has disrupted every element of our lives and our work. Disease outbreaks are challenging the ability of the humanitarian community to effectively provide aid. And as many of us experienced during the early phase of the COVID pandemic, restrictions on movement across and within borders made reaching conflict-affected communities incredibly difficult. At the same time, conflict remains a significant barrier to preventing the spread of disease outbreaks. Research from the Ebola outbreak in the DRC suggests that population-level vaccine campaigns were less effective in areas that had recently experienced conflict. The intersecting crisis of conflict, climate change, and pandemics have both drastically exacerbated humanitarian need and exposed critical gaps and weaknesses. Today, we will explore these key challenges and look forward to the strategies that will shape the future of humanitarian response. With that backdrop, I'd like to welcome our esteemed panelists, if you'd all join me up here. As we began to pull this panel together, we realized that International Medical Corps' work complements and intersects with all of our panelists' work. And this, of course, brought to mind the power of partnerships. No one organization or entity or government can do this alone. We must all work together. So I'm delighted to welcome everyone. I don't know, you're so far away. Come closer. I'm going to introduce each of our panelists one by one. They will be making opening remarks. Dr. Ali, do you want to join me down here? You want to start?
Okay.
We're very honored to have His Excellency, Dr. Ali Adnan, the Minister of Health from Somalia, here with us today. Dr. Ali, would you like to make your opening remarks?
Okay, thank you. Thank you. Thank you very much. His Excellencies, Head of States, Ministers, and all participants, good morning. As you may know, Somalia is fighting at the forefront against the recurrent droughts, multiple disease outbreak, conflict, and climate changes, and COVID-19 pandemic. All these warring disruptions are constantly at the forefront. Every day, multiple tragedies impact the life of our people. As I speak, over half of our population, 8 million exactly, are in need of humanitarian assistance. COVID-19 pandemic is not yet over in Somalia. Like the rest of the world, we continue to see low number of cases and deaths, signifying that the virus presence has not stopped, but perhaps with low intensity. The fact that we have close to 45% of our population fully vaccinated, we may see upsurge of cases in the event of circulation of any new variant of concern. The COVID-19 pandemic, the climate shocks, and the conflicts have taught us lessons that building and investing strong primary healthcare workforce is crucial for improving service delivery and healthcare coverage. The migration of skilled health workers from Somalia due to protracted conflicts and resulting shortage have adversely affected service delivery at all levels of our healthcare. Today, we have less than 10 healthcare workers per 10,000 population, which is far below than the lower threshold of WHO workforce standards of 23 per 10,000. Therefore, sustainable investment is needed in building health workforce that can reduce the current shortage and ensure that our health workers have the required skills and knowledge to deliver good quality health care at all levels. Climate change has proved to be the biggest driver of internal displacement in Somalia. The ongoing drought, which is the result of 5 consecutive failed rainy seasons, has displaced over 1 million people in Somalia. About 40% of internal displacement in Somalia is climate related. For us, climate is real. Therefore, climate change for us is not something that will happen in the future, it is happening now. The agriculture and livestock loss will hit hard on economy of our country. The agricultural sector contributes to 65% our GDP, 65% of our GBD, and livestock contributes 40% of our export earning. The emergence of new pathogens and resurgence of old diseases, which are proven consequences of climate change, will mean that more lives will be lost from preventable causes. In 2016, Somalia conducted joint external evaluation of its capacities to prevent, detect, and respond to epidemics and other public health emergencies. The assessment revealed that we had limited capacity in almost all the assessed areas. Since then, Somalia had taken bold decisions and steps toward improving its capacity to prevent, detect, and respond to epidemics and other public health emergencies, among others. These include strengthening of the routine vaccination program and conducting timely reactive vaccination campaigns to reduce the outbreaks of vaccine-preventable diseases such as measles and cholera. Expanding the disease surveillance system from sentinel sites approach to all health facilities in the country. Establishing PCR testing capacity and genomic sequencing capacity to all the states in the country. And also establishing public health emergency operations all states in the country. Establishing the frontline field epidemiology training program to equip frontline health workers with outbreak surveillance and response knowledge and skills. Implementation of integrated disease surveillance and response strategy aimed at integrating multiple disease surveillance systems into single multi-disease surveillance system. The above are conceptualized as low-cost interventions. For example, Somalia is currently rolling out implementation of the integrated disease surveillance and response strategy for strengthening surveillance through integration. Other low-cost but high-impact interventions we implemented include solar-powered medical-grade oxygen, which is now installed in multiple tertiary health facilities in Somalia. The community health worker program is another low-cost, high-impact intervention that has been implemented. As a measure of impact, 42.7% of all confirmed COVID-19 cases in 2021 and 2022 were detected by community health workers. Our plan is gradually scaling up the community health workers program to all accessible states, regions, and districts. The One Health approach, which links human health, animal health, and environment, will be key to addressing also future challenges in humanitarian response to epidemics and pandemics, as well as humanitarian crises arising out of climate shocks. For humanitarian response to be effective, we need to engage communities, civil society organizations, religious leaders, women and youth groups, and the media. Often their voices are not heard. Often we design an intervention or a delivery model that are not culturally sensitive or context responsive. Our recent experience with the engagement of non-state actors in the last 3 years of the pandemic has been effective. The humanitarian actors have worked with communities and local NGOs to ensure access to this area. Impartiality is key to gain the trust of the communities. We need to bring together partners from across the humanitarian system to advocate for the survival, well-being, and dignity of people affected by crisis and for the safety and security of aid workers. Whenever and wherever people are in need, there are others who help them. The affected people themselves are always the first to respond when the disaster strikes together with their local authorities and a global community that supports them as they recover. Far from the spotlight and out of the headlines, they come together to ease suffering and bring hope to their communities. We therefore need to strengthen resiliency at community level and make sure that disaster risk reduction, and climate adaptation programs benefit the communities. The One Health approach was conceptualized as a global public health strategy that encourages interdisciplinary collaboration and communication on health at the human-animal environmental interface. If we invest more on One Health, we will protect the environment and our ecosystem, strengthen collaboration of multiple disciplines, working locally, nationally, and globally to attain optimal health of people, animals, and our environment. One Health issues have gained greatest traction in terms of climate change and its adverse effects on the health of humans, animals, and the environment. Climate change compromises the ecological and environmental integrity of living systems. Climate change is termed as threat multiplier in that it adversely affects infectious diseases, zoonosis, food security, food safety, and local, regional, and global responses to these threats. Aligning One Health with climate change could establish the environmental sector in One Health triangle. We should do more to support One Health involving the public health, veterinary, public health, and environmental sectors. The One Health approach is particularly relevant for food and water safety, nutrition, the control of zoonotic disease, pollution management, and combating antimicrobial resistance. If we neglect investing in One Health, we do it at our own peril. We have already seen what all these threats are posing to the economy and sustainable development of our country, like Somalia. Our aim is to reduce poverty by 2030. Nearly two-thirds of our population, 69%, currently live on less than $2 a day, not enough to cover their basic needs. 1.8 million children, which comprises 45% of children in the country, face acute severe malnutrition. These are not just numbers. These are our reminders that we may fail if we do not believe that we can be only as strong as our weakest links. The pandemic of COVID-19 has given us this stark lesson. What gives us hope is that the humanitarian response is changing. We are turning crisis into opportunities. We are talking about resiliency now more than being dependent on aid. Our humanitarian partners and donor agencies are also realizing that we need to build the institutions and support system building more, while we are also address the acute humanitarian need.
Dr. Ali, I think that we'll save that question for the end. Let me introduce our next panelist, His Excellency Mr. Sultan Al-Shamsi. He's the Assistant Minister of Foreign Affairs and International Cooperation for International Development Affairs for the United Arab Emirates. Welcome. You try again? Sound?
Hello?
There we go.
Okay. Well, I would like to thank you and for the organizing very important session. I would like to thank King Salman Center, Dr. Abdullah Rabi'a, for this important gathering. And it was really my pleasure to attend the third conference. I was in the first and the second. And I think it's really timely. As you've seen, this is the earthquake in Syria and Turkey. And even yesterday there was another earthquake. It's timely to come together and speak about how we can better respond and how we can shape the future of the humanitarian response. Thanks.
Okay, great. And representing the World Health Organization is Dr. Hanan Balki. She's the Assistant Director General for Antimicrobial Resistance and the Access to Medicines and Health Products Division. Welcome, Dr. Balki.
Thank you very much, Rebecca. I hope the voice is clear. Assalamu alaikum, everybody. It's a great pleasure and an honor to be in my hometown participating in this session, and I would like to extend my sincere appreciation to the Kingdom of Saudi Arabia and His Excellency Dr. Abdullah Rabi'a and IMC for organizing this specific session. I think you wanted a few words of introduction. I think from the WHO perspective, it becomes very important that as the Global Health Organization dealing with 194 member states in the middle of a pandemic and also facing tragedies, whether it's from climate change, man-made or natural-made disasters, compounding the challenges for access to healthcare and medicines. And I think this panel is going to be a great panel to emphasize on how are we going to move forward in the next years to come so that we are actually ready for the current challenges, whether, again, they are natural ones or man-made ones, and how are we going to be prepared, and I would like to touch on that maybe in the upcoming questions. So thank you again for having me on the panel, and looking forward to the discussion.
Great. And then next we have Dr. Valerie Bimo, the Deputy Director for the Global Development at the Bill and Melinda Gates Foundation. Thank you for joining us, Dr. Bimo, on your birthday. Happy birthday.
Happy birthday.
Thank you. Thank you, Rebecca, for this is a special day for me to be with all of you. How many of you had your birthday with so many people guests? Then I'm honored to be here today. And I'm also honored for the Kingdom of Saudi Arabia for inviting us and create this magnificent event and Cares Relief. I'll take the perspective of the philanthropy. As the Gates Foundation, we know we are one of the biggest philanthropy in the world, but we also know that the money is just a drop in the big ocean of the needs. And as a philanthropy, we see our funding as catalytic, as essential, because we, as a philanthropy private sector, we can take risk where others cannot. And we see the value of innovation, of bringing, and we saw it with COVID and other big crises where we can bring that. But we also have the power of our voice to bring partnership. Earlier, Ms. Honorable was mentioning how we have been partnering with the Saudi, with LLF, to create, we can bring together big government, we can bring together private sector, we can bring big academia to work on that. And COVID has shown us that we cannot do it alone, and we have to be together. And as one of African proverbs said, if you want to go fast, go alone, and if you want to go far, go together. And I think this, for me, is the big piece of how do we get to the COVID, and the impact of COVID will just affect all of us unless we get together. And that will be the first piece for me. Thank you.
Thank you, Dr. Bimo. And then we have Mrs. Adele Koder, UNICEF's Regional Director for the Middle East and North Africa.
Good
Welcome.
morning.
Good morning.
Rebecca, thank you very much. And I would like to start by sincerely thanking the Kingdom of Saudi Arabia and His Excellency Dr. Rabi'a for hosting this third Riyadh International Humanitarian Forum. For us as a child's agency in the Middle East and North Africa, we really find this topic of utmost relevance because this region has around 79 million people in need of humanitarian assistance, including 35 million children. This is a very young population in the region, and I think there are a number of elements that make it very relevant. The first is that this region really has probably the highest number of a humanitarian crisis that have lasted for a very long time. So we have conflicts that have been happening for so many years, whether it is the conflict or the situation of crisis in Yemen, in Syria, in other countries as well. That's a very important element. Second is that this region is very much prone to natural hazards. I think we all know about the earthquake that has been happening and is still continuing with the aftershocks. It's also a region prone to climate change and water scarcity, and water scarcity is linked to health outbreaks and to epidemics. It has also lived through very difficult COVID times that impacted the health systems, and Dr. Hanan spoke about that, and then also the economic deterioration that many countries in this region have been witnessing over the past, I would say, 2 years. So all these conditions and really make this topic that we are discussing today very relevant, because it is one emergency on top of the other. So I'm looking forward to the interesting discussion and to the distinguished panelists that are with us today. Thank you.
And finally, we have Mohammed Al-Thati, Senior Advisor to the President, Islamic Development Bank.
Well, Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Good morning, everybody. I would like to join my colleagues also in extending sincere thanks and appreciation to the Kingdom of Saudi Arabia and to KS Relief headed by His Excellency Dr. Abdullah and the team, and also thanks to IMC for organizing this session. Now, let me start by mentioning that the Islamic Development Bank, being a development institution, is really focusing on helping member countries for their development needs moving into the SDGs. However, the session and the timing is right because of the challenges facing many of our member countries of the ISDB, being LDMCs, least developed countries, or even fragile and conflict areas, without mentioning the countries. Having said that, let me just start by maybe kind of like a philosophical point. When we're talking about conflicts and fragility, yes, we're addressing physical conflicts like what's happening in Syria or Ukraine or Yemen and other countries also in Africa, etc., which is, we need to do something about it. But also equally important to highlight, there are also some philosophical and ideological conflicts. And I give two examples. The example of polio eradication in Pakistan, where the international community and also the Gates Foundation, WHO, the ISDB, they were willing to help, but there was some resistance from some areas about the vaccines. So this is something that has to be taken into consideration. Another example is what's happening currently in Afghanistan, and we're all sympathizing with Afghanistan, where everybody's trying to help, and we feel that women and children are really the major constituents in the country, yet we're seeing everybody trying to help. At the same time, there is resistance for female education and going back to work. These are also has to be taken really seriously to be addressed. At the same time, we're witnessing more fragility and more conflicts. The moment we finish from a financial crisis and we want to take some relief and try to go back into the development and getting into more growth and prosperity, we're being hit by another conflict. Most recently, the COVID pandemic, where I think this time uniquely, it's not only a region or a country or an area, it is the whole world that was hit by the COVID. Definitely, we all suffered. The whole world suffered. At the end of the day, yes, maybe there were some solutions, lessons learned, and even some, I would say, some benefits at the same time. But we cannot underestimate the damage that has been affected by the COVID pandemic on everything from health to education to livelihood to job creation or job losses, etc. Even we're witnessing countries that are, unfortunately, we're going into a kind of a positive growth in their GDPs, and now, unfortunately, they're going down. So now, being a development institution, although we focus more into the development and self-reliance of our member countries as an MDB, however, we cannot ignore, and His Excellency, my boss, Dr. Mohammed Al-Jasser, mentioned yesterday that although we're not a humanitarian assistant institution, we're more a development institution, but there is no way that you can isolate between what's happening in the member countries and the fragility areas, where we have to do some humanitarian assistance and bringing capacity. But at the end of the day, for an MDB like the ISDB is to move more into development, more into self-reliance, building capacity, bringing more prosperity, and going back into the development. So we are here to complement whatever the humanitarian organization, UN, NGOs, etc., by helping them right now. But honestly, our intention in our member countries and the conflict areas is to move more into sustainability, development, prevention of all of these shocks and all of that. So let me stop here, and hopefully later on maybe we can address some specific questions. Thank you very much.
Okay. Thank you, everyone. Now I think we'd like to kind of dive into the topic and talk about how pandemic and other disease outbreaks continue to impact communities. And Dr. Ali, you talked a little bit about the Somali government's focus on building resilience at the community level. Maybe you could talk a little bit about some of those strategies and what it looks like at the community level in Somalia.
Community
What are some of the things that the Somalia government is doing to help build resilience at the community level?
Yes, community level. Now the government of Somalia is struggling to also relieve the acute humanitarian emergencies, while also trying to develop and sustain development and resilience system. And we made example the program of community health worker, which is high impact intervention, and was implemented as measure 42.7% of all confirmed COVID-19 cases in 2021 were detected by community health workers. So we implemented also public health emergency operation centers that will be responsible for surveillance all over the country. We also implemented frontline field epidemiology training program to equip frontline health workers with outbreak surveillance and response knowledge and skills. We also implemented integrated disease surveillance and response strategy that aiming at integrating multiple disease surveillance systems into single multi-disease surveillance system. So we are trying to build the health infrastructure and health system in Somalia. We experienced collapse of government systems for more than 3 decades,
Right.
30 years. So now we are trying to reestablish government institutions, especially health system infrastructure, and strengthen it. We are facing more challenges, conflicts, buffers, recurrent droughts, multiple disease outbreaks. We are facing multiple challenges. And above that, we are facing war against terrorist Al-Shabaab. Now, many areas that liberated from the terror group did not get any access to health service or humanitarian aid for more than 15 years.
Right.
So now we need to establish the mother and child health centers to to get service delivery for mothers and infant. Somalia, as we know, is the highest number of maternal death and infant death in the world.
Right.
Is in Somalia. So, large area we liberated from the terrorist Al-Shabaab did not get any access to health service for more than 15 years. So the government now, beside the humanitarian aid, the government is trying to build hospitals, to build mother and child health centers, to build the health institutions. A lot of hospitals that was functional before 1990 now still are not functioning. Large hospitals in the city, Mogadishu, that was referral hospitals before the collapse of the government in 1991, still are not functioning. So we are struggling in one side to fight against Al-Shabaab, struggling on the other side to fight the recurrent droughts and pandemics, fighting on the other side to build the infrastructure of the government, especially health infrastructure.
Right.
So our people now, 69% live on less than $2 per day, which is not enough to cover their basic needs.
Right.
1.8 million children, which comprises 45% of children in the country, face acute severe malnutrition. These are not just the numbers, these are our reminders that we may fail if we do not believe that we can be only as strong as our weakest links.
Right, right.
Yes.
Well, the specific challenges that Somalia face are mirrored in a lot of countries in the MENA region. Mrs. Kodor, as we broaden that scope a bit and talk about some of the countries in the Middle East that are experiencing conflict, why don't you share a little bit about the impact, particularly on children and families?
Thank you. I think maybe I would like to talk about four really areas of impact that we see. I think the first one is, of course, on the physical health of populations, especially children, because usually they are the most vulnerable, but also on the mental health of the people and the children. And yesterday, actually, I was talking with Dr. Mandari, my colleague, the WHO regional director, and we were saying that, and even our colleagues who are now on the ground, supporting the earthquake response, about how important it is to deal with mental health issues that can leave an impact on the population, and especially on children for a very long time. So I believe this is the first challenge. Maybe the second one, of course, is the burden of increased disease and mortality, which is a result of the conflicts, it's a result of the epidemic and of any humanitarian crisis. And the third one, of course, is the overburden on the health systems, because many of these countries that are experiencing the epidemics, and we saw that with COVID, that they were already suffering from weak health systems. And then the COVID crisis came, and now we have the earthquake. So it's one emergency on top of the other that is weakening the health system. And the fourth and last one probably is that we also have to think about the health service providers. And I think the earthquake that happened recently reminded us that the people who are usually the first responders have themselves been affected by the earthquake, and they had to care for themselves before they are able to care for the others. And I think this is something we were also talking with a colleague, with Wafa from IMC this morning, about how much our colleagues who are in the field are also traumatized. They are there to support the others, but at the same time they find themselves traumatized. So the impact and the challenges on the health are really, and the health systems are really huge.
Mm. Well, Mr. Al-Shamsi, as a government leader, maybe you could talk a little bit about how the UAE responded to the COVID pandemic at home, but also how the UAE played a critical role in providing support to communities around the world. Maybe you could talk a little bit about that.
Well, thank you very much for this question. First of all, I would like to thank all the humanitarian and health workers on the ground and for the action they provide, plus coming together with different instruments to support. UAE was really, have the early warning system, and we've been following up all the cases during the pandemic since December 2019. And already we have the system in UAE. Yes, we learn a lot. It's very important to build on this experience what we have got actually in UAE. On all the testing center, the vaccination programs being made that during the time. It was really important how we can also support other countries. Our support really comes with different elements. So one, working with the WHO as a leading organization in health. Also another working with the multi-donors funds like the Gavi and COVAX facility. Global Fund also came and also they allocate 5% to the allocation to support the pandemic response. But also in addition of that, the UAE has a really good infrastructure of the logistics, because during the pandemic, one of the difficulties was the lockdown and also everything is being closed. The airports, ports, airlines was really closed. All the markets was closed. UAE has the biggest humanitarian hub in the world as a humanitarian relief, but also we are responded to the many countries providing the PPEs, ventilators, vaccines later on. So we managed to provide assistance to 140 countries, sending thousands of tons. We daily, during that time, have around 2 to 3 flights a day to the countries. But the most important, I think, how we can really be better prepared. I think we get the experience during the pandemic COVID-19, and we have to work more on this system is being built. We invested a lot now on the health system in different countries, like building mobile hospitals or strengthening the capacity of the health workers on the grounds. But also very important to be how they eradicate some diseases, because we've been glad to work with a number of organizations like Gates Foundation to eradicate the polio in Afghanistan and Pakistan. We managed to give vaccination more than 80 million children, around 600,000 doses to vaccination. So at least we have a future generation with no polio in the future. But the most important, how we can eradicate, how we can be much prepared for the response, and to avoid any eruption on the supply chains. The private sector, I think they has get a good experience during the pandemic. They need to expand in the countries. They have to invest in these experience on the also development countries. We have a good middle-income countries and low-income countries. I think they're really open for the private sector investment on the health, whether manufacturing, the PPEs or vaccination, and also management of the health facilities there. So I think this that we can bring donor, recipient countries plus private sector with the international organization to work together.
Right. It takes us all, right? We all have to be involved. And I mean, these are all kind of challenges that have been related to the COVID pandemic, but of course, cholera and Ebola and other disease outbreaks are continuing to challenge conflict-affected communities. Maybe Dr. Bimo, you could talk a little bit about some of the challenges that response agencies are facing, and what are some of the strategies that we can implement to adapt to these challenges? Dr. Bimo.
Okay.
Thank you. Yes, there's a lot of challenges, but I also see it as an opportunity.
Right.
COVID-19 shows us that the world acted individually without solidarity as independent, and we can't do that. We have seen a world where we increasingly be connected to each other, interconnected, and we are a global world. We know that one person in Africa impacted can impact somebody in China or elsewhere. And I think one of the things that we really realize as we look at the world, at the global entity, there's no real mechanisms to come together and to have the leaders talking to each other in the terms of pandemic preparedness. And one of the things that the WHO have been leading, especially at the Geneva, I'm glad that I have the assistant director to lead in the way, like, how do we work as a solidarity? How do we create a pandemic preparedness, a pandemic corps to look at the world in the next one? We know that the next pandemic probably will not wait for 100 years. It will probably sooner than that. We also know that in the way we were lucky to have a pandemic, COVID, who just had less than 1% case fatality rate. And we are not sure that the next one will have a so low fatality rate. That means that we may have a big disaster. If, as a world, we can come together, having our leaders talk to each other, creating a force that can work together, that can exercise together, plan together, actually will solve a big issue to serve not just as a pandemic, but we know the pandemic starts with outbreak, an outbreak that go beyond borders, transnational, regional, and global. How do we start really thinking about that, including strengthening each country health system? If one country is strong and the other one are not, will not be solving the pandemic.
Right.
Then and I'm glad to hear from, for example, Somalia, from Somalia to UAE, where you have Somalia who's going with a lot of crisis, but strengthen their system, or UAE will demonstrate that they can also have in a country who have a diversity of people coming, but able to capture well the COVID. What do we learn from this sector, from this system? And I think we have a lot to do as a world, but we can do it together again. Thank you.
Right. Well, Dr. Balki, I mean, as the Assistant Director General of WHO's Division on Antimicrobial Resistance and Access to Medicine, I mean, tell us a little bit about WHO's response to emergencies. I mean, WHO has been tested quite a lot over the past several years.
Thank you very much. Maybe I'll definitely address what you just mentioned, but maybe touch on a few other issues that were mentioned by the colleagues. So the WHO, as I mentioned, as the global health organization dealing with 194 countries, not only that, but we work through a very complex structure of 7 major offices and over 150 country offices. And that type of engagement with our member states puts us in a very strategic situation where we can deal and manage with the multilateralism that is extremely critical for moving forward at the country level. But there's also bits and pieces of the work that we do that are a huge part of our work, which is the normative work that we do. So I'm going to talk about maybe just a few tracks that may not be visible to the regular audience. The first part is the importance in pandemics. You're talking about pathogens that have different, as our colleague Bimo said, Dr. Bimo, the different pathogenesis, different impact, different mortality rate, different transmissibility rate. So once a pathogen pops up as a cause of an epidemic or an outbreak, there has to be very quick identification of all of the characteristics of this specific pathogen. And that needs to be done in cooperation with the people on the ground in the countries, through their surveillance systems, through their diagnostic systems. And that's why it's very important that the work that is done at the country level is patient-centered, so that the countries themselves have their fingers on the pulse on what is happening at the country level. They know what are the pathogens that are circulating in their communities and what are the new ones that are emerging. So WHO encourages very much and works with member states to strengthen the surveillance and diagnostic systems, and that's very crucial to our success. Number two is understanding the epidemiology as it's in its active phase. So without the surveillance and the networks that we're working through to understand the epidemiology of the COVID-19 virus, we would not have been able to identify the whole genome sequencing. We would not have been identifying, I'm not saying us as WHO, but the research and development entities, the scientists, the R&D, they would not have been able to develop very quickly an effective vaccine. We would not have been able to develop very quickly therapeutics and diagnostics. So part of our work is to ensure that that mechanism continues to move forward in a very robust fashion. The second, and this is just, I'm just touching on the issue of data and surveillance. The second part is the work, the interagency health emergency work that we do with many other partners. And Mr. Shamasi mentioned His Excellency on the work in delivering these kits to the countries. These kits that are developed through multilateral agencies serve each kit, we're talking about not a small kit, we're talking about huge containers, serves 10,000 individuals for 3 months. And over the past several weeks, I think through the hub in Dubai and others, there was at least 185 metric tons of goods delivered to the different countries, and some are even landing on the ground now. Now, those kits have to have the necessary medical equipment and medications that are relevant to the specific outbreaks and for the initial response to health challenges in the context of disasters, whether it's natural or man-made. Now, within those kits, one of the major roles of WHO is to ensure the regulatory processes are in place and that what is in those kits are actually of quality and they're regulated and they've went through specific pre-qualification. This is a very also complex work that the WHO does. And maybe we will talk about it a little bit later, I think, in this session. The third part that I wanted to talk about is, again, another normative part is the guidelines. Once an outbreak happens, as we saw in COVID, and a vaccine came out, what's the dose? How frequent? When do we give the second one? Who should be excluded from the vaccines? New medications came on the market, the same thing, the guidelines. What's the dose? How frequent? Pregnant women get it or not? Children get it or not? All of those guidelines are developed by the WHO through our technical expertise networks. But not only that, we've tried to be even more efficient in developing what is known as living guidelines, so that the impact of the science can reach the communities in a much faster way. So these living guidelines are present on our websites, where they are updated in the same time as the science is being developed. And I think just with also Dr. Bimo mentioned the issue of the pandemic and our preparedness. So I want to say a few words on the new architectures that are being developed. At the beginning of the pandemic, there was huge assessment of the response, whether the WHO, of course, as the center of global health, but I think also we've received over 300 recommendations directed towards WHO, but also directed towards the multilateral organizations, towards the governments, towards, if you want to put it in the right context, the global community that needs to work together in responding to a pandemic. These 300 recommendations have led to a huge ripple effect. One of them was to revise the international health regulations, which is taking place right now, because the IHR, as many of you know it, is really to address the issue of trade and crossing borders, and that's one big challenge in such situations. The second one is, which was led by the Director General through our member state governing body meetings, is establishment of a pandemic accord or a pandemic treaty. And the member states, through our governing bodies, had made that pandemic accord a binding treaty, and that is extremely critical. It is now time for the member states to be at the table while this is being crafted, while this is being written, to put their voices in. The WHO is the organization that has equal voice to all of its 194 member states. at the table, crafting, writing, writing down the pandemic accord, and this is happening over the next year or so. And within that pandemic accord, the binding part is in talking about intellectual property, talking about crossing borders, talking about sharing information, talking about royalties. It's going to affect all countries of all economic levels. So the IHR, the Pandemic Treaty or the Pandemic Accord, and the third one that is also led by the WHO through the recommendations that came out is the Health Emergencies Pandemic Response Architecture. Many of the people at on the panel today were part of the ACTA Accelerator, or Access to COVID Tools Accelerator, and we became a big family working together. But that was really more of a functional or a gentleman's agreement among the organizations to expedite the communication on what needs to be done during the pandemic. That will not be sustained forever, and now we need to look at how are we as the multilateral organizations, how are we going to work together? How are we going to work with science, and how are we going to work with our member states so that the current outbreaks and the future pandemics will be addressed in a more equitable, effective, and fast method? And I think at the heart of all of this is strengthening the healthcare systems for the resilience. I'll leave some of my other comments maybe for later, so thank you.
That's great. Well, I'm going to go off script a little bit, Mr. Assalte, and ask you, we've been talking a lot about preparedness and health system strengthening, and as a funder of government and everything, how are you prioritizing preparedness and health system strengthening efforts in the bank?
Okay, thank you. Now, when it comes to the issue of addressing COVID and also other, first, the knowledge of the countries is very important, and again, it's always, you have to be always prepared and all of that. Now, addressing the issue of COVID, the Islamic Development Bank, what we have done is immediately we have developed a program, we call it SPRP, the Strategic Preparedness and Response Program. It was initially starting at $2.4 billion US dollars. Although we don't want to say that we were trying to address the issue of vaccines and all of that, because this is more specialized to the health organization. But what we tried to do is to look into country by country. Okay, now they have shifted their priorities. So some of their developmental programs, now they have moved into health and all of that. Here is where we come in. We try to fill the gap in other social sector, basic needs like education, creation of jobs, agriculture, development, etc., etc. And also we looked into this issue about trade, this issue about food supplies, which are important. Yes, health is very, very important. However, we try to address the other needs because unfortunately, yes, there are some well-off countries that are managing, but even middle-income countries and even low-income countries, they were really hit hard. And the issue that whatever progress we achieved in fighting poverty or bringing little progress, it has gone down, so we try to fill in the gap. Also, another thing what we did, which is I think Dr. Hanan mentioned, this issue about coordination and again data sharing and all of that. You cannot work alone, and I think this has been said also. So we have been working with partners and all of that. I give an example where we have looked into the COVID response with our colleagues in the Arab Coordination Group. These are the Arab financial institutions, including Saudi Fund for Development, Abu Dhabi Fund, Kuwait Fund, Qatar Fund, Arab Fund, OPEC Fund, even Badia in Sudan, Arab Monetary Fund, AG Fund, including also the ISDB. So what we did is we came up with a quick program of $10 billion together to address the issue of the COVID and how we can help the member countries addressing their needs in whether it comes to social services, infrastructure, etc. And I'm very proud to mention that we have exceeded that target by we reached even about the $15 or $16 billion. From the ISDB also, it was started with 2.4, but then we got into trade, we got into insurance, we got into private sector, helping creation of jobs, SMEs, etc., etc. That way we can complement the health work that is going there, and we have increased our intervention to more than 4.5 billion in there. So these are some varieties that we have been trying to do Of course, you cannot do it alone. You have to talk to the MDBs, the IFIs, NGOs, private sector, again, to re-inject hope, re-inject some of the developmental needs in these member countries and helping them at least they're coping with the health situation, etc. Also, just one last note, which is we have to look into the issue of fairness and accessibility to health services or vaccines, because all of us, we have witnessed, I'm sure the whole international community, they were wholeheartedly working for helping member countries. But we have seen and we have received complaints from some of the least developed member countries that the issue of the delivery of the vaccines or the health services were slowed because of either it could be accessibility, it could be financial situation, whereas some of the, I would say, the high-income countries and middle-income countries, they get it. So we really have to work as an international community to address this issue about fairness, accessibility, being prepared, etc., etc., etc. So I just end by saying in that part that yes, aside that we're addressing the health issue, but you cannot ignore the other thing to help the countries, otherwise they will go into total collapse. So we have to maintain the education system, we have to maintain livelihood, we have to maintain job creation, or at least protection of jobs, little economics, socio-economic, etc., etc. And we're continuing to coordinate with our family of the MDBs, IFIs, and also the countries and the other partners.
Right. That's great. We've touched on all of the impacts of conflict and climate change, and then disease outbreaks. I mean, Dr. Ali, I mean, as we think about the future of humanitarian response, what do governments need to do to effectively prepare for that triple threat: pandemics, climate change, and conflict?
Thank you. And as a government, and the fact that we have now, we are talking as a colleague from Islamic Development Bank, talking about, we wanted to talk about resilience more than acute humanitarian aid only. We hope that our humanitarian partners and donor agencies, we want to realize that we need build institutions and support system building more, while we also address acute humanitarian need. The need for supporting humanitarian development and peace nexus in a country like Somalia cannot be overemphasized. One thing is clear: we cannot win the war against ill health, hunger, poverty, while we are neglecting health, food, nutrition, water, and environment. So we need to build resilient health national institutions. We need to localize capacity and not substitute. We should be guided by science and evidence and the spirit of solidarity, partnerships, collaboration, and coordination led by the government. We must be hopeful and not hopeless, moving forward with targeted approach to serve the acute humanitarian need, but also build resilient institutions so that countries like Somalia can face similar crises like this on its own. Our donors should support us with funds that are flexible but have futuristic eye on inclusivity and sustainability. So what we need is fragile countries like Somalia facing many crises: war, drought, pandemic, diseases, lack of enough infrastructure. We wanted to, most of the countries wanted to fight emergent and emergent infectious diseases that crossing the borders in order not to reach them. Mm-hmm. But also, we wanted to support the fragile countries to build their institutions, right, rather than focusing humanitarian aid only.
Right.
Yes.
Right. A dual strategy.
We also want that government should lead and prioritize the needs and the humanitarian aid also. Yes,
Right.
thank you.
Right. You know what your people need, and you need that dual strategy, both strengthening the health system as well as providing the humanitarian assistance. Yeah. Mr. Al-Shamsi, the UAE is hosting COP28 this year, demonstrating the role that governments like yours have to play in identifying solutions to challenges such as climate change. I'd love for you to add your perspective. Can you speak a bit about the role of diplomacy and policy in shaping the future of humanitarian response? And what policy actions should we explore?
Well, thank you very much.
I mean, that's a big question. Sorry.
Well, I think it's really interconnected. The diplomacy and the policy and humanitarian action. And yes, we need diplomacy, especially now when we speak about the Syria earthquake. We need diplomacy about increase the cross-border operation and cross-line operation. Just yesterday when we saw another earthquake, so we have to activate, yes, it's backed by the UN resolution, but also we have to activate as much as we can the cross-line, cross-border operation. We use all the access. We have to increase the access. So we need the diplomacy on that. We need diplomacy also on the how we come together, how we coordination and collaborate together. It's very important. And we saw actually a big institute and organization playing an important role, like the African Union or Arab Leagues. The conflicts now, I think, is very important also to have like is African talk, to have that. So you need the diplomacy, whether on the DRC, whether on the South Sudan or others. Plus, we need policies also about the allocation, how much we disperse on the humanitarian development. We saw actually many donor countries, they are spending more than 80% of the development, which does really make sense. Around 15% just focus on humanitarian response. But seems now, I think, there is a miss of the early recovery. So we need a policy about how also we fill the gap and avoid any implication after remitting response. Now, actually, on the natural crisis or the man-made crisis, I think we have to work as much as we can on the early recovery to avoid any humanitarian. We need diplomacy also on the assurance of respecting the IHL on the ground. They have to respect the IHL on the ground. We saw actually as good now coordination of the civil military coordination on the ground. We need also diplomacy to back that. We have to have, because in the end, we have to reach the people in the end. We have to have more access. So I think we need to also have more diplomacy and policy also backed up. The pandemic, the COVID-19 pandemic, I think we did a lot. We have to also develop our new policy, how we can much prepare, how we can really respond together. With all the stakeholders we have, we need also policies really guiding and backed all this assistance. Finally, I think always on our response, especially UAE, and our health response to women is also on the center, and the children as well. So how we can engage women is not about only responding to crisis to the women, but also how engage them on the decision makings, how to design the programs, how they can implement. So they have to have a voice on this one, also an accountability. So this is actually a cycle that we have. They have to be in designing and implementation as women. We have really engaged many actually women on our programs. We have programs when it comes to the climate change, and UAE hosting the COP28 at the end of this year by November. We have really invested on the small and island states on the Pacific and Caribbean. We allocated $50 million there and another $50 million actually on the Caribbean. These islands really so fragile. We have to find a sustainable solution for them. In addition of that, we engage more women to manage these programs on the ground. That is, women has to be in the heart. What's happening now in Afghanistan is not really open the education for women, also or work actually on the organizations. I think we are missing a big opportunity if not really giving any education for the girls and and during this time.
Right. I mean, you make a really good point about putting, the affected people at the center of the response. I mean, maybe Mrs. Kodor, you could talk a little bit about the ways that UNICEF does that. And then Valerie, perhaps you, Dr. Bimo, you could follow up with some just overview of how humanitarian entities should put conflict-affected and communities at the center of their response. You want to start, Mrs. Kodor?
Thank you very much. And Rebecca, I think for UNICEF, of course, the issue of the localization of the response is something to which we have adhered long time ago, because it came in the World Humanitarian Summit and then in the Grand Bargain commitments. And in fact, in all our humanitarian action, we have something called the account the affected populations. I think Mr. Shamsi spoke about it, and which is really at the heart of what we do. And even inside our own audits, when we get an audit or a review of our humanitarian action, one of the things against which we are assessed internally as an organization is the issue of the accountability to the affected population. Now, concretely, what does it really mean? I think the first thing is that we work through the local leadership and through the existent systems rather than replacing them. So it is our priority all the time to see what already exists on the ground and see how to strengthen it rather than how to replace it or create a parallel system. I think that's the first point. The second is about also respecting the local partners' capacity. And I think that it was talked about that we don't look at our partners on the ground, and specifically the NGOs, as implementing partners. Actually, we are not calling them anymore implementing partners. We are just calling them partners because they have a say in how the work is done. The third is the issue of looking at multi-year and long-term partnerships. And this means that we are looking also at not doing something which is very quick and which will go with the end of that quick delivery of the service. So how can we invest in something that will stay beyond the emergency is something important, because we will be strengthening the systems that already exist in place. And in fact, in our preparedness activities, I mean, myself, I know that even ahead of a humanitarian crisis or in anticipation, and I think yesterday there was one panel on anticipatory action, one of the actions that we do is to see, okay, with the local partners, what are their needs for preparedness? So increasing the preparedness capacity of the partners that are on the ground is something which is also very critical. For example, I know in Ethiopia, where I was working, we had a big partnership with the Ethiopian Red Cross, to be able to make sure that they have the capacity in a number of centers to do pre-positioning of supplies, to do capacity building for their staff. So all these are really issues about the accountability for the affected population. And I would like to mention as well the issue of the prevention of sexual exploitation and abuse. Many people look at it as something which is separate than accountability to affected population, but I think it is part and parcel of that. And this is something that has to do with reputational risk and accountability to the people that we are supposed to be serving, especially the children and women, to be able to protect them. Because most of the time we focus a lot on service delivery, but we forget protection issues. Mm-hmm. And for me, protection is a critical part of the accountability to affected populations.
That's right. Dr. Bimo?
So much. I think the first things I always remind us is that the local people who are there before the crisis, during the crisis, and after the crisis. And they know better what they need, and they know better what is necessary. I think that is the first principle. The second principle is that these people affected by different humanitarian crises are just at the wrong place at the wrong time, but they all have dream, hope, like all of us. And we should go there knowing that they are human beings that actually need support, but they are not lost their dignity. I think that is the principle for us to go together, is the first thing. As we think about localization, we saw with COVID-19 that the more we get closer to the community, the better we act really rapidly. And if we cannot bring them together at the beginning, then we struggle. We saw how it was difficult, the misinformation, the disinformation. We have to look at the community to have the solution themselves. And the other piece, when we talk about local partnership, we tend to see local NGO government. But you have to look at the whole stakeholder because they all are part of the solution. The private sector, they will be affected themselves or have solution. The media, we know how critical media at local level is important. The academy for the research, the innovation, the government themselves are really essential. And I think unless we start really thinking about that, we will not be able to overcome the gap in the humanitarian sector is so big, we cannot cope everything. Then the people have resources. How can we harness that resources, that local knowledge? Because then we can have the best response. And actually they will be at the front center of the response, and they will be dictate what is their need. And I think with COVID, with the different crises, it was difficult for people to move from border to border, from places to places. And rapidly, we realized as the world that each community have to deal with themselves. Then how do we learn from that and anticipate that strengthening this community will be essential on how we can have a better world? Thank you.
Right. Well, very specifically, Dr. Balki, I mean, we have the priority to strengthen health systems locally and to put affected populations at the center of our work. But what happens when there is no access to medicines? How does WHO step in and help with that?
Thank you very much. Again, this is a very important question. You're talking perhaps about several solutions when there is lack of access. And I think we also need to work ahead and think ahead of time. How do we ease that for the future? So I think there could be different scenarios. One of the scenarios would be about talking about stockpiling. And I think stockpiles are very important when they're available for specific known diseases, stockpiling within a specific country, because that specific country is known to have certain pathogens that continuously emerge. Yellow fever would be a good example. Ebola would be a good example. Then you have stockpiling within regions, like what is being done for the influenza, potential influenza outbreaks or epidemics or pandemics. They could be regional ones. But we have to remember that this part of improving access also requires a lot of country preparedness for them to make sure that they have the stores available, that they're able to move the medications, vaccines, or diagnostics around within their stores, that they do not go through expiration dates. And if they are regional stockpiling, that it's very important that first of all, that what is being stockpiled has underwent regulatory and pre-qualification in the specific countries that are going to be using them. One of the things that we are doing a lot of work on at WHO is how, and I'm moving from the access part to a critical piece that facilitates access, and that's regulatory. So the regulatory authorities within the countries, we're working very hard, and this is again maybe a bit of the invisible work that we do to the majority of the audience probably, but it's very critical that the regulatory authorities within the member states are strengthened. So when we talk about health systems strengthening, a big piece of that is strengthening the regulatory authorities so that they can allow for specific medications, doing the pre-qualification, putting the medications, vaccines, and medical equipment on their formularies, that they have regulatory focal points, which we work with very closely, because the risk here is that if you do not have that in place, then the communities will start accessing falsified and substandard medications. And with His Excellency, the Minister from Somalia, and when you were talking about antimicrobial resistance, I'll use that important example. In communities that do not have access to effective and quality antibiotics, they will eventually go to substandard or falsified antibiotics. And in using less qualified antimicrobial agents, the risk of resistance becomes higher. Another good example, if the pain medications are not regulated in a specific country, then specific communities will not have access to pain control. They will obviously require healthcare, surgery, and then they will be facing less effective treatment and less fair treatment. So I think when we talk about access, the regulatory piece becomes very important. The coordination becomes very important. Understanding what access are we talking about? Is it in the peacetime or is it in the pandemic and wartime? So there's a lot to be said about that, but I wanted to emphasize the stockpiling processes, creating the resilient regulatory and oversight, and also ensuring that there is a mechanism to ensure that the stockpiling and the access are for effective. And then the last point, which is the equity allocation. I think we had a great example during the pandemic on allocation of the COVID vaccine. And in a way, it did not move as fast as we wanted it to. It did not move as equitable as we wanted it to. But the WHO was core and prepared with the partners the allocation framework. And with that, the allocation framework was to ensure that there is access to the COVID vaccine to the most critical, the elderly and the healthcare providers, because healthcare systems needed to be sustained. And it was about to provide 20% of the produced vaccine, so that the produced vaccine will cover 20% of those critical entities in 194 countries. I think that's a live lesson that we need to go back to the table and understand how did that work or did it not work and why. That will require maybe, Becky, another session to talk about, but I wanted to touch on it here because it's extremely important for access.
Yeah, thank you. Thank you. Okay, well, we have about 7 minutes left, and I think I'll ask each panelist to give us a sense. I mean, we've talked a lot about the challenges, but there's a lot of positive things that are happening, and maybe, Mr. Alsati, you could start with sort of what gives you hope for the future of our world, I guess, more broadly.
Good. Thank you very much. I think this is very important. Now, of course, with every challenge, there is always hope. Let me start by saying that, yes, we are over with COVID. We learned a lot, but the story did not stop there because one, if not among the few, now we have to deal with food security. Now, when you're looking at food security, it's a challenge for us. So here we have to look into mechanisms of increasing productivity, agricultural productivity, different crops, different mechanisms, and the sort of thing. I will not take too much time in there. And if you're talking about food security, it's just only about the food. It talks about education, bringing children healthy too, okay? So this food security issue is very, very challenging. And by the way, similar to the COVID, we have gone into a program with the Arab Coordination Group, again, of a $10 billion addressing food security in 3 stages. Quick wins, then going back into productivity, etc., etc. Now, another challenge which you mentioned, Rebecca, which is climate change. And of course, by the way, I'm not an expert in this area, but if we're talking about climate change, it's everything. It's about famine, it's about desertification, it's about lack of water, it's about lack of food, you name it. Even these natural disasters, they're all linked to the climate change issue. So what we did during the COP27 in Sharm el-Sheikh recently, the bank has announced a program of about $13 billion to address the issue about climate change, adaptation, etc. And we have set a target for us that by 2025, our projects, 35% has to be green finance. And this is challenging, but we have reached almost 33% between now. With the Arab Coordination Group, again, by the way, I speak highly about the Arab Coordination Group. One of the most successful partnership, of course, our work with our colleagues in the IFIs, MDBs, and all of that, but we value the relationship with the Arab Coordination Group. We put a target of 24 billion between now and 2030 to address the issues of climate change, activities, etc., etc. Now, with this challenge, there is always hope that you can bring solution, you have commitment, you change even yourself. So I would say that it's a three-part: internal, at the country level, at the global level. Internally, we as an MDB, ISTB, and others, we have to develop the policies, we have to prepare the plans for addressing another crisis on after. So this issue of fragility, resilience has to be there. At the country level, you have to develop policies, we have to help the countries, and also this issue about capacity building. It's very, very important. I give two quick examples. We have an anti-blindness program in Africa, where we have volunteer doctors go help countries, and we did many cataract operations, as I mentioned to you yesterday. We don't leave. We do the operations, which cost a little, $24 or something, but capacity building, we train the doctors and the nurses and all of that to take the job over. In Yemen, I give this example frequently. At one time, unfortunately, the situation there, money was not a problem in Yemen as far as development. It was the issue of capacity. It was the issue of the absorptive capacity, the implementation, etc. So this is at the country level, we have to develop policy. Finally, at the global level, we have to work together. We have to develop plans, coordination mechanism, and platforms. By the way, we go to a country, I don't know what the others are doing on the ground, and we'll be hitting each other in the corridors. Right. So this issue about coordination, making sure that we have plans, complementarity, the funding challenges is really huge. So if we don't coordinate and work together and do more comprehensive outlook and all of that, I think we fail ourselves and we fail our member countries.
Right.
Thank you.
Well, Mr. Al-Shamsi, what about you? What gives you hope for the future?
We have a lot of challenges, really. We start with a crisis to find another crisis, but I think always we see all the crises now on very important for the political leaders, and always the humanitarian agenda on the table, which is really is important. Yes, we need more funding, we need more action, but we see officials going to the crisis. Our foreign minister went to Syria to see the damages by the earthquake, then also to Turkey. We allocated money to these crises, plus also we sending flights, 8 flights a day to Syria, and we continue to our bridge. Also, as we see it, also a hope. We see the more countries really move to the more flexible funding. They are using different instruments like SERF or the Emergency Response Fund. So I think we need also more like flexible funding, at least for the first to respond. Then, of course, until they launch the whatever appeal for the crisis. Also, we see at the international level, yes, the RC system has been introduced just a couple of years ago. We see difficulties, but I see it's improvement. It's giving more independence for the RC and humanitarian coordinator on the ground. We see movement from the organization move to more on the field, not to the headquarters whether in New York or Geneva. We see more on the grounds. This is really very important. And also what we see it also, the big issues that really tackles the climate change, the technology has been introduced. It's not really, you can't, like it's identified as the one goal of the SDGs. It's really more cross-cutting issues. The climate, the technology, the women, it's really more cross-cutting issues that we have to tackle. Somalia is really real climate change. You will see South Sudan, Sahel area, Areas being liberated from Shabab group, whether Harshabili or West Somalia, is very important to immediately to start the stabilization programs.
Right.
What we have done actually, and areas being liberated by Daesh, immediately we start the stabilization. The mechanism is already there. Now is really implementing on the Lake Chad and also on the areas like is liberated from Shabab group. So I think there is a system now really very advanced, and this is what we really to invest more.
Great. Okay. Well, quickly, Dr. Ali, we'll go to you, then Dr. Balki, and then to Mrs. Coder and Dr. Bimo. Really quick.
Thank you. I have talked that 8 million of Somali population now are in need of humanitarian aid. I have talked that climate changes and 5 consecutive failed rainy seasons of drought caused more than 1 million of internal displaced people. And I have talked that 2/3 of Somali people are less than $2 per day, live by less than $2 per day, which means 69% of Somali population are under line of poverty. We hope in the future, and we aim to reduce the poverty by 2030. We hope, although we are struggling war against the terrorists, also we are at the forefront fighting against the drought, climate change, pandemics, recurrent outbreaks, and at the same time we hope now to focus to build resilient system rather than dependent of acute humanitarian aid. We hope our partners and donor agencies to support us to build resilient national health institutions, to focus and national and development system. We hope that not to be dependent only to humanitarian aid, but we need to build institutions, support system building, and also we wanted to fight against the ill health, hunger, poverty, and not neglect health, food, nutrition, water, and environment. So we are inspiring better future, although challenges are more, and we are inspiring for better future, and we hope to overcome all these challenges by the support of our friends, donor agencies, and humanitarian support and aid. Thank you.
Thank you. Dr. Balki?
Thank you very much. As a closing, I think I wanted to reflect on my career that was around now 25 years, and I'm an infectious disease person, so I've always been in the front line when I was in Saudi practicing on outbreaks and MERS and SARS and H1N1 and all those good ones. And I think every time we kind of go through an amnesia. And I think this pandemic, the fact that it affected the whole globe and the fact that it was not an influenza pandemic, it was a novel virus, it really pushed us all to work together. And I think that's probably the positive thing in this collaboration, in the multilateralism, in putting the pandemic treaty on the table and looking at the HEPR. I think all of these are positive things. The question is, how much of this pandemic will we learn from, and how much of it will we really put forward the necessary pieces to prepare us for the future? What I do hope for in your question on in the future is, how are we going to continue to engage the political leaders? As Mr. Shamsi said, I think that's crucial, but not just the political leader, the financial leaders, to ensure that the investment in health and resilience continues to move forward. And I think the other thing that we need to focus on a lot, and I'm hoping for, is the issue of equity and dissociating the situation of an individual, whether they are in a specific community, but regardless of where they are, regardless of who they are, that they are able to access healthcare systems, and the tools needed to keep them healthy.
Thank you. Mrs. Koder?
Yes, thank you very much. I think a lot was said, and I will just maybe highlight two points. I think the first one is the need to have global solutions for these global problems. And I think we are really inspired by the fact that there is so much, I think, solidarity from the international community in dealing with these problems. But maybe 2 points that I would like to say. I think first, there are many crises in the world that don't make it anymore to the media.
Right.
And that doesn't mean that they are over. And I think we have a lot of them in the region of the Middle East and North Africa. And the second point, and with all appreciation, I think, for all our partners that are really supporting us in our work, and I think this is what the High Commissioner yesterday spoke about, Filippo, the issue of flexible funding, because it enables us, when it is at the beginning of the crisis, to immediately be able to respond and to avoid many problems that could even increase further in the future and cost more to be able to solve them. So I would say those 2 points, and maybe the last one is the one about really political action to end a lot of these crises that
Right.
are intertwined. Thank
Right.
you.
Dr. Bimo, the last word?
An optimistic person.
Yeah.
And yesterday, one of my colleagues reminded me why I decided to do humanitarian 20 years or plus again. It's because I believe in humanity and believe in the human people, and that as long as we breathe, we have the capacity to make change and to do better. And for me, crisis present us an opportunity to innovate, to be creative, to build better, faster, innovative, and more resilient. And as we sit here in Saudi Arabia, the land of the Mecca, where we know each year people come from diverse background, diverse economic, but they come for the one aim. And I think we need to learn from being together, from one aim. And if God did not give us on us, who are we to give up? Then I believe in humanity. Thank you.
What a great note to end on. Thank you so much, everyone, for your expertise, and thank you for being here today. Thank you.
Thank you very much.
Thank you, Ricardo. Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Shukran. Thank you.
Thank you to our panelists for that very important and interesting session. We all have learned that we need to learn from the pandemic and prepare for the future, more importantly, which leads us into our next session, which is anticipating crises and taking early action in fragile and conflict-affected contexts. Humanitarian needs are at a record high. Crises and conflicts, climate change impacts, and disasters are increasingly threatening the lives and livelihoods of millions of people. For the humanitarian system to continue to be able to protect affected populations, a shift towards more efficient, effective, and forward-looking humanitarian assistance is needed, based on a shared understanding of the critical importance of preventing and mitigating human suffering and reducing needs before they occur. Global efforts have been dictated to making the humanitarian system as anticipatory as possible. I'd like to welcome to the stage our next panel, which will be moderated by Dr. Rebecca Nadine, and I will have her introduce our panelists for you. Thank you.
I think, too connected in terms of time. And then because I had
for drought response.
I think
Is that working? Yes. Oh, you can just sit at the chair, that's fine, yeah. Is everybody's mic working? Yeah. Are we? Yes. Okay. Good morning, everybody. It's my absolute pleasure to welcome you all to what promises to be a very engaging event this morning on the importance of anticipating crisis and taking early action in fragile and conflict-affected contexts. My name is Dr. Rebecca Nadine, and I'm the Director of Global Risks and Resilience at ODI, a global affairs think tank based in London. I'd also like to thank today the UK's Foreign and Commonwealth and Development Office for hosting our discussion. Ladies and gentlemen, we're here to talk about anticipatory action. And so what is anticipatory action? Well, that is actions triggered before a crisis in order to mitigate the worst effects or even avoid those crises altogether. For example, a government social protection programme providing increased payments in areas forecast to be flooded. Anticipatory action is increasingly attracting global attention as an approach to reducing the humanitarian impact of drought and other climate and weather hazards. So rather than responding to crises after they happen, anticipatory approaches, in particular forecast-based assessments, can help protect people's lives, livelihoods, and the well-being in the face of foreseeable hazards. And that's the important point, foreseeable hazards. The World Bank estimates that upgrading early warning and early action capacity in all developing countries can save on average 20,000 lives per year and avoid losses of between 300 million US and 2 billion per year. So those are really quite staggering amounts. Anticipatory action is particularly important for people living in fragile and conflict-affected contexts. These countries and communities are among the world's most vulnerable and the least able to prepare for disasters. So most anticipatory action to date has taken place in countries that are easier to work in, and donors and agencies now are only beginning to develop frameworks to act early to mitigate natural hazards in more conflict and fragile settings. But why is this the case? Why is this only now happening? Well, that's because current anticipatory approaches and planning are more suitable for stable areas. They don't fit the compound crisis and conflict histories of fragile areas. But it's these complex and protracted crises that further erode assets and capacities at the individual and national level, making it harder to manage climate shocks and to enact adaptation programs. Ladies and gentlemen,
anticipatory action must be expanded to complex situations of conflict-affected places. And I hope today that the discussion will give us some practical steps to take forward in the coming months and years, including at the COP28 climate conference in UAE this November. At today's event, we will hear 2 opening statements, followed by 2 keynote remarks to situate our discussion in the context. And finally, we will have a panel discussion with a broad range of actors from across development, peace building, and climate sectors. Therefore, I'm delighted to invite the Right Honourable Mr. Andrew Mitchell, Minister of State for Development and Africa in the United Kingdom, to speak. Minister, I hope you can introduce the opportunities and challenges for scaling up anticipatory action and what the United Kingdom is doing to strengthen the resilience of communities.
Assalamu alaikum. Good morning, everybody. It's a great pleasure to be here and to be addressing this vital and important issue at this great conference, which we should all thank the Saudi authorities for convening and bringing so much expertise into one place to discuss this vital issue. And I'd also like to thank our moderator here today from the brilliant British think tank, the ODI, the Overseas Development Institute, who do so much to contribute to international development thinking around the world. And as we learnt yesterday, and as this conference has so eloquently shown, the key issues here are the link between humanitarian spend and resilience and mitigation, so that we address the problems that are forthcoming on such a regular basis in the humanitarian space and are able to do something to give people greater resilience the next time these disasters affect them. So this is an important opportunity to reflect on both the opportunities and the challenges for scaling up anticipatory action, for considering how we can prevent and mitigate the impacts of humanitarian crises on the most vulnerable people. First, let us take a moment to reflect on the current context. Global food insecurity and the risk of famine is greater than it has been for decades, driven by conflict, COVID, and climate change. And the auspices for 2023 are not good. There are already many ominous signs. Nearly 800,000 people are experiencing famine-like conditions in countries including Burkina Faso, Ethiopia, Somalia, and South Sudan. Russia's invasion of Ukraine has exacerbated pre-existing crises, and we have just seen the terrible earthquake in Turkey and Syria, and the further events overnight. Global needs are at a record high, and there is a growing gap between these needs and the available funding. Humanitarian action is a key United Kingdom priority and has been for many years. We care deeply about this in the United Kingdom, as of course many other countries do around the world. And indeed, in respect of the earthquake in Turkey and Syria, in just a few days, the British public have raised nearly £90 million, $110 million themselves, for the disaster's emergency appeal. Now, if we look at that, our vision is to do 3 things: prioritize effective assistance for those in greatest need, protect civilians, marginalized people, and especially women and girls. And thirdly, prevent, anticipate, and prepare for future crises, rebuilding resilience in protracted and recurrent crises. A key part of our approach is working with the international system and our partners to act ahead of conflicts, climate shocks, and famines. Coordination across the international sector is essential and our duty to those who we seek to serve. I'd like to touch on 3 key priorities here. First, building a more coordinated approach, shifting towards more anticipatory action and preventive instruments. In other words, building resilience and mitigation, which we spoke about in the first session yesterday. This will help better manage and anticipate humanitarian emergencies, including in situations of protracted crisis and conflict. The UK is supporting this shift through the support that we have always given to the UN Central Emergency Response Fund, the CERF, which is pioneering anticipating initiatives on anticipatory action. This is a fund, the CERF Fund, which was invented by the United Kingdom some 15 years ago, and over $1.7 billion has been donated to it by the British taxpayer. We are also supporting the Red Cross community, and it was a pleasure to see the ICRC lead Robert Martini here yesterday, and the START network to strengthen anticipatory approaches to humanitarian assistance. This is complemented by our contribution to the Risk-Informed Early Action Partnership, which I know Ben Webster will talk about later. We also need to build effective disaster risk finance systems, linking fast payouts to early warnings to ensure the resources are there to act rapidly and preempt damage. That is why the UK committed £120 million at our G7 meeting in Carbis Bay to scale up disaster risk famine, and why we are playing our part in the global shield. We are building systems to reach the poorest and expanding the use of disaster risk finance for humanitarian and food security responses. And many of these instruments have been developed in the London insurance market, and pooling risks for insurance is already an up and running and an effective support in this area. Second, we need to bring our humanitarian development and climate efforts more closely together. This includes harnessing the full range of funds across those three areas for programs that build the resilience of vulnerable communities and support early warning and social protection systems. And third, we want to unlock climate finance and money from the international financial institutions for the most vulnerable countries. This will help scale up preemptive action and build their resilience in shocks. But remember the importance of partnership and technical assistance in achieving that, which underlines the importance of building up these extra buffers. Now, during its COP26 presidency, the UK focused prominently on climate adaptation. The Glasgow Pact demonstrates increasing ambition in preparing for and responding to climate impacts, scaling up early warning systems, and heading off crises before they begin. And as we look to the future, we must continue to strengthen anticipatory action by increased coordination across our humanitarian development and climate partnerships and financing, and by improving our analysis of need, helping the most vulnerable people and countries to access finance. I hope that today will result in a shared commitment to actions that support this much-needed shift. This is how we can better support some of the world's most vulnerable people in these deeply difficult times. That is our challenge, our duty, and our opportunity. And now it's my pleasure to welcome our participants and pass over to Diana Jansi, the Minister for International Development, Cooperation and Foreign Trade from Sweden. Thank you very much indeed.
Thank you, Minister. Ministers, Excellencies, ladies and gentlemen, I would like to begin by thanking the Kingdom of Saudi Arabia and the United Kingdom for convening this panel. As we all here know, humanitarian needs across the globe have alarming levels. The UN Global Humanitarian Overview for 2023 is one such a sobering and heartbreaking reading. 339 million people in need of assistance. The COVID-19 pandemic hit the most vulnerable the hardest. And then came Russia's illegal and unprovoked aggression against Ukraine, which has significantly worsened an already dire situation. As a result, We now have a global food crisis on our hand, as well as a cost of living crisis. Also, this crisis hit the poorest the hardest. On top of all this, we have witnessing the escalating consequences of climate crisis. I saw this firsthand when I visited Somalia in November, where there are already pockets of famine with people starving after the worst drought in 40 years. And this is just Somalia. Today, we face the risk of famine with people starving. We face the risk of famine on the Horn of Africa, but also in the Sahel, in Yemen, and in Afghanistan. In Afghanistan alone, half of the population is dependent on aid, not to starve. When we thought that things could not get any worse, a devastating earthquake in Turkey and Syria struck 2 weeks ago, the deadliest in 100 years. No living person can be untouched by this. No responsible decision maker can stand passive in the face of this. Ladies and gentlemen, faced with all these tremendous challenges, the humanitarian system is delivering. It is saving lives. It is relieving distress. However, it is also overstretched and overwhelmed. Humanitarian appeals have been underfunded for years. Last year, they were only financed by 51%. This is deeply disturbing. Undoubtedly, states have the primary responsibility to protect and assist persons in their territories who are affected by disasters, armed conflict, or violence. Humanitarian action is designed to complement and support states in fulfilling those responsibilities. It should neither undermine nor supplement state responsibilities. However, an increasing number of people live in states where humanitarian action is needed. Some also live in countries where the people in power seem indifferent to the suffering of their own people. Ladies and gentlemen, we see an urgent need to step up our efforts, simply put, to shrink the gap between humanitarian needs and the resources required to meet them. We need to change the way we do humanitarian action. Let me here outline 3 strands for such a new reform agenda for humanitarian action. Firstly, funding the humanitarian system still relies on too few donors. The 10 largest donors provide almost 90% of all humanitarian funding today. This is not sustainable. My own country, Sweden, a country of 10 million people, is one of these countries. If we can, others can. On our part, we will continue to advocate for broadening the donor base, including among our European partners, as Sweden is currently holding the presidency of the EU, and together with the European Commission, hosting the European Humanitarian Forum next month in Brussels, where we hope to see many of you. However, we must also recognize that it's impossible to overcome the challenges we face solidly by seeking increased humanitarian funding. Therefore, secondly, we need to use our available funding more wisely and more strategically. We need to ensure system-level efficiency and effectiveness within the humanitarian system. The humanitarian system provides an indispensable global public good. As mentioned, it saves lives and provides assistance to the people suffering the most. It goes to the core of what makes us human, our ability to see beyond our own needs. We must ensure that humanitarian actors can prioritize strategically, respond quickly, and ensure operational continuity also in neglected crises in line with the humanitarian principles. We need to introduce a quid pro quo where agencies ensure a clearer prioritization of needs based on severity and where donors provide the flexible funding that agencies need to respond effectively. Close cooperation with development actors such as the World Bank, the Development Bank, and IFAD is also vital for an effective humanitarian system. To cover the exponential increase in humanitarian needs, we urgently need to ensure that development actors remain engaged in fragile and conflict-affected contexts. Finally, we must learn from our mistakes and become better at taking action ahead of humanitarian crisis before it is becoming a catastrophe. Extreme weather due to climate change risks overtaking conflicts as a main cause of hunger. We therefore need to build resilience to future shocks, invest in early warning mechanisms, and scale up anticipatory action. The challenge is that humanitarian budgets are already under significant strain as we struggle to cover even the acute needs. We need to reposition anticipatory action so that it becomes an integrated link in building resilience to crisis. It is not just a humanitarian issue. Development efforts, climate adaptation, resilience building, and humanitarian assistance must go hand in hand. Today, only a small proportion of climate finance goes to countries already at risk of multiple crises in fragile and conflict-affected states to support adaptation. Only 12% of funding from multilateral climate funds go to fragile and conflict-affected states. Sweden is committed to further enhance our global climate adaptation efforts while not wavering in our focus on mitigation and emissions reductions. Ladies and gentlemen, acting ahead of a crisis means working smarter. Costs are cut before they multiply. Consequences such as mass displacement and migration are sometimes even prevented. That is why we need to more focus and funding for anticipatory action and adaptation from the broader development system. This is how we ensure that affected populations are able to fight the next drought in Somalia, the flooding in Pakistan, or earthquake in Syria. Let us make this a joint endeavor, but also jointly rally new partners. Thank you for your attention.
Thank you. I'd really like to thank both ministers for, the fact that they're really emphasising the importance of scaling up anticipatory action and also drawing attention to the importance for greater coordination across humanitarian, climate and development. Thank you so much for your interventions this morning.
You're coming here.
So, ladies and gentlemen, as we just heard from the two ministers, anticipatory action is not just a question for the humanitarian sector. It's an issue which requires coordination across sectors and at different scales between development, peace building, climate actors. But despite this, as we all know, the international aid architecture does remain siloed. So there's a need for a nexus approach, and this is particularly clear in fragile and conflict-affected states, where protracted crises have increased people's vulnerabilities to risk. People in these areas have faced with several overlapping shocks with the interconnected impacts, which actually limits their capacity to prepare for disasters and weather-related shocks. We better need to coordinate between organisations working in this area. And on this point, I'm delighted now to turn to Mr. Achim Steiner, who's the Administrator of the United Nations Development Programme. Mr. Steiner, as UNDP is a peace-building and development actor, I really hope you can set the scene for this discussion. How can we better work across different sectors to enable anticipatory and early action? And what capacities are required to build this, do you believe?
Thank you.
The floor is yours.
Thank you. Thank you very much, Excellencies, ladies and gentlemen, dear colleagues. Let me also begin by thanking the King Salman Humanitarian Aid and Relief Centre and the UK Foreign and Commonwealth and Development Office for convening this important discussion. And we do so fully conscious that yesterday, yet again, an earthquake struck in Turkey, and it is a brutal reminder of the extraordinary times in which citizens of Syria, Turkey, but also in many other parts of the world are currently struggling with crisis upon crisis. Our session today is meant to look particularly at the anticipatory capacity to see where crises are on the horizon and to take early action in fragile and conflict-affected countries. I just wanted to remind us of that title. And I want to begin by perhaps posing at this humanitarian forum, which I consider to be a uniquely important opportunity, The first thesis that humanitarian responses, humanitarian response strategies in today's world are increasingly challenged by the fact that unless they are integral to, first of all, an anticipatory approach to understanding these crises, and second, also an integrated approach in terms of how, particularly when it comes to conflicts and crises, the peace and development side of that HDP nexus are designed as far more integral approaches to both anticipation and also early responses. Let me begin with an example that, in a sense, goes beyond just the humanitarian response. If we want to be more anticipatory, then we need to do something that in many respects we're very familiar with already when it comes to droughts and anticipating famines. We have a very sophisticated empirical and database system to anticipate those. And yet most crises are not necessarily as a result of a natural disaster. They are unfolding disasters within our societies, tensions, whether because of inequality, ethnicity, religion. We can observe those tensions growing. And much of the work that UNDP has done over the last 30 years with the Human Development Report and the Human Development Index has been an attempt to also provide decision makers with an early warning system when essentially there are key elements of that human journey of aspiration called development is going wrong. A very acute illustration of that is the very moment we find ourselves in right now. The world is facing many crises. I don't need to describe them to you, but one that is particularly egregious in not being addressed in an anticipatory and commensurate way is the financial and economic crisis across many of the developing nations across the world today. We are facing an acute debt crisis, yet our ability with our international financial institutions to respond to that, to address the extraordinarily limited fiscal space that countries have at their disposal to address post-COVID recovery strategies, now a cost of energy, a cost of living crisis, our ability to respond and actually address these issues is extremely limited. There are over 50 developing countries right now that are facing a debt distress situation, many of them one step away from defaulting. Do I need to describe to you, experts in having witnessed this time and again, how such economic implosions cause extraordinary crises and then conflicts within a society? We are not responding in an anticipatory manner. Now that is at the higher level of being able to anticipate crisis. Let me quickly move then into the situations that many of us are very familiar with. A situation in Yemen, in Afghanistan, in Myanmar, in Libya, in Iraq, or indeed Haiti and many other countries that are in the midst of crisis or conflicts. Our ability as an international community to respond to those is still severely limited by understanding our ability to intervene as very often being triggered after a crisis has occurred. Now, for humanitarian responses that are focused on life-saving, that trigger is fully understandable. But this is my first point that I made at the beginning. We should not look at the humanitarian response as being, in a sense, an isolated tool that is at our disposal. Anticipating crisis, being able to predict better when early interventions could actually avert a crisis, is also integral to how humanitarians today would think about crisis responses. In fact, my dear colleague Martin Griffiths was with you yesterday, and with him I very much share the view that we need a far more integrated and synchronized approach. But also our ability to then, when a crisis has occurred, to be able to respond very quickly, first of all with life-saving interventions, which we often characterize as the core of the humanitarian response, and then the peace and development responses. They are not anymore understood in a chronological order. If we continue to think of them in chronological terms, then we are going to continue to reproduce the crisis that today have left us with over 100 million people, the highest number since 1945, entrapped in either refugee camps or refugee status, or as internally displaced peoples in their own country. And we have even invented a very elegant term to describe this. We describe them as protracted crisis. Protracted means essentially leaving people in their tens of millions, essentially in a state of suspended animation, in refugee camps, as internally displaced people. often with the next generation being born into that very same situation in many contexts. This is a sign of failure. And therefore, I would argue very strongly that in the way that we need to think forward about early actions in terms of recovery also, is that we have a far more integrated approach to responding also with development-based responses. In Afghanistan, the response to many of the decisions that have been taken by the de facto authorities is essentially to isolate, to sanction, to withdraw support. We strongly argued against that approach already a year before the de facto authorities took over in Kabul, for the simple reason that we could anticipate the economic implosion that would lead to over 90% of Afghan citizens today living below the poverty line. This kind of catastrophe not only is not helping to address a crisis, it actually amplifies it. It makes it worse. We need to find smarter ways, even in complex political contexts where the ability of the international community to mount a humanitarian and emergency development response is not equated to the political recognition of either a government or a regime, or is indeed only able to withdraw as a response to a setback in either governance or development contexts. Our ability to continue to stay and work with people directly in the people's economy, allowing them to have access to support for their livelihoods, maintain their dignity, avoid them becoming part of the humanitarian caseload, is an integral part of the way in which we need to respond to these crises in today's world. And this, and I end with that remark, takes us back also to the broader global outlook. If we want to work on more anticipatory approaches, on early recovery responses, then we also need to take threats such as climate change far more seriously. Many of the extreme situations that people face today across the globe, many of the natural disasters, think of Pakistan and the flood events, the droughts in the Horn of Africa, the forest fires, the hurricanes and the typhoons. These are the illustrations of a world that has arrived in the age of climate change. So if you want to deal with anticipatory action, we have to also find a way in which our global climate response is commensurate with the degree of threat, where mitigation is not only an attempt focused in climate policy terms around reductions of CO2 emissions, but in fact adaptation becomes a crucial integral element also to being more anticipatory. So I hope with these few examples I've been able to give you a sense of how in the United Nations Development Programme, we are fundamentally rethinking our way of thinking about how to anticipate crisis better, how to work alongside and in tandem with our colleagues in the humanitarian community, so that when a crisis hits, we do not, in a sense, withdraw and somehow wait for the opportunity to re-emerge for development. In fact, the best way, the most effective way, and often the cheapest way to come out of crisis and conflict is, in fact, to find a way to invest in development pathways out of them. This ultimately is at the core of what we call the UNDP crisis offer today, and I commend it to you on our website if you wish to find out a little bit more about some of the deep lessons that we have tried to learn in recent years. Thank you very much. Thank you.
Thank you very much, Mr. Steiner. And I just want to pull out a couple of points that you mentioned. I think, as you say, the humanitarian response should not be seen as an isolated tool, but also to commend UNDP on their thinking in terms of looking at these different global challenges, climate change, conflict, how they intersect, and how in some instances we're also embedding some of the risk in our development pathways. And ODI actually have worked quite closely with UNDP on what we describe as risk-informed development that really does look at these challenges intersecting and looking at some of the trade-offs as well, so that actually we can really start to bring our knowledge and our understanding of how to anticipate crisis rather than keep walking into them. So thank you very much for your call to action there, Mr. Steiner. I'd now like to turn to His Excellency Abdi Rahman Abdi Shakur Wasame, to give us a better picture of the urgency of some of these discussions. Mr. Wasami is the Special Envoy for Drought Response in Somalia. Your Excellency, we know that Somalia is one of the most vulnerable countries to climate change in the world and is also experiencing truly frightening few years of weather-related events, of course, the drought that is familiar to many. So I hope you can provide us with some information about some of the impacts of these climate-related events in fragile and conflict-affected areas in your country. The floor is yours.
Thank you. I'm facing challenges. Thank you for hosting, and I first want to thank King Salman for inviting us to this esteemed Somalia has known droughts, but never 6 consecutive failed rainy season. Somalia has also known the displacement, but never 3 million IDPs at the time when our internal conflict is weighing down. The Somali government has called for anticipatory action and emergency response before, but never have our calls been answered so late. The recurring drought have resulted in a devastating loss of lives, displacement, and profound suffering for Somali people. The effect of the drought have been compounded by the other factors, such as conflict caused by the terrorist group linked to Al-Qaeda and ISIS, climate change, supply chain disruption from COVID-19 pandemic, locust infestation, and ongoing global conflict resulting in high food, fuel, and fertilizer prices. These challenges are a stark reminder of the urgency need to take action to address the root causes of the crisis in Somalia. What is unprecedented about this drought is that it is due entirely to the climate change. Climate vulnerable countries like ours need justice in the form of financing to enable a green transition that allows our community and economy to adapt to this climate reality. Almost 12 years and 8 billion in humanitarian funding after the 2011 famine, we are still facing similar crises every other year. If we had incorporated a share of that 8 billion, even a third of it, in the resiliency scheme, we would have mitigated the effect of the climate change on our communities. We need to do things differently. We need to invest in programs that promote community ownership and participation. We must involve local authorities and empower them to play a more active role in addressing the crises. This will ensure that programs are developed with the input and involvement of the communities and they are intended to. Currently, for instance, several projects are ongoing in our country, each attempting to address a specific driver. However, these projects are normally siloed at a pilot scale, lacking coordination and complementary. Consequently, they have failed to yield the intended long-lasting result of lifting people out of the poverty and food insecurity and building resiliency, thereby creating a vicious cycle of aid dependence. Another problem is that once a fund are earmarked for the humanitarian needs, they are locked away from any other use, even when the use is connected to the crisis. We have to break this cycle and connect our emergency response today to build the resilience with and for affected communities tomorrow, so that when drought and floods recur, we can build on past effort instead of repeating past mistakes.
We can no longer rely exclusively on a humanitarian response. Instead, we must work closely with our development and peace stakeholders to incorporate a more holistic approach to addressing Somalia's prolonged crisis. With the current drought specifically, our issue was timely action and funding. At this time, our challenge is connecting immediate relief to medium and long-term resilience of affected and yet to be affected communities. Today, drought is already worse in severity and duration than 2012. Drought crops production has now been reduced by 70%, and more than 3 million livestock have died as a result of the drought. In 2011 and 2017, we learned the lessons that the community-based early warning and action system connected to the state-level system are key. If we would have received early emergency funding, this system would have enabled us to respond with targeted intervention that could have saved lives, prevented displacement, and cost every involved much, and the cost everyone involved much less than what Somalis and the humanitarian system as a whole require when disasters are allowed to spiral out of the control. In the absence of early anticipatory action and response, the challenge is evolving for crisis-affected communities. The support they receive is too often short-term, with little no longer-term recovery and resilience planning alongside life-saving humanitarian action. We witness that short-term interventions save lives, but their impact doesn't allow for communities to recover and to rebuild. We are increasingly losing our rural communities and seeing people who typically survive on agropastoral work with no option than to abandon their traditional way of life for large towns and cities. Yet our cities' capacity are already overstretched. We are trying to accommodate and provide service and humanitarian assistance to these new arrivals, but the need are fast and only increasing. It is not just the IDPs who are in need of shelter and protection. Host communities are also struggling as well. As I briefly stated, we need commitment by all to deliver for those who are worst affected. We could discuss loss and damage today and how the supposed 100 billion a year in funding have yet to materialize. But as necessary as that, in our people cannot wait. As we improve our security situation, push Al-Shabaab out of its remaining stronghold, and build our capacity to work with affected communities in addressing their specific needs, we now need our partners, both public and private, to help Somalia adapt to the realities of the climate change. I must thank our partners who have helped us to farming to affairs. Yet to end Somalia's protected humanitarian crisis and endless cycle of displacement and emergency response, we must integrate immediate emergency response with medium and long-term sustainable solution rooted in the community needs and climate adaptation into the structural change of our economy and infrastructure. We work with the national government to build a strategic financing partnership and synergize among different actors to underpin a holistic response to avoid duplication and gaps, to institutionalize and operationalize the coordination of different types of partners, example, public-private, private-public effective partnership coordination involves 3 components. First, capacity building and strengthening, platform of knowledge sharing and mutual accountability, monitoring, evaluation, reporting, and learning. Somalia faces many obstacles, but it is recovering. We are more stable today than a few years ago. We have made tangible steps to move forward. There is remarkable progress in building state institutions that is strengthening political inclusivity and security gains. We are reaching completion point of debt relief and debt exemptions. However, this progress faces 2 main challenges that pose a real threat to political and security achievement: recurring drought and terrorist group. To overcome these daunting challenges, we ask our partners, particularly our allies from Gulf countries, to stand by Somalis as we strive to restore our strength and sovereignty. What we are seeking can only be achieved by boosting our capacities to strengthen security and fight against terrorists and provide basic services to the citizens, including creating job opportunities for our unemployed youth who are caught between desperate lack of opportunity and strain of dealing with terrorists. Youth support and investment towards long-term resiliency building and development is not only a realistic solution for Somalia's recurring drought, but also key to fixing food security in Arab world following the COVID-19 pandemic and the Ukraine war that have affected a global supply chain. Somalia has enormous resources like minerals, rivers, the longest coastline in Africa, and large agro-pastoral population. But they are unexplored and underdeveloped and often mismanaged. Work with us to save lives today and make investment in our country that will be felt for a generation to come. I thank you.
Thank you very much, Your Excellency, for introducing Somalia's situation so clearly. I mean, you paint a sobering picture of some of the many challenges from, drought and food security, but also the important issue of the need to address youth unemployment. And also, I think, if no better endorsement actually of the need for a more holistic approach than coming from Somalia itself, calling for this much more integrated approach between humanitarian development and climate actors. And the importance there as well, we heard His Excellency emphasising, anticipatory action isn't about just responding, it's also about providing people with agency to manage their own responses. We are now, ladies and gentlemen, going to move to our panel segment. So I'd like to thank our two speakers. Thank you so much, Mrs. Serna. Thank you so much, Your Excellency. And can I welcome the panelists, please, to the stage. Thank you, ladies and gentlemen. If you just bear with us for 1 minute. Also, we have a slight change to one of our panelists. Mr. Dane McQueen is unable to join us today due to his family being unwell, but we are joined instead by Miss Helena de Jong, who I will introduce in a minute. So, thank you, panelists. Thank you for joining us. Ladies and gentlemen, so I'd now like to welcome our panelists, and the point of this session is to discuss in a little bit more detail some of these key issues that we've heard about earlier on how we might anticipate crisis and take early action in fragile and conflict-affected areas. So first of all, I would like to welcome Mr. Ben Webster. Ben is Head of Secretariat for the Risk-Informed Early Action Partnership, better known as RIHF. RIHF was launched in 2019 to help take early and anticipatory action to scale. Ben, I understand that RIHF is launching this week its flagship report, Early Action State of Play 2022, which provides a snapshot of early warning action commitments, investments and activities. Ben, from your perspective, what has been the biggest opportunities and challenges of RIHF's work to date? And where do you stand right now based on the State of Play report? Over to you, Ben.
Thanks, Rebecca, and good morning, Excellencies, ladies and gentlemen. Pleasure to be here. Thank you for the invitation. So just to explain the purpose of this partnership, I think our opening speakers have made it very clear that the humanitarian community has made fantastic progress on this agenda, but can only move so far on its own, on our own, and therefore this has to be a joined-up conversation across development actors, climate actors, humanitarian actors. And that's why the partnership was created in 2019, to create this platform to bring together those different stakeholders, involving governments, civil society, UN agencies, private sector, academia and science as well. And so in terms of the opportunities, what we've seen in terms of progress, but then also the challenges in recent years. I mean, first of all, I'd say that there's real energy and appetite and political momentum behind this agenda. Yesterday, Ambassador Potzel from Germany was talking about G7 commitments to this agenda, and Germany's leadership on anticipatory approaches has been critical in recent years. But also State Secretary Janse mentioned Sweden's EU presidency, and they are looking to prioritize anticipatory approaches. We have the UN Secretary General's Early Warning for All initiative launched last year, which aims to cover the entire globe with effective early warning systems. And of course, there's no point in early warning systems unless they result in early action. So that's another fantastic opportunity. We have India's G20 presidency this year with a disaster risk reduction working group focused specifically on early warning and early action, and the COP28 presidency. So many opportunities in moving forward on this agenda. I guess the challenge is that it's easier said than done. So to put this into practice is quite a complex business, working across different government departments, your Met Service, the National Disaster Management Authority, the Ministry of Finance, the Ministry of Planning, right down to a local level, as well as support from international actors, national actors, local actors, private sector. You know, implementing these approaches is actually quite complex. And therefore, as a partnership, what we try to do is resource these different partners to understand each other's roles and responsibilities, to have a broader vision of what it is we're trying to achieve, and to be able to understand the complementary added value that each partner contribute on this agenda. And therefore, last year, we launched a glossary, like a phrase book, if you will, to help these different actors to engage with each other. And as Rebecca mentioned, we have this annual State of Play report as well, which sets out what the current situation is and what are the common actions that we need to take. What are the collective actions that all these different partners need to prioritize? And so briefly, I don't want to spoil the surprise. I'd love for you to download the report and read it. But just to give you a brief overview of some of the recommendations. Number one, we need to move to more regional and national level approaches to implement anticipatory action. So at the moment, the global discussion is good, but how can we utilize regional bodies that can actually contextualize, you know, the recommendations for many different governments and countries to turn this into action and implementation on the ground? Secondly, we hear a lot about working together, reducing silos, collaboration, and again, I think it's easier said than done. So how can we actually incentivize that coordination and that collaboration? We have a great example at the moment. The government of the Netherlands, Ministry of Foreign Affairs, is supporting some of the international actors in East Africa to really identify their roles and responsibilities along this full value chain of early warning and early action, and is really incentivizing that collaboration. So that's a good model that we need to replicate. And how can we institutionalize this? So it's not about individuals with goodwill who want to work together, but how can we ensure this is the way of working where everybody understands their roles and responsibilities? And maybe the third one is around the financing. So we hear again that we need to bring in climate finance and development finance, and it's great to have UNDP at this conference as well. But in my mind, it's not about repurposing those development and climate financial mechanisms to meet humanitarian needs, but how can we achieve alignment and complementarity? So adaptation finance is building longer term capacity. Development financial mechanisms can trigger in advance of hazards. So some of the existing mechanisms, social protection schemes, how can we get them to trigger in advance based on risk analytics and early warning forecasts and so on? So it's not about repurposing to try and meet the same needs, but how can we achieve that alignment and complementarity. But as I say, download the report, and if you're interested, please join this partnership, because Martin Griffiths mentioned yesterday, it would be great to have all those different actors from the climate and development communities in the room. Well, that's what this partnership is trying to do, is to facilitate and convene those different stakeholders so that we can work together more effectively. Thank you.
Thanks, Ben. Yes, and as Ben says, yes, please do download the report, but also actually, please do take a look at the glossary. I mean, I think this is an important point, because do we actually all have a shared understanding of vulnerability? Do we all have a shared understanding of what constitutes risk? Do we all have a shared sense of understanding of the, are we talking biophysical vulnerability? Are we talking socioeconomic vulnerabilities? And then what does that mean when we start using phrases like anticipatory action and early warning? So not something I'd normally tell everyone to do, go look at a glossary, but in this case it's actually really important. I'd now like to turn to my next panellist. I'm delighted to welcome Ms. Lisa Doten. Ms. Doten is the Director of Humanitarian Financing and Resource Mobilization at UN OCHA. So UN OCHA, Ms. Doten's office is one that's overseeing the impacts of climate change on a daily basis. And UN OCHA has been supporting a humanitarian shift towards anticipatory crisis and fragile and conflict-expected states. Ms. Doten, could you just give us a bit of an overview of what you've been learning through your work?
Yes, thank you very much, Rebecca, and thank you again to the King Salman Center and to the UK for hosting this. You know, just a few years ago, anticipatory action was an experiment. Many didn't believe in it. Now it is grounded in General Assembly resolutions. It's in humanitarian programming, and we're discussing it here as a very important venue. So now, as many have said here, we need to work together to move it forward and really scale it up. So our role at OCHA is to facilitate coordinated humanitarian action, and we've been investing in an anticipatory approach because it brings our community together, as Ben was talking about, bringing together so many different actors to better serve the people that we intend to serve that are vulnerable to crises. It also makes moral sense, it makes programmatic sense, and makes financial sense. It allows us to use the resources, the very limited resources we have, much more efficiently and effectively. So we've learned that anticipatory action to mitigate humanitarian needs works best if everything is pre-agreed and pre-arranged. So that includes what are the forecasts, what are the triggers that we're going to use, what are the actions, and then what are the financing mechanisms we can use to try to finance those actions. So over the past few years, OCHA has facilitated some program pilots that address the droughts, the floods, the storms, the disease. And since July 2020, OCHA has released $89 million from the Central Emergency Response Fund, from the CERF, and has reached more than 3.5 million people across Africa and Asia. And we've already lined up another $43 million that are prearranged to get ahead of shocks that we see are coming in 5 other countries, may come. You know, from the experience through these pilots, we start to understand better what's going to work and what's going to work into the future, and how we need to improve this, what pilots we need, and how we need to scale those up, what other hazards we need to address, and then also in these complex crises, as you had mentioned. You know, for instance, in South Sudan, last year, where the floodwaters still hadn't receded from the rainy season, and then coming to the dry season, and you had the dry season, and you still had the floods that were there that were really isolating affected people, and then the rainy season was coming. So recognizing that imminent risk, the CERF and the South Sudan Humanitarian Fund allocated $19 million for anticipatory action and early action. So this meant that the materials were in place already to provide the assistance that was needed, to provide the stormwater management, the shelter, and other basic services and supplies that were needed in advance. So the other example I wanted to mention is in Niger, where they had the lowest rainfall levels in 30 years, and also exacerbated by the conflict in parts of the country in the southwest that had been affected by conflict and insecurity. So in line with pre-agreed agreements, that were set out in the anticipatory action framework already worked out. SURF released $9.5 million to 7 UN agencies to prevent and mitigate the immediate impact of the drought and supporting the most vulnerable Nigerians with food, health, protection, and access to safe water. So going forward, OCHA is committed to continuing to use its financial tools that it manages on behalf of the humanitarian system, the Central Emergency Response Fund and the country-based pooled funds, to facilitate, to generate evidence for, and to scale up collective anticipatory action. And so we plan to move forward on those pilots and then extend those and add new countries and hazards that I mentioned earlier. But in order to do that, to scale that up, we need a few things to happen. So first, we need an expansion of flexible, coordinated, and predictable financing. So this means we need more funding for anticipatory action, but it also means we need to use the funding that we have in really more effective ways. And we want to see more co-financing, as has been mentioned many times here on the stage today, behind the collective approach where SURF agencies and donors pre-arrange the funding together. And again, as we've heard today, we want to make sure that we encourage the development and climate financing to invest in anticipatory action, including through existing mechanisms like the SURF, to reach some of the most vulnerable communities in these complex emergencies where humanitarians have a comparative advantage. Secondly, while there's been a lot of progress in investing on early warning, more needs to be done for these warnings to reach the most vulnerable people and to enable them to take preventative measures themselves. So that's enabling the people to act. As was mentioned, the Secretary General's Early Warning for All initiative is trying to bring together that value chain from disaster risk knowledge, early warning, and response. And OCHA is a core member of that initiative. So we'll continue to use our support to make the priority in the fragile countries. And third, to truly scale up, we want to work with governments and social safety net programs to integrate the anticipatory approach into disaster management and in the most challenging fragile settings. So it's not impossible. For instance, we can work more closely with the World Bank, as we already are, and we continue to improve that and strengthen that collaboration. Finally, anticipatory action has been one of the most impactful innovations in recent years in the humanitarian sector, so we have to really build on that. But we also have to recognize that anticipatory action alone will not and cannot be a silver bullet for that, to prevent and address all needs. And given the scale of some of these crises, the investment is still much too low. We see this in the Horn of Africa, as was just described by the Special Envoy, where OCHA and others have provided millions of dollars for anticipatory and early action in Somalia and in Ethiopia since July 2020 to support hundreds of thousands of people. But these investments are insufficient in the wider context of a global pandemic, of the worst floods in a generation, and then also the worst drought in decades, exacerbated by locusts. So many hazards there. They're also insufficient in the context of a generally slow global response. So even with the dire predictions that we're hearing about many people being on the brink of famine in Somalia, we know that anticipatory action works because we see that those that we have reached with this anticipatory action has built the resilience and has made a better trajectory for those who were reached by this assistance before they were affected by these crises. So in the end, it's about those we can reach, but also reaching so many more and really scaling up anticipatory action. And so with that, I turn back to you. Thank you.
Thank you very much. I just want to sort of pull out a couple of points that you made there, Mr. Stotin. Thank you so much for summarising the work that your office has been doing. And I think you make some important points about the need for the funding to be more effective, and then also that importance of coordination of finance. And also to note, as Mr. Steiner did, that humanitarian response is not an isolated tool, nor should anticipatory action be seen in the same way. But again, to harness the learning that we already know from disaster risk response, disaster risk management, the humanitarian sector, climate adaptation, etc., and to sort of pull these ideas together. I'd now like to turn to Mr. Nasir Al-Khatani, who is the Executive Director of the Arab Gulf Programme, or Ag Fund, to speak. Ag Fund, as many of you know, is a regional organisation which seeks to tackle a number of pressing development issues. Mr. Al-Khatani, what does the Ag Fund do to enable people to act early and take their own anticipatory action? And also, could you just explain for us what the Ag Fund's role is in terms of providing technical support ahead of crisis?
Yeah, thank you, Dr. Rebecca. An anticipation crisis and taking early action. Something is, go with the journey of Ag Fund. Ag Fund, since established 1980, helping women and children without any discrimination. After working with United Nations, 17 United Nations, 1,000 projects, we found out area of challenge. One of the challenges is financial inclusion. At that time, that was 1997. So include individual, because whatever we do, anticipating any crisis, if we do not empower individual, we cannot even help country. Because as you know, at the beginning after a crisis, the first thing the person, woman, and man stand to support the family. If they are not included in the financial system and excluding them outside the financial system, this is the basic human right, should be available for everybody. Imagine today, with this crisis, we have no accounts, no saving, no insurance as an individual. So that's not happening at that time. We come up with the initiative opening microfinance, full-fledged bank for the poor people, 1997. The way we do it, because we are non-for-profit, because financial is always with a private company, we couldn't even convince the private sector to invest because this is a risky business for them. So what we come up with a modality called non-dividend company dedicated to solve a human problem. It's a company with all good governance, but there is no dividend, so you work with NGOs, with non-for-profit, solve a human problem. That's where you anticipate a human problem, helping government, etc. So we managed to open a bank in Yemen, Jordan, Bahrain, Syria, Lebanon, Palestine, Sudan, Mauritania, and Sierra Leone. With this experience, started 2004 until now, we include most likely 1 million people in the financial inclusion. But the most important thing, what lesson we learn, how we anticipate things before early happening. So digitalization with our bank in Yemen, for example, which started 2010. Now, people in Yemen have access to mobile banking. All the money assistant could be go through the bank. The bank have what we call BAS, the platform. 70% of the cash assistant came through this. Imagine if the Yemens have no access to digital payment during this crisis. That was if this is not started 2004, we will not have that system aware. The second area we replicate this is in all our bank, including Sudan. And something happened, we believe in it right now with climate change and food insecurity. Happened a story 2014 in Sierra Leone during Ebola. In Ebola, it's almost, they went through what we went through it in COVID-19. So 2014, everything was locked down, everything ever. We found out that some of the children, they go blind because of deficiency FB12. What we did, we said, oh my gosh, let's start with solution. We find the solution with the small farmer. Helen Keller is an Ag Fund winning prize. We call them up. How can we help those people to have something, with the small farmers, particularly women? We found out that sweet potato, if they grow it, that prevents them from, being blind, and feed them. So they help us through our bank. We finance the beginning of 50 women. That 50 women feeding themselves and feeding their children, and now they start selling this. That's why Ag Fund became put in a priority for small farmer in Sudan. What we did in Sudan, probably some of you doesn't know about the piece of land available for agriculture in Sudan. It's 5 times the piece of land available in Ukraine. Imagine 25% fat only used. Imagine today, if the war in Ukraine stopped and we invest in Sudan, we will we'll have no food, insecurity at all for everybody, because Ukraine, with that quantity, feeding themselves, feeding Europe, feeding the less developing country. That's why AgFund invest with the partner in Sudan, and we create what we call farmer hub for resilience program for small farmer, with the help of our partner, with the United Nations, you name it, but particularly with Suez Capacity Building Facility, where this is how we anticipate this is in help, and Syngenta Foundation. We do risking for small farmer. Imagine today that the small farmer buying the seed in Sudan, even before they grow the seed, they take the chips and put it in their own mobile and link with the weather index, with giving them an indication it's going to rain or not. If you're going to grow, they become insured, because the small farmer in Sudan, they are not aware about insurance and etc. And we have to do, financial literacy to educate them. So we, include that cost with the seed, by the way. And we develop the kind of seed, because small farmer does not need insurance as the backbone, but they need financial credit, they need saving, they need link with the supply chain, and most important, they want to develop the seed to be resistant to the climate change. What's happened in those days, if we don't have the right seed, when a small farmer use that technologies, the yield is 5 times in peanuts and Arab gum. Most of the agriculture, and particularly Arab gum in Sudan, which is 80% of the Arab gum used by the whole world coming from Sudan. 99% is small farmer. Nobody helping those people. Nobody even train them. By the way, this is father and other who they want to take care of that tree. If there is any damage in that tree, we will be losing the big supply, for Arab gum, for medicine, for Pepsi Cola, Coca-Cola, for all liquor. That's one of the way we want to call up to everybody. Please visit Sudan, look at the hub. If we go and invest, we leave the conflict and the war and everything to the politician to stop it. But believe me, if we invest in Sudan with a small farmer, this is the only way we will be helping Sudanese to feed themselves. And we want now to move with our partner to scale up the hub in the whole Africa. And please, help Sudan and help Africa. While we're doing this, is not to just to help them, to help us to have a food security. And this is one of the area we want private sector invest in it. Our partner as a Suez Capacity for the financial inclusion, including the biggest, company, which is Syngenta Group, they are coming to help us through the foundation. And now, after the work, they are convinced to come to Sudan. They had a visit last week to Sudan to help in that area. So this is how we anticipate and how we be able people to have receive the shock when there is a crisis happening. Imagine that with people now in Syria and Turkish, if they are not included in financial saving, they have no insurance, they have no saving, etc. Where can they go now? So if they have built that with the insurance, because as you know, insurance to assess the risk, and then the government should pay back the risk or pay a little insurance. This is a business. This is a business could be created to help a lot of survival from this crisis happening suddenly.
Thank you very much, Mr. Al-Qahtani. I just want to say, thanks very much for sort of drawing our attention to some of these sort of innovative approaches, mobile banking that you're building, but also to really emphasize that importance of financial inclusion. And I think you touched on some really important points there about how critical it is to provide people with tools, the financial tools, and access to information so people can make decisions about their livelihoods themselves and better absorb the risk. And again, also that importance of engagement with the private sector. So thank you very much. I'd now like to invite Mr. Matthew Wyatt. Mr. Wyatt is the Director for Humanitarian and Migration Director at the Foreign, Commonwealth and Development Office of the United Kingdom, to share with us a little bit more about the work that the UK is doing to support countries and communities to act ahead of crisis. Mr. Wyatt, the floor is yours.
Thank you very much indeed, and may I also thank our hosts here in the Kingdom of Saudi Arabia for laying on this terrific event. I mean, we've heard a lot about the fact that this year we face perhaps the highest risk of famine and extraordinary humanitarian need and mass starvation for a generation. And we've also heard about how humanitarian finance is just not keeping up, and the gap between the needs and the money is continuing to grow. In that context, something that can actually make our money go further, save more lives, has got to be something that we really put our effort into. And anticipatory action can do that. I think studies have shown that anticipatory action and early action, every dollar you spend on that can save up to $7 that you need to be spending if you wait until things happen. So there's tremendous opportunity with anticipatory action, and there is some good news, but there's also some bad news I'll come to. But the good news is that I think the political commitment to anticipatory action is really growing. One example of that, in the UK, we've been working very closely with G7 partners and Germany. I want to pay tribute to their incredible leadership last year under their G7 presidency, when foreign ministers committed to making humanitarian action as anticipatory as possible. And that political commitment is mirrored with lots of really fantastic initiatives, which is giving us enormous lessons of what works and what doesn't work. We've heard from Ben of the RIHF, and the UK is really proud to be supporting the RIHF and also to be supporting the SURF, which we heard from Lisa about, and the terrific work that they're doing on piloting initiatives. The UK is also supporting the START Fund, which has done terrific work in this area. It supports disaster response by national and international NGOs, and it gives about 15% of its funds already to anticipatory action. And we also are really proud to support the Red Cross and civil society to deliver more locally led approaches, and providing support for the Disaster Relief Emergency Fund, which supports work on forecast-based financing. So lots of good things happening. That's complemented by really good work in the insurance field and disaster risk financing. The Minister mentioned earlier that the UK has committed £120 million to scale up disaster risk finance, and some of that's already flowing and working, for example, with the Africa Risk Capacity and Start Ready, and the Start Network in Somalia and the World Food Programme, and also work in Mali and Burkina Faso to scale up humanitarian response and early action to drought. So that's good news, but the bad news is that there's just not enough of it happening. I think START estimates that about 50% of humanitarian disasters are predictable, but only about between 1% and 3% of humanitarian finance is actually going into anticipatory finance. So we really need, first of all, to increase that proportion so that we're doing more anticipatory finance, but also, as the Swedish State Secretary said, I think in her introductory remarks, really important to broaden the base so we're crowding in resources from a number of other sources. So still work to do, but fantastic work happening. The other point that I wanted to make was relating to, and we've heard quite a lot about this, development finance, climate finance, needing to bring that into the mix. And I think it's no coincidence that 12 of the 15 most climate vulnerable countries have now got appeals for emergency humanitarian assistance. So the link between climate vulnerability and humanitarian need is really, really clear. But a shockingly small proportion of climate finance actually goes to those very countries. And I think it was ODI, your organisation, Madam Chairman, that did a study on this of 4 climate funds. And between 2014 and 2021, non-fragile countries got an average of about $161, but fragile countries got $2.10, so a seventh of that. So there's something wrong here, that it seems that the more a country needs this finance, the less likely, frankly, it is to receive it. So there's a real job, I think, that we need to do to kind of join up funding that is available in the IFIs, climate finance institutions, and so on, and make sure that it actually flows to the people who need it the very most. And that means both working on the boards of those agencies and so on at the top level, but also working with countries to make sure that they're able to make the applications in the right way, get through the bureaucracy so that they can really tap into the funding. So I think there's real work for us to do there. And then my final point, Madam Chairman, is, I guess, addressed to fellow humanitarians in the room, of which, of course, this is a humanitarian conference, of how important it is that we get out of our silos. We shouldn't just complain that there are silos. We need to be really active in getting out of our silos, partnering with the international financial institutions, with insurance companies, and you spoke very eloquently, sir, about importance of insurance, with insurance companies, with the peace-building community and so on, to make sure that we're working really seamlessly together and harnessing all the sources of finance we can for those who are the very most vulnerable people on the planet. And for our part in the UK, we will look forward to working with all of you in trying to do that. Thank you.
Thank you very much, Mr. White, and thank you, yes, for highlighting that there is some good news out there, that the political commitment to addressing and driving forward, scaling up anticipatory action is growing. Also, as we heard from Mr. White, there are a number of initiatives there. But also, thanks to Mr. White as well for also, yes, there is some bad news, but actually, you know, we've heard it on this panel today that we know what needs to be done. We know that there needs to be greater coordination. We know that we need to get a better understanding of what the risk appetite and risk tolerances are for investing in some of these contexts. So, as Mr. Wyatt mentioned, you know, the importance of climate change, and this brings me to our final panelists. As I mentioned, we don't have Mr. Dane McQueen, but we're equally honoured to have Ms. Helena Jong to join us. And it's important to hear from the Office of the Climate Change Special Envoy for UAE, because as we all know, the UN Climate Conference will be held in November in the United Arab Emirates. Last year at COP27, we saw several major breakthroughs for vulnerable groups. Countries successfully negotiated this establishment of a loss and damage facility to compensate developing countries which are already suffering impacts of climate change. How that is implemented is yet to see, but there is that agreement to establish it. In addition, the UN Secretary General launched the Early Warning for All initiative, which aims to ensure that within the next 5 years, everyone is protected by disaster forecasting, preparedness and response. And in fact, the urgent need for early warning systems was also widely appreciated at COP27. And for the first time, we really saw that figured prominently in the cover decision known as the Sharm el-Sheikh implementation plan. So it's my great pleasure to introduce Helena de Jong. She's a senior specialist at the Office for the Climate Change Special Envoy for UAE. Ms. de Jong, perhaps you can tell us a bit more how today's topic, early anticipatory action in fragile conflict-affected states, fits into COP28's agenda.
Yes, thank you very much, and good morning, everyone. Thank you very much to the organizers for convening us here today. COP28 is mandated to deliver the global stocktake, which is basically an assessment of where we are at regarding the implementation of the Paris Agreement. I don't think we need the global stocktake to tell us that we're not in the best place. But it also provides an opportunity to look forward and to see what is possible and how we can accelerate action to remain on track. And this, I feel, is where anticipatory action, particularly in conflict and fragile areas, comes in. So the COP28 presidency is very committed to putting a spotlight on conflict-affected and fragile areas. So we've seen progress already on this topic, and COP26, for example, spotlighted this issue. COP27 saw the first climate responses for sustaining peace initiative ever at the COP, which is great progress in spotlighting the particular challenges that are being faced by these communities. So it is our ambition to deepen and strengthen and build on these milestones. So let me highlight 2 items that we would like to see progress on at COP28. The first one is relating to climate finance. We would like to see greater and higher quality of finance to conflict-affected and fragile contexts. We know that half of the countries that are considered to be the most vulnerable to climate change are also affected by conflict and fragility. And you will see the same thing if you look at where UN peacekeeping operations and special political missions are deployed. You will find that many of them are actually deployed in the contexts that are most vulnerable to climate change. Yet, as was very nicely mentioned also by my neighbor, was that they receive least of the finance. So we would like to pay and draw specific attention to the specific needs of communities in these contexts, and to really bridge a gap between this climate finance fragility gap. The second point is relating to modalities and to addressing some of the technical issues that currently prevent climate finance flows to these contexts. So what needs to change for communities in fragile and conflict-affected areas to benefit from climate finance flows? How can finance be disbursed to this context? What are some of the financial and technical vehicles that we can use to ensure that finance reaches those that need the most? What mechanisms are out there that can be repurposed, for example, to enable this? And there is also a big role of humanitarian actors to play, and in some cases also of peace and security and peace-building actors, since they are often the ones that are on the ground and that have access to the communities that need it the most. So this really requires partnerships, and this was mentioned by several panelists already, between public actors, between private sector, between local actors on the ground. It's a whole package. So really to break through these cycles of climate insecurity and protracted humanitarian crisis, we need to build resilience. And we've heard this a lot yesterday and earlier this morning. We need to demonstrate and scale anticipatory action and early finance, and we really need to identify the pathways that to translate international commitments and international pledges to finance and action to national and local level action. So really a key talking point for us will be also that when we pilot anticipatory action or climate risk finance or disaster finance, early warning systems, when we pilot those, we should focus on conflict-affected context. Rebecca, you mentioned before that we often see that the first iteration of these programs is being piloted in some of the easier countries. But it will actually be a big talking point for us to advocate for piloting in the countries that need it the most. We do not have time to wait, and we also don't have time to waste. What is also a big priority for the COP28 presidency is to listen to the communities and the people that are most affected, and to really putting a spotlight on their voices. And we really hope that everyone in the summer will leave the UAE with a sense of urgency of this topic, but also really with a sense of the opportunities and the possibilities that are out there with regards to anticipatory action in fragile and conflict-affected areas. We very much look forward to working with all of you to make that happen. Thank you.
Thank you very much, Helena. And as you say, we're looking to COP28 to be the solutions COP, so no pressure there. But as you made clear, we can't afford to row back on any of these commitments made at COP26 and COP27. But thank you as well for that very clear overview and for stressing how you see this agenda as being important for COP28. We're almost coming to the end of our session, but just before we do, I'd just like to turn to back to Ben just one more time. Ben, given what we've been discussed today and what you've heard from the panelists, sort of with your RIHF hat on, obviously, what would you say some of the priorities are for this agenda looking ahead in 1 minute?
Yeah, thanks, Rebecca. I think there are two things that stand out from my perspective, and this comes back to His Excellency the Special Envoy's point around the situation in Somalia. How can we really focus on the affected communities? So number one, there's still more to do within this humanitarian community, and I feel like I can say we because I've been part of this humanitarian system for the last 20 years, but we need more specific commitments. So Germany has committed at least 5% of their humanitarian budget towards anticipatory approaches, and listening to Lisa, we need to do more to really prioritize these early and anticipatory approaches within the humanitarian system. But secondly, to contribute towards these broader development pathways. As the humanitarian sector, we need to be plugged into these discussions at a national level, at a regional level, whether it's through the loss and damage agenda or early warnings for all, or whatever the opportunity is this year, the humanitarian actors need to be at the table to contribute towards these broader, longer-term aims of building resilience so that we do not end up in this cyclical, reactive loop that we've heard is the situation in Somalia. So those two things stand out for me, but we really look forward to working with you all to make progress on this agenda overall. Thank you.
Thanks, Ben. So, ladies and gentlemen, today we've heard from our key speakers and our panelists. They've provided a range of perspectives about the latest international work on early action and anticipatory action, and on how actually these current initiatives that we already have, this learning, this knowledge that we already have, can be scaled up to countries affected by conflict and protected crisis. And for me, I think from today's session, there are sort of three key resounding messages, if you like. First and foremost, in fragile and conflict-affected states, communities, difficulties begin long before humanitarian timescales and systems of anticipatory action. Government and aid actors from across different sectors, humanitarian, development, and peace building, they need to work together to address these risks on all the timescales, and that came through, I think, very clearly from our panelists. And this includes longer-term support to risk reduction, adaptation and development, as well as the short timeframes of anticipatory action. Secondly, I think we also heard from our panelists, and this came quite clearly, I think, when we heard the intervention from His Excellency from Somalia. When we focus on technical solutions, we can sometimes lose sight of how people manage their own risks. Technical solutions must enable people not only to be informed of the risk, but to be better informed. And what I mean by that is this means providing information or resources so people can take action based on their own contexts. And this is a critical part of anticipatory action, and I think today's discussion has really reflected that. And finally, this event is part of a process. It remains to be seen whether COP28 will further the commitments made at Sharm el-Sheikh towards supporting anticipatory action in some of the world's most vulnerable companies. We sincerely hope it does. And I think based on what we've heard here today, I believe we can be cautiously optimistic about the upcoming negotiations in the UAE. So I would hope you could all join me in thanking our speakers and panelists for taking their time to be here today at the 3rd Riyadh International Humanitarian Forum. And I'd really like to thank you all for coming to our event today. Thank you. Thanks, everyone. Thanks.
Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized movement to help each other. We will have to work together to achieve the UN Sustainable Development Goals, SDGs, and take responsibility and cooperate to achieve the goals of our organizations, conferences, and forums to reach the desired goals. This is how we can change our world, as much as possible, for the better. And slow down the deterioration to replace it with positive change to ensure a prosperous future for humanity. We are here today because we are responsible and we are able, together, to create a world we have always imagined. Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized movement to help each other. We will have to work together to achieve the UN Sustainable Development Goals, SDGs, and take responsibility and cooperate to achieve the goals of our organizations, conferences, and forums to reach the desired goals. This is how we can change our world, as much as possible, for the better. And slow down the deterioration to replace it with positive change to ensure a prosperous future for humanity. We are here today because we are responsible and we are able, together, to create a world we have always imagined. Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized movement to help each other. We will have to work together to achieve the UN Sustainable Development Goals, SDGs, and take responsibility and cooperate to achieve the goals of our organizations, conferences, and forums to reach the desired goals. This is how we can change our world, as much as possible, for the better. And slow down the deterioration to replace it with positive change to ensure a prosperous future for humanity. We are here today because we are responsible and we are able, together, to create a world we have always imagined.
About to begin. We are going to be focusing on challenges in humanitarian work, moderated by the lovely Juliet Foster. Thank you.
Our panel in a few moments. If you could be patient with us, please, and in the meantime, take your seats. Thank you. Lovely. So that's just mine. Great. And to switch it on, is it on already? Or? It's already on. Lovely. It's just there. So it's just the headphone. Lovely. And the translators, they're not speaking yet, are they? Yeah. Okay. So I'll have to listen to it then. That's fine. Great. Thank you so much. Are we all ready? 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 Okay. Guys, are you ready? Okay. Okay. Okay, I believe that we have the cue to go. So please, everybody, come in, take your seats, and we are about to begin our panel. So first up, I'd like to say good afternoon and thank you for joining me on the final day of the 2023 Global Humanitarian Overview. I'm sure I met most of you yesterday at the opening session, but for those I didn't meet, my name is Juliet Foster, and in a few moments I'm going to be moderating the panel, Challenges in Humanitarian Work. Now, it is an appropriate subject given everything that is currently happening in the world today. I'm sure that most of you heard about the further earthquakes in Turkey, on top of the tragedies which have happened already in the last few weeks. So again, more pressures there for those involved in finding survivors and also dealing with those who've been left behind. But also as well, Russia's invasion of Ukraine has internally displaced 5.9 million people, while almost 8 million Ukrainians have crossed into neighboring countries in the region, including Moldova, Poland, and Hungary. Now, Ukraine's misery does have far-reaching consequences that are already being felt. It is impacting food security and systems in Africa, from the inability to import staple crops to the long-term implications of fertilizer restrictions. Over a third of African countries rely on Russian and Ukrainian wheat imports, with 20 African states buying in around 90% of their wheat from the two warring countries. Since Moscow's tanks crossed into Ukraine a year ago this week, global food prices have skyrocketed, and for low to middle income countries struggling against the backlash of weather extremes and limited resources, that spelt disaster. 50 million people across East Africa are being pushed towards starvation, where even the most basic nutritious foods are at risk of falling out of reach. What the Ukrainian experience tells us is that a humanitarian catastrophe in one part of the world can compound another elsewhere. Such is the nature of global interconnectedness. Climate change, drought, war, population displacements, and the breakdown of health or social infrastructures are a dangerous, toxic mess that somebody has to make sense of in order to navigate. To which I say, welcome to the world of the 21st century humanitarian. So much for the operational landscape. How can help be administered to traumatized communities on the verge of falling apart, assuming they haven't done so already, when the funds that could make a difference might be in short supply? How can humanitarians maintain their neutrality in a diverse and crowded field of actors where offers of unconditional assistance might not always be welcome? Who should be trusted or indeed avoided at all costs? The bottom line is that humanitarians are doing a difficult job in a constantly shifting landscape. They have become an easy target for attack, either verbally from critics at home or physically from those in the field. In the words of Gareth Price-Jones of the Steering Committee for Humanitarian Response, the incentives to attack humanitarians remain much the same. Denying assistance to populations that may support opposition groups, removing witnesses to atrocity, allowing greater military freedom of movement, and blocking or discrediting independent narratives around levels of humanitarian suffering. Hold those thoughts and let's meet our panelists. First up, Lisa Dalton. Lisa is Director of Humanitarian Financing and Resource Mobilization at the UN Office for the Coordination of Humanitarian Affairs. It's good to see you. She also oversees the daily operations of the CERF, that is the Central Emergency Response Fund. Lisa, thank you for joining us. Jessie Mason is Global Coordinator for Anticipatory Action at the World Food Programme. Jessie, it's very good to see you too. Please also welcome Benjamin Davis. Ben is Director, Inclusive Rural Transformation and Gender Equality Division at the Food and Agricultural Organization. Dr. Maria Nera is Director, Public Health and the Environment Department at the World Health Organization. She's been with the WHO since 1993. It's good to see you. Let me also introduce you to Elke Meyerhofer. She is the UNFPA Regional Humanitarian Advisor for the Arab States region with more than 20 years of experience in the arena of international cooperation. She's also worked in the Arab region since 2009. We also have with us Kit Dyer. Kit is Humanitarian Specialist for WASH, that is the Water, Sanitation and Hygiene Group for UNICEF in the Middle East and North Africa region. And also, can I introduce you to, on my list, Manuel Pereira. Now, Manuel is Head of Division for Migration, Environment and Climate Change at the International Organization for Migration, or IOM. And finally, I'd like to introduce you to Sheikha Hissa Al-Thani. Now, she's the envoy of the Secretary General of the League of Arab States for Humanitarian Affairs. And I'm asking you, our audience, to welcome our panel. Please show your appreciation for their presence. Okay, so just to give you an idea of what's going to happen, I'm going to put some questions, 2 questions each, to some of our panelists. For some of them, it's just 1 question. They will have 7 minutes to complete their answers. And then at the end of this particular segment of this discussion, we will then go on into a much wider question and answer session. So I'm going to start by putting the first question to you, Lisa Dalton. But before I do, if anybody wants to address the audience from here, please do feel free to do so. You'll also be doing my feet a favour because they'll be having a rest. High heels are not a good idea for these things. But look, Lisa, you've got 4 minutes, and my question to you, the first one is, from your perspective, what are the key challenges facing humanitarians? Not to put too fine a point on it, they're huge. Yeah, can we have her microphone on, please?
Hello?
Yes, that's
okay.
fine. We can hear you.
Key challenge number 1, to be heard.
I think somebody else's is on.
Yeah,
too.
Kit was talking, but your microphone is live.
Okay, very good. Okay, thank you so much, and also thanks again to the Kingdom of Saudi Arabia for hosting this forum. So in terms of the challenges, you're right, there's so many, but I'm going to talk about 4 specifically. First, crises are growing in magnitude, frequency, and severity. So this year, 339 million people need humanitarian assistance. That's 1 in 23 people on this earth. So it's quite amazing if you look around here, how many people, how many of those would actually be proportionally needing assistance. So what's behind these things? These numbers, there are 4 things. 1, there's hunger. 222 million people will not know when they'll have another meal. Nearly 1 million people are at risk of starvation in Afghanistan, Ethiopia, Haiti, Somalia, South Sudan, and Yemen. Displacement is another thing. The number of people displaced globally continues to grow, reaching a record 103 million people. Also epidemics. So there's a rise in mortality from epidemics like cholera and COVID-19. Infant vaccine coverage has reached its biggest drop in 30 years, which is a disastrous thing for the future generations. The pandemic, of course, set back the whole development clock, and we're off track to end poverty by 2030. And women and girls are the hardest hit, as we know. It'll now take 4 generations in order to reach global gender parity. Conflict is the last thing I want to mention in terms of one of the behind the numbers, which is prolonged conflict, such as in Syria and Yemen, new conflicts which plunge millions into dependency. The war in Ukraine has caused so much devastation, as we see on the news every day. In terms of the challenges, I see the second one is the price tag for the assistance. It continues to grow and is moving much faster than the funding that's available. So the humanitarian response system is being tested really to its limits. This year, in December of last year, we launched the Global Humanitarian Overview, also including here in Riyadh. And we appealed for $51.5 billion to assist 230 million people in 69 countries. Those are the most vulnerable of the 339 million I mentioned that are in need. Last year we received $24 billion in funding, which is less than half of our goal. So this although it fell far short of what we actually need, humanitarians used the funding to reach 145 million people, or close to 80% of our target. Now that actually means that the system is increasingly delivering more value for money. So for example, while the number of people in need has more than doubled in 5 years, the funding requirements have only gone up 1.5 times. The pooled funds that OCHA manages on behalf of the humanitarian system play an important role in all of these efforts because they're not only financing instruments, but they also support coordination. The Central Emergency Response Fund, or what we call the CERF, and the country-based pooled funds that we manage enable partners to respond very quickly and at scale, providing $1.7 billion in principal needs last year. So another one of the challenges I mentioned is the operational environment is getting so much more complex every day. Humanitarian need is concentrated in the most fragile countries where economic decline, violence, extreme poverty, lack of basic services collide, making humanitarian work even more challenging. Likewise, what is a huge challenge for humanitarian workers is that they are targets. They're often caught in the line of fighting in many of these very fragile and conflict settings. If funding requirements are one of the pieces of the measure of complexity, I should note that 10 country programs this year have needs over $1 billion. So they include Afghanistan, the Democratic Republic of Congo, Ethiopia, Nigeria, Somalia, South Sudan, Syria, Ukraine, and Yemen. So the requirements have also grown in many other countries of crises that are not on the front lines, on the headlines all the time. So for instance, in Haiti, where mounting violence, staggering inflation, and outbreak of cholera has almost doubled the needs in that country. Also in Afghanistan, drought and a crackdown on women's rights has further exacerbated the needs of 28 million people. The last challenge I wanted to mention here is climate change is picking up speed and winning the race in many places. We've heard that many times during this forum. It's claiming the lives of the most vulnerable and fast outpacing the world's attempts to stem that. So COP27 is really, I would call it an aha moment for also humanitarians, but for many, a global recognition of the really difficult injustice that those who are suffering the most are those that are not causing it, are at the central cause. They're the most at risk, however. The Horn of Africa is enduring a 5th consecutive failed rainy season. And last year we saw how record flooding submerged the entire villages and harvests in Nigeria and Pakistan. So a lot of this humanitarian work focuses on responding to the consequences of climate-related disasters. You know, for instance, this year's extreme heat events, or last year's extreme heat events, where they were more dangerous and made life very less livable. 2022 saw communities across the globe sort of melting under the very high temperatures. China, for example, recorded the most severe heat wave ever anywhere. And Pakistan's ongoing flood emergency was preceded by a series of extreme heat which hardened the ground, which made it less able to absorb the enormous rainfall and flooding that came thereafter. There's a report called Extreme Heat, which was issued by the International Federation of the Red Cross and Red Crescent Society and OCHA, which I invite you to read to hear more about how heat is increasing vulnerability. So in short, you know, these challenges make us look at more humanitarian work moving forward, which also means we need to proactively create and seize more opportunities to make it a better and stronger system to do that.
Okay, thank you so much for that. Can you now tell me what are the opportunities? You have 3 minutes, so again, if we could be brief in our answers, because we have a lot of ground to cover.
Yes. Okay, so in terms of the opportunities, I will try to be very quick. First, humanitarian work can and should be more local. We need to involve the local responders. They're the ones that are there when disasters happen. They'll be there after. We're taking important steps to empower local response and working with them, listening to them, giving them voice and agency, which is the next part as well. We have to make sure that humanitarian assistance is more accountable to the people we serve. So again, listening to them, providing them that opportunity. Thirdly, humanitarian work can and should be more nimble. So one way of doing that is providing cash assistance, which also addresses the needs, the needs that people have. Rather than providing them with basic supplies, they then can decide what is most important for themselves. So that way, the cash transfers enable people to have, it's also more accountable, they're able to address those needs. And just as an example, last year in Ukraine, the humanitarian community implemented the largest humanitarian cash transfer program in history, which transferred $1.7 billion more through the system to 6 million people, which was an enormous effort, an enormous leap in how we can assist people. Fourth, humanitarian work can and should be smarter and more collaborative. We need to use increased technology and innovation to ensure that it's delivered more quickly and more effectively. A couple of examples of that are using AI to estimate population densities in crisis areas, social media to fight disinformation and hateful rhetoric against humanitarian organizations. Fifth opportunity is that it can and should promote more sustainability and long-lasting solutions. This is where we can work better and smarter, and we can also link to development organizations to ensure that those that move out of humanitarian don't slide back into humanitarian situations and protect those gains. And then the last thing I would mention is that humanitarian work can and should be more anticipatory. We need to act before the disaster actually hits. And it does, we see data that shows that 30% of crises and the needs can actually be predicted. And so we can address those before they occur by providing early action and anticipatory action. So I think just to conclude, a couple weeks ago, the Secretary General did a walkthrough in OCHA, and he was talking about the enormity of the challenges that the world is facing. And he said that there's one thing that really saves us, and it ensures that we all work together as a humanitarian system, coordinate and make sure that we seize these opportunities and address the challenges.
Thank
Okay,
you.
thank you so much for that, Lisa. A very comprehensive response to those two questions. Let me now go to Jessie Mason. You have two questions as well. I'd like you to respond to this one in 4 minutes. Again, if you wish to come here, do feel free. But my question to you is that a few moments ago, you heard Lisa reference the need for collaboration, also partnerships. But how can agencies do this in a way that is meaningful? 4 minutes.
Thanks so much. I really appreciate it. And I really appreciate the colleagues who've made it here after lunch and joining us in this important discussion, and KSA for hosting us. And I think that's key to our issue here, which is making sure that we have time to discuss, making sure that we have time to work together long before the impacts of climate hazards or other on people are visible. And so yesterday there was a discussion during the Humanitarian Development Peace Nexus, and I think there was a point there that was really important for us to capture here, and that's our actions are not the sum of our collective inputs. They're pieces that we need to start to plan together long before the needs are visible and long before people are suffering. And I think that's key to us excuse me, being able to practice this, being more nimble, being able to move quicker, and being able to work together. And so as we have this discussion under this changing climate and the losses and damages of the consequence of failed collective efforts in reducing levels of global warming and substantive underinvestments in systems to predict and protect, this is a point in time that we need to come together. So I wanted to focus on the part about where we can put this into practice. How does this actually become more meaningful? And to support this shift in the humanitarian system from increasingly expensive crisis response to a more forward-looking management of climate risk, organizations such as WFP, FAO, OCHA, IFRC, and the START network of NGOs have piloted anticipatory actions ahead of different types of climate hazards and across diverse country contexts. This collaboration has led to the development of operational frameworks that Lisa had just mentioned, for anticipatory action that define the roles of different partners, the early warnings to be used, the co-targeting of at-risk people, as well as priorities for evaluation and learning. This learning part is the part where we get to be able to learn from these issues and start to improve the way we collectively work together. As we have just heard from Lisa, and yesterday from Germany, we've also developed protocols to release flexible financing predictably and rapidly when a pre-agreed trigger point has been reached. This collaboration has evolved into the development of interagency anticipatory action frameworks led by global and country teams and NGO partners, as well as joint targeting and evidence protocols. As a result, when we've seen devastating floods in Nepal this year, in Bangladesh in 2019, financing reached local agencies and communities days before the floods arise, allowing families more time to prepare, save lives, and protect assets. And these similar processes are happening across countries and the places where we work together. And this is where I think we start to put this into practice on how we become more nimble and how we start to plan long before the suffering is visible on people.
Okay, my second question then, if humanitarians are guilty of silo working and thinking, doesn't it follow that they're making things worse for themselves by not acting collectively? 3 minutes.
Thanks so much. Well, it's certainly making it less efficient and more challenging to collectively get ahead of the curve, right? If we're not sitting down and having these conversations long before we're under the cloud of emergency, long before we're trying to move forward ahead and save lives, it's going to make it very challenging for us to get ahead of a changing climate. And one challenge we observe at country level is that the tools, resources, and protocols that are already available within our individual partners and our individual agencies are not systematically applied across partners and country teams. And that good practices are not integrated into the humanitarian program cycle. These learnings, these opportunities that we've been able to collectively generate together need to start to inform the way we look towards the future. We also see a need to become more systematic in sequencing and combining different sources of financing. We heard that today from the minister around how we start to leverage insurance and anticipatory action finance, development finance, and climate finance, so that early warning and anticipatory action systems can be meaningful, coupled, and prioritized in national climate adaptation plans and augment rapid response needs. We need to be able to see this as part of a collective picture that we're all contributing to, and ensuring that we're not looking at just the short-term needs, but how this pushes us forward into the future. And we have an opportunity to discuss how we can collectively support this change, to leverage the learnings, tools, and resources that our respective agencies are developed to strengthen a more effective use of early warning systems and anticipatory action frameworks at country levels. Governments and their humanitarian and development partners require forward-looking risk management systems to avoid predictable climate hazards from turning into humanitarian emergencies. And thanks to progress in climate modeling and impact-based forecasting, this is now possible. Robust early warning systems, as we heard today, around the Early Warning for All initiative can facilitate decisions to release prearranged financing and pre-agreed activities, which can protect lives and livelihoods long before new climate shocks occur. Such anticipatory actions save lives, time, and money, which WFP and our partners have been able to demonstrate through expanding anticipatory action programs.
Okay, Jesse, thank you so much for that. I'd like to move on now to Ben, who's sitting next to you. Now, I'm going to give you 7 minutes. So you're having one question, 7 minutes, please, don't overrun. But look, there was a session yesterday on the Humanitarian Development Peace Nexus, and during that session we heard how one of the solutions to some of the many challenges that you guys face can be addressed by better aligning humanitarian development and peace investments and objectives. My question to you is, how can you do this in practical terms, given the reality of what's out there? 7 minutes.
Great. Thank you very much, Juliet, and good afternoon, everyone. It's a pleasure to be here today. I mean, I think we really have some challenges, which I'm interpreting as someone who comes from the development world, let's say, looking at the humanitarian world. One is some of the challenges in humanitarian work need to be addressed through the Humanitarian Development Peace Nexus. We need to specifically to better leverage existing government spending, development partners' investments on development, that's systems, policies, infrastructure, program, institutions, for humanitarian response. And this sets the foundation for a more effective humanitarian response. Now, saying it is much easier than actually doing it, and the big challenge is how do you do it in practice, right? Now, part of the challenge is that these are different worlds, the humanitarian action and development action. There's different speeds, immediate response versus long-term planning. There's different incentives. There's a different imperative to action. There's different training and skill set among the actors themselves, different sources of funding, different priorities of donors, and there's a different language. We speak different languages. We often don't understand each other. Now at FAO, we have a fair amount of experience in facing this challenge since we're primarily a development organization, normative focused, with technical expertise in a broad array of areas around agriculture. That's crop, livestock, fisheries, forestry, etc. And in our humanitarian work, really our value added derives from this technical expertise. So for example, social protection, which is a technical area under my supervision, and one which we work closely with our Office of Emergencies and Resilience, it's an important tool for operationalizing the HDP nexus, whether we're talking about slow or rapid onset of climate-related disasters, COVID-19, conflict, or other crises. Now, social protection, and here I'm talking about policies and programs that address social and economic vulnerabilities, cash transfers, school feeding, labor market interventions, etc. It's long been used as a development tool, and it's long been used as a humanitarian response. But really only recently has there been a fundamental shift towards trying to bring these worlds together. Now, it's really a two-way street. One is how can functioning social protection systems facilitate the flow of humanitarian aid? And how can this aid be better aligned with government systems, with national objectives and priorities? It's both about strengthening government systems as well as improving and institutionalizing the delivery of aid. Now, what have social protection systems, programs, and tools, how have they been leveraged by humanitarian actors? So you can use or build off existing social registries and program registries for targeting, management information systems to manage caseload. You can use or expand existing social protections programs to implement humanitarian aid. You can use the experience and data from existing programs to design humanitarian interventions. You can take advantage of national staff for outreach. And you can leverage existing disbursement modalities as well as grievance mechanisms. But I think more fundamentally, it's the existence and the expansion of social protection systems and programs prior to emergencies, which can help, let's say, reduce the need for the massive humanitarian response. Because social protection plays this preventive, protective, promotive, and transformative functions, right? So it strengthens resilience of households against shocks, averts losses of income, assets and livelihood, and it contributes directly to risk mitigation and disaster preparedness. It also protects people in the case of shocks by providing basic subsistence and providing relief. But it's also promotive in that it promotes livelihoods and it builds resistance within livelihoods. But it also can be transformative in the sense that it can address structural inequality as well as promote inclusive economic processes in the long term, which can reduce and avoid a lot of the sources that lead to humanitarian crises. Now, of course, the problem is that countries that are most at risk are those with the least effective coverage of social protection systems, right? So I think the point here is that if we want to use social protection systems in order to address these covariate risks, we really need to invest in government systems where they're needed most, okay? Now, I just want to give one example, really, of how this has played out in practice, and that's the global response to COVID-19, okay? And so social protection was the #1 global response to COVID-19, to the negative impact of the pandemic and the ensuing economic crisis. You know, nearly 3,900 social protection measures in almost every country of the world, representing 3% of global GDP in 2021. Now, of course, it was highly unequal between countries, right? So in high-income countries, they spent 90 times per capita more than in low-income countries, which just didn't have the resources necessarily to give the response. But I think really the valuable lesson from an HDP perspective from COVID-19 is that those countries with an existing social protection system were able to respond more quickly and more efficiently through horizontal expansion, expanded eligibility, or vertical expansion through top-ups, et cetera, and the modification of existing procedures, whereas those who had to start from scratch or from weak systems experienced much longer delays and a much less efficient response. Thank you.
Okay, Ben, thank you so much for that. Let's now move on to our next panelist. This is Dr. Maria Nairo. Now, look, thank you so much for joining us. What I want to get from you is a 7-minute response to what you've heard so far from your fellow panelists, but within the context of your areas of expertise, which is climate change and health. 7 minutes.
Thank you. Good afternoon, everyone. Let me be the one putting the big H here, H for health. I think this is what will be agglutinating all the interventions from the participants. Health will be a central point on a humanitarian response. One of the first things we need to organize when we have a crisis is exactly that, providing protection, providing water, providing food, and immediately then the health response. And I'm afraid from now on, the humanitarian and disasters and climate change will be all together. I'm afraid from now on, it will be very difficult to confront a humanitarian disaster which is not related directly or indirectly to climate change. So we all need to be prepared, align. This coordination among the different actors is fundamental. What's happened to health and climate change and humanitarian disasters? Climate change is affecting our health. And it's affecting our health because it's creating the perfect conditions for more diseases transmitted by vectors like malaria or dengue, and of course by water, lack of water and sanitation. Cholera was mentioned before, but all of the infectious diseases will be very, very sensible to the warming temperatures and the conditions that climate change is creating. Obviously, climate change is affecting our health as well because we'll be accelerating the intensity and the frequency of all of those natural disasters. And the first to suffer when there is a natural disaster will be humans and humans' health. So we have plenty of reasons why health has to be a very strong part of climate change. But at the same time, as the health system, we need to be better prepared for that. One of the things is that in a humanitarian emergency, you will need to provide health. And to provide health, look at these slides. I mean, imagine a healthcare facility or a little, even a mobile hospital without light. That's something that is almost impossible to provide health assistance because you need to keep a refrigerator for a vaccine, or you need to perform a minimum of a surgical intervention, you need to disinfect, you need to keep a communication, and therefore we need to make sure that our healthcare facilities are better prepared, are more adapted to what climate change will bring for all of us, and being climate resilient better prepared to provide this humanitarian and health assistance that we need to provide. On the other hand, we need to make sure that we reduce our carbon footprint. WHO is working with other partners now to make sure that those healthcare facilities will now have access to sustainable sources of energy. We want to put solar panels, for instance, in our healthcare facilities to make sure that they will be more resilient, they will be less dependent of, for instance, diesel engines that we need to many times with other organizations to send to the field to respond to this humanitarian request. If our healthcare facilities, if our health system is more resilient to climate change, is better prepared, more adapted, if the sources of energy that we need are coming from sustainable sources like solar, I think those are innovations that can be very much replicated all around the world to make sure that when this health assistance is needed, we will be there. In that sense, we want to thank Saudi Arabia and King Salman for the support on this type of innovation, making sure that we will make our healthcare facilities around the world better prepared. The other thing is that we have an opportunity now to join forces and making sure that we are strategically aligned at the COP28. COP28 will be a moment where we need to tackle the causes of climate change. And if we all together claim and accelerate the ambition and the speed for more action on climate change, one of the most immediate benefits will be for the health sector. There will be plenty of benefits for the health community if we tackle the causes of climate change. We will reduce this exposure to the conditions that are creating this vulnerability for our population, and we need to make sure as well that access to renewable, clean sources of energy, access to safe water and sanitation, which are the basic public health needs, are provided to our health system and our health providers in case of a disaster. I think we need to align as well around some action-oriented, orientation and strategic response, and of course, by default, collaboration among ourselves. Thank you.
Okay, fantastic response. Thank you so much for that, Maria. Let me move on to the panelist next to you, and that's Elke Meyerhofer. Thank you so much for being here. Now, I'm going to give you 4 minutes to answer the first of the 2 questions. There has been a lot of discussion whenever you talk about this, about building resilient communities, but you could argue that the goal is undermined by an insufficient knowledge of gender analysis. So how does that impact the ability of humanitarians to respond to the needs of other vulnerable people? And I'd like you to answer that within the context of your remit, please. Thank you.
Thank you very much, Juliet. Allow me to share 2 very specific examples, and one is actually related most recently to the earthquake in Turkey and Syria. So within a few days, the earthquake struck on the 6th of February, and on the 11th of February, the NGO Forum in Northwest Syria came up with the Rapid Needs Assessment called RIHF. And the idea of the Rapid Needs Assessment was to analyze the needs among IDPs, those that had been newly displaced as a consequence of the earthquake, and also those that had already been displaced before in the host community. And so what they did is they looked at, they looked at 15,000 IDP households, and they looked at around 604 communities in the affected areas in northwest Syria. Now, for each one of the 604 communities, they took one key informant and asked a specific set of questions. All right. They came up with a 17-page report, and the 17-page report indicated what were the priority needs, how were people affected. Not surprisingly, it was really cold early February. Winterization was a key priority for both IDPs, but also the host communities. And then there was a bit of a difference between the newly displaced IDPs who were also in search or who were in need of shelter, while the host communities were more interested in multi-purpose cash assistance. And I think we had heard before, the people, affected communities really appreciate cash. Now, I mentioned 17 pages, not one mention of men, not one mention of women, not one mention of persons with disabilities. And so health came up as a need, but not very specific. It just said, well, people are displaced. There's currently a cholera outbreak in Syria, as we know, so there might be an issue. Now, let me put that in context. Among the 8.8 million people affected in Syria by the earthquake, there are currently more than 130,000 women who are pregnant. And of these 130,000 pregnant women who have been directly affected, around 15,000 are going to give birth within the next month. And yet we have an assessment that did not look specifically at the needs of women. I dare say, if I'm a woman and I'm displaced, yes, of course, shelter is important, but hygiene is important. If I'm a woman who is menstruating and I do not have access to hygiene items, I will not be able to access services. If I'm a pregnant woman and I do not know where to access reproductive health services, it is an issue. And so I'm just highlighting that because with all the good intentions and the report obviously gives us a good idea about the needs, it really portrays a very male perspective and leaves out the very specific needs of women. Let me move on to Sudan. Quite a different example. So UNFPA, within the global coordination structure, hosts the gender-based violence area of responsibility. So we're coordinating GBV partners to prevent GBV and to respond to gender-based violence. And so we have a publication called Voices, and it is a certain methodology where every year we ask a certain number of key informants, we have focus group discussions, and we ask about gender-based violence. And the idea is really to establish trends. We're not looking at, incident data, prevalence data, but really what are some of the GBV trends to help us understand what the needs are. And so last year, we did this for the first time in Sudan. And we looked at where would a woman go to if she were a survivor of gender-based violence. And so in this Voices of Sudan's publication, what came out was women would first and foremost look for help within the family. They would look within the community. And if anything, they would look at traditional justice mechanism. Now, also in Sudan, there was a multi-sector needs assessment. And the multi-sector needs assessment was more quantitative. The Voices was qualitative, so this was more quantitative. And more of the respondents were men. And it came to an entirely different result. So that multi-sector needs assessment, 80% said, if a woman is a survivor of gender-based violence, she will go to the police. Now, that is an important difference because who of the two do you believe? And I think that the message really is, whenever we come up with a report and an assessment, we need to be very clear, what's the methodology?
Can I interrupt for a moment, please, because I'm very conscious of the fact that we need to stick to our time schedules as we have to set aside time
I'll just
for the general
summarize it with one
Q&A.
sentence.
If you could be very, very brief, because there's one other question that I wish to put to you.
Excuse me, sorry?
If you could be brief in your summary, because I have another question for you.
I'll just summarize in one. Different results depending on whether you talk to men or women. You always want to be clear because your response is going to inform how are you going to respond to gender-based violence needs, and therefore gender analysis is important.
Right, and it's a very good summary, and I hope that we'll have the time to actually look at that, the use of words. But my final question to you within this segment is whether you can give me a personal example, one personal example, please, of where a gendered perspective made a difference. 3 minutes, if you could stick to your time there, please.
All right. I'll try to be short. I had 3 examples. I will not have time. Let me look at the Horn of Africa. So yesterday we heard about the IPC. It was the FAO colleague who talked about the integrated phase classification that looks at different levels of food security. They just did a revision of the manual in 2021. And the manual does look at gender. It looks, for instance, at women and their dietary needs. If you're pregnant, if you're breastfeeding, you have specific dietary needs. What the manual does not look at is gender dynamics, right? So for instance, we know there are household dynamics that predispose women to certain gender-based violence. We know, for instance, when it comes to assets, women own less assets, women have less say, where do resources go? And the very same factors that expose women to food insecurity also expose them to gender-based violence. So now, what's the lesson learned? The gender-based violence at a global level area of responsibility came up with a manual where they said, we need to be better. We really need to look at the dynamics and say if there are certain dynamics at household level that will result in gender-based violence, we need to better understand why. And so it gives guidance to the people who are conducting the integrated phase classification assessments. It also looks at the gender-based violence practitioners, and it also looks at the food security people so that we can improve and better look at gender-based violence.
Elke, well done, and thank you so much for that. Let me move on now to your fellow panelist, Kit Dyer. Good to see you. My question, is there an absence of long-term thinking among humanitarians, given that what works today might be irrelevant in 5 years' time? You have 4 minutes.
Thanks, Juliet, and thanks, KS Relief, for giving me the opportunity to listen to some of the panelists and participate. The question's really quite simply phrased, but I think it's a bit more complex. It's a bit of a yes and no kind of context, I guess. Most of our humanitarian action is driven by funding, is driven by the principles and standards that we hold ourselves accountable to, and it's driven a little bit by organisational mandate. And by necessity, quite a lot of that is short-term and humanitarian. We have a life-saving focus. So on the one hand, a little bit yes, but we also then recognise that those life-saving activities don't happen in a vacuum. They happen to communities, to people who have had an experience before and who will have an experience afterwards. So yes, it might appear that often our lens is quite short-term, is we're only thinking to the next 3 months, 6 months, but in reality, we're trying to find these mechanisms to lengthen that lens. We talked a bit before, some of my colleagues here talked about the nexus programming between peace and development. That's something that's quite critical, and there's a lot of movement at the moment trying to figure out how we can do that practically and in reality. I think there was a good description a bit earlier about some of those really practical pieces around nexus programming, and more of those kind of opportunities will be coming up. I think there's also an opportunity for us to lift our heads a little bit from this short-term life-saving goal in when we look at some of the humanitarian architecture, and particularly around coordination. My colleague from OCHA talked a little bit about that. I think the coordination platforms do give us the opportunity to have a bit of a longer think about what we're doing now and the impact of it into the future. And the final piece where I think there's a little bit of an opportunity for us to perhaps do better is to really grab hold of some of the innovation that is going on in our sector. And I'm not talking mostly about technology, but about systems and processes. And I think some of the innovation that's going on around forecasting and insurance gives us, in the technical sectors like my own, a real opportunity to look into the future, to try and come up with these life-saving solutions for right now that do have an engagement with the future.
Okay, thank you very much. My second question to you, and you have 3 minutes. Is there any value in setting strategy timelines when you have no idea what's coming around the corner?
Yeah, thanks, Juliet. That was an interesting question. I thought a lot of the organisations now have resilience strategies. A lot of governments have resilience strategies for communities. And when I think about the timelines that we put inside them, there is a value to putting a timeline into any strategy. It means that we have something to be held accountable to. There is an action that we must take by a certain time. However, then recognising that the future is quite uncertain. We talked about this context that's terribly changeable. If we look at climate change, we've got some ideas of forecasting, but we really don't know what's going to happen a lot of the time. So the strategies we have, when we think about the outputs, perhaps, the outputs are a little bit set in concrete, but our outcomes are very much at a resilience kind of level. Then I think the timeframes we're talking for and the timelines we're looking for perhaps need to be flexible. And it's those actions that we also then need a bit of flexibility. There's a couple of really nice examples of this where we try and bring in the analysis that allows us to have the flexibility in our resilience strategies. I work for UNICEF, and we're looking at I think the short term is a CLAC, and I've completely forgotten what it stands for now. I think it's a climate landscape analysis for children. Sorry about that. That gives us the information that allows us to look at all of the sorts of things about programming for children, both in humanitarian action and development action, through a changing landscape. And it gives us that flexibility in the programming that if we need to change something, we can change something. If we need to steer in a different direction, we can. And then two other things I think offer us opportunity as well. One is the localization agenda. It's very easy to say that, but I think it's it needs to be really grounded with funding and with programming, because that's where resilience really happens. It's not at my level. It's when we're working with people on the ground. And the third area that I think is an opportunity is the changing support provided through humanitarian action, the changing modalities. We've talked about social programming and cash and voucher assistance. I think that is a real opportunity for resilience because it offers choice.
Okay, Kit, thank you so much for that. Manuel Pereira, don't hide. I can see you around corners. Look, thank you so much for being here. My question to you, and I'm giving you 4 minutes, is I want to get your perspective on these enormous challenges that humanitarian work is going to face in the coming decades, vis-à-vis climate change that we've referenced here, and also how innovation can contribute towards addressing them. 4 minutes, please.
Nope.
Can we have some sound on his microphone, please?
Hello?
Thank you. That's great.
Thank you, Juliet, and to KS Relief for being here. I think that there's a question of perspective first on my presentation. I invite everyone, maybe not now, to go to the internet and look at a model that exemplifies how our solar system moves through space. And that is completely different from the way that the majority of us sees where we fit. And it's exactly the same approach that we need to take vis-à-vis climate change. The interconnectedness between the physical processes and the interaction with humans and societies is different from anything that we have done. It's much more complex. And societies and communities are not prepared to address these issues. Innovation is very important, but in humanitarian assistance, there are things we cannot innovate anymore. It's very difficult to link access to technology, time availability, and scale, and still deliver a response that would be the optimal solution. We cut corners at all time. So innovation is always pushed to be fit for purpose or to be one step ahead of the basics. We are still discussing in 2023 plastic sheeting. That's one of the best things that can be done in an emergency, because you fold it, you put it in pallets, you ship it fastly, and it's how you use it, not the material. And so technology can have a role on that, on making people more aware of what's to come. And today was already referred the initiative of the Secretary General on early warning systems for all, but it needs more. We need to bring the changes on livelihoods. We need to bring disaster preparedness. No disaster is natural. A disaster can be a man-made technological incident or a natural hazard. It's how people in societies are organized and how they interact with this hazard that happens. People in floodplains get flooded. People in earthquake-prone areas that do not have building codes up to standard get damaged. Drought areas that do not have adequate management of water systems fail. When we don't take care of the ecosystems impact on water availability, on the rest of the biodiversity. So I think that the big challenge we have is to comprehend where we fit, how climate will impact these processes, and help communities and governments, above all, to tackle that in a structured way.
Okay, passionately explained. Thank you so much for that. My final question to you in this segment: how can humanitarian work contribute to better resilience, mobility and capacity to address the impact of climate change, environmental degradation and disasters? You have 3 minutes.
Thank you. I think that humanitarian work is at large a political act because it's always derived on a system not having coping capacity and asking assistance. There's many countries in the world where crises do not need this extra effort. So it's also important to do the groundwork before. We talk a lot about localization, but there cannot be localization just by getting people and hiring them after a crisis. It's building their capacity before, asking them what resources and what capacities they need if they face a disaster. This forward-looking planning is what builds resilience, because when you are discussing solutions, you are also discussing the root of the problems. And when you discuss the root of the problems, you have the door to change things. Humanitarian work many times contributes to that, but the notion of the need of humanitarian work can also build resilience. We should think that the presence of systems to address crises, led by governments, empowering communities, and putting people at the center of what one day may be that response will be much more transformative than any practice we write to arrive to a place and try to implement it. And this balance is where I think we need to keep investing on countries, on their capacities, on changing the systems, and progressively we will have less need of humanitarian assistance. We'll always need it, it's the world, but at least we can try to mitigate it.
Okay, thank you so much for that, Manuel. I can see a lot of people nodding in agreement with that, so thank you. I'd now like to leave the final comment to Sheikha Hissa Al-Thani, because she's going to give me a 7-minute response within the remit of what she does. 7 minutes, and just to the audience and the panel, of course, she will be speaking in Arabic. So to non-Arabic speakers, there should be headsets with translation. I believe that if you want to hear the English, it is channel number 5. So Sheikha Hissa Al-Thani, the floor is now yours. You have 7 minutes. Thank you. Sheikha, can you hear me?
Yes.
Yes, lovely. So you have 7 minutes. 7 minutes, the floor is yours, and I believe you will be speaking in Arabic. So 7 minutes, responding to what you've heard so far.
Yes.
The floor is yours.
Okay. I thought you would ask me. Okay, thank you. السلام عليكم ورحمة الله وبركاته. شكرا لمركز الملك سلمان والقائمين عليه لإتاحة هذه الفرصة لي للمشاركة. سأحاول أن أركز بشكل أكثر خصوصية على التحديات.
I would like to focus mainly on the challenges faced by the humanitarian world, work in the Arab world. I'd like to focus on 4 cases that needs urgent human aid. Now we are witness one of them these days. There are 4 cases that needs this help. War, conflicts, armed conflicts, included with loss of life, properties and injuries, also displacing and the need for shelter, natural disasters like drought, floods, and Somal is the biggest evidence. Volcanoes and earthquakes that has consequences of larger consequences. We up till the moment with the reaction that we cannot predict or stop. The economic crisis that comes from mismanagement or corruption, which prevents of preventing a huge number of population from resources and economic. This affects food, housing, and also medicine practitioner. And this becomes harder in these countries that they are deprived from the social protection and systems. If we speak about the challenges that face the human aid or the workers, we find out that the humanitarian aid that is given by institutional, and it's defined as immediate aid or help, and presented by UN agencies, often and usually the location is outside the Arab world and reaches those in need in the developed countries. And these are again outside of the Arab world. And here we have some unclarity. A lot of times these agencies and organizations, internationals, they don't use the wise use of the resources in the targeted countries. That's why it's always important to have partnerships with the governments and non-governments who are either not concerned in helping the citizenship. So partnerships is more effective if they are with the NGOs that are directly related to those who are in needs. Often, the humanitarian aid starts in the poor countries after the crisis from local volunteers who are not associated with any societies or NGOs, but they try to help. This happens without any planning based on their humanitarian feelings, and this might lead to duplicates and might lead to deficiency on long term. When there's a lack of investment, lack of direction in the local communities, all these help and aid goes in vain, and it results in depression of those volunteers, and they have less enthusiasm to do humanitarian aid. In other cases, there are political obstacles that affect the reaching out for the humanitarian aid. The difficulty of access and inaccessibility represent geographically in Yemen and other Arab countries. There is a problem, inaccessibility, how to reach there, us or those who are seeking information who may not get it or maybe receive misleading information. If we speak about difficulty of accessibility or inaccessibility of disabilities, it applies hugely on them. Sometimes we don't reach those affected from those disabilities. Organizing human aid includes huge partnerships with governmental and NGOs, volunteers, private sectors, and international community. And also it concludes organizing a huge number of help. All of this requires leadership and coordination and direction and proper distribution. Otherwise, this humanitarian aid will be an obstacle in the face of humanitarian aid. In many cases, a huge number of aid and volunteers who pours into the damaged area without any coordination or proper direction. It causes so many logistic obstacles and crowdedness and forms a threat for those who are inexperienced and how to behave in dangerous areas and add to the burdens of the lifesavers and aids. A lot of the Arab countries, they don't have not the proper safety equipment for people to rescue, and they don't have proper or enough training. We have seen in Syria the crisis where those savers, he tried to lift the rebels with their hands because they had no tools, proper tools. Rumors, news, is another obstacle. Sometimes in the news and the sources are trusted, and so either they exaggerate or make it less based on political criteria or using social media to spread rumors. and also to spread confusion in the society. This results in confusion of reaching the help to those in need. Influencers and celebrities on social media, sometimes when they show up on social media and also giving information that are not real, affects the accessibility of help and aid. Information is very important for those with disability. I'd like to add double the information for those elder people. Financing, I will just lack of financial aid and financial and human aid, and the gaps between the resources and the needs is getting wider and wider, and it will get even wider under such accelerating crisis. In the Arab world, we lack from the lack of human aid or presenting aid in different multi-parties. It's only bilateral, while we prefer to have the multi-parties with the other international organization under the Arab League. We also have a problem in localizing of response. A lot of people, that is a cultural adoption is an obstacle for presenting needs. I'm gonna stop now.
Response to my question. Can you also please show your appreciation to the panel, because I have put them under terrible pressure and they have survived the ordeal and it's not even over yet. Thank you. Because we have roughly 19 minutes, a lot of ground to cover. Are you ready? Tough if you're not, because my question to all of you, the opener, I don't care who answers it, but if you hesitate, I'm going to choose somebody. I'm looking at this from an outsider's perspective, but I get the impression that it's more difficult being a humanitarian now than at any other time. And given the multiple crises that you guys are facing, is it time to rethink perhaps how you do your job? Is it time for perhaps to get some new skill sets? And if so, what are they? Who'd like to tackle that one? It's a biggie. Maria, you look very enthusiastic.
Yeah, thank you very much. I will bring a word that is probably critical in this debate, is going back again to prevention. I think we need a massive strategic strategy of prevention all aligned, because we will be seeing more and more humanitarian disasters, particularly related to climate change. So I think we need to reduce emissions, go to the mitigation of the climate change, the causes of climate change, and that can already be a kind of barrier and obstacles to prevent at least some of the most critical humanitarian crises we are facing, and that are affecting so much the health of the people. So a call for, being a medical doctor, a call for prevention, prevention, and prevention.
Okay, would anyone else like to respond to this? The overall question itself, it's a more difficult job, but also, do you need a new set of tools to approach your job in a different way, an innovative way perhaps? Jesse? Sure, yeah. I think... Can we have his microphone, please?
I think we're here. I think we arrived, you know, and I think part of the issue when we first started looking at these new tools was we always looked for the weakest link. And so oftentimes we would say, we need these new innovative tools and new innovative ideas, and people would say, but where's the financing? And so then this is where we started having these wonderful talks with OCHA around how can we start to bring that type of resources to our country teams. And then the idea was, well, we don't have enough capacity in our own tools and our own selves. And we started to hear from Germany and the UK and Norway and Denmark and saying, we're here to support this change. We're here to support you with these ideas. We're here to start to bring these types of capacities to your country teams and to your HQ offices. And then we started to hear from today on our panel and from others that we need to do this together. We need to bring our collective resources together and start to be able to not just, as I said at the beginning, hope that the sum of our individual agencies will somehow magically arrive at this amazing collective approach, but actually sit down and have these conversations long before that these hazards had turned into humanitarian disasters.
Effectively.
Exactly.
Yeah. Would anyone else like to add to that? Oh, sorry, Lisa? And then, Kit, do you want to talk after Lisa? Okay, Lisa.
Yes, yes, I'll just say one thing. It's really a softer skill. I mean, there's technology we talked about, which I think we can integrate much better into humanitarian assistance, but as a softer skill, I would say listening. And that's something that I alluded to when we had a listening project recently to really see what is it that people, what do they need, how do we address those needs in a very different way so that it really addresses what they themselves say they need.
Okay, thank you. Kit. Microphone, please.
To add to what Lisa said, as well as the listening, it's the voice at the table. So it's expanding the skill set, but also the voices who are part of that conversation. And that's something I've seen change quite dramatically since I started 20-something years ago. That there's more youth at the table now talking. There's more people with disabilities actually have more of a voice. There's different languages at the table. And that's a big step forward, and I'd like to see more of it.
Okay. Sheikh Al-Thani, I saw you nodding in agreement. Is there anything you would wish to add in response to that question before I try to get to some other points as well in the time available?
نعم أريد التوقف.
I want to stop or encouraging, and I would wish to see that there are research, that they work seriously and find out the resources of faults and negatives and set clear, transparent strategies to work with. Also, to make sure that you have to integrate the development initiative with the aid, because what happened recently made us stay away from the development and focus on the aid. And I don't think that to have a larger pace of donation is the solution. I think is change of the scenario of the forms and the meetings. It has to be changed. Donors, they need to have practical scenarios. Shows the line that is presented. These aids are presented. Who took what and how to fill in the gap in order to reduce the gap between the resources and the needs.
That, Shaker. And also, Manuel, would you like to respond before I move on to the next question? Because I saw your head lowered and your hand moving, so I guess you were taking notes, or not?
Me?
Manuel, can you hear me?
Yes. No, I think that is the fundamental. The skill set is an analysis skill set, right? We need all kinds of skills to make this work. The day that humanitarians are one profile of one type, we are in trouble, because that doesn't represent the diversity of finding the right solutions for the diversity of people we interact and problems we interact. But I also think that what our colleague here said, changing how we interact, especially with governments, changing how we practice. We need flexible funding, because if we have a prescribed medicine of how to solve a problem, we can never think on how to find it another way. Edison said, it took me 100 times to find the lamp. I know 1,000 ways not to do it. And that's where we need to focus.
Okay, let me move on to another question. Ben, I'd like you to take it. And again, I would like the panel to give me your response to what he says. Because look, outsiders looking in, we feel that humanitarianism has a very strict sense of principle. But given the difficulties in which you're working, is there a risk that perhaps principled humanitarianism could be marginalized because there are so many complexities that you're having to deal with? You cannot approach situations in the same way. Ben.
Are you looking at me?
You are the only person on the panel called Ben, I believe.
I didn't hear your name, I'm sorry. No, I think what I think is, I'm not sure how to respond to that, in the sense that, I think by definition, the humanitarian response is principled, right? What I think really there needs to be, in a sense, is a new attitude. Because I feel as though, we talked again about kind of new skills, new people coming together, but I feel as though there's still too much competition and not enough collaboration among us actors, right? We compete for money, we compete for space, and we don't complement each other and collaborate when we all bring a diverse set of skills, right? And I think part of that is because, many of the actors were dependent on soft money, right? And so we fight for that soft money. I think that, so I think that's one issue, and I think that's an issue that, we honestly need to face and address, again, in an honest way. Secondly, I think, again, this issue of prevention is extremely important. Many people have talked about it. Again, I think there's a problem with incentives, because donors like the humanitarian response, because they like to spend the money and see the impact. It's immediate, right? If you focus on the root causes, it takes a long time to see the impacts. The efforts aren't immediate. You have to believe in what you're doing, and the incentives don't always line up, right? And so I think there needs to be really a reevaluation of some of our attitudes in terms of how we face the humanitarian issue, the kind of things we want to focus on, let's say, that we need to invest in things that are going to have a long payoff. They're not going to be immediate and visual, but in the end are going to end up costing us a lot less money and having a much more sustainable impact.
Okay then, and Elke, what's your response to that, please? Oh, Elke. And also, Maria, if you'd like to follow up on Elke's remarks to what Ben has just said in response to my question about principled humanitarian perhaps being at risk of being marginalised because the situations you're dealing with on the ground are so complex, you cannot approach situations in the same way.
It's a very difficult question, particularly when it comes to principled humanitarian response. But I mean, you also mentioned context, and it really takes me back to accountability and accountability for affected populations. And it is true that sometimes we think we have the solutions and we have the tools, and sometimes the solutions are really there on the ground, and what's needed is for us to empower people and to really listen to them. And I know, for instance, when we look at there's a global youth compact that, for instance, says very clearly, nothing for us without us. And I think that's really the principle for me. If I go anywhere in Sudan or here in Saudi Arabia, what do I really know? I mean, I have my skills, but I don't know the local context. And I need to listen to that older person. I need to listen to that woman, to the boy, to that girl, and really say, what is it that you need and what's not working right now? And I think that's ultimately, sometimes our processes are very cumbersome and very long in the planning, and then we tend to talk to each other and sometimes miss out on actually listening to the affected populations.
Okay, thank you. And Maria?
Well, I think in the last years we have advanced a lot in terms of coordination on a more strategic planning and preparedness and response, particularly on the health aspects of the humanitarian response. But still, when you see in certain communities that the donors will be maybe ready to give you financial support to buy ringgit lactate, for instance, which is you need to put it on a plane, you need to translate it to the place, and that's very costly. And maybe you don't have the resources to spend and invest on water and sanitation, which is the one that will be prevented at front the occurrence of a cholera outbreak. We have cholera-prone places around the world where we know that certain investments in terms of, again, prevention, preparedness, and readiness to respond will be extremely effective. So that's maybe one of the aspects where we need to balance and see where do we invest on preparedness, readiness, response, with a little component of the prevention part as well that we need to prepare for it.
Okay, thank you very much for that. The window on our timesheet is closing, unfortunately, but I want to put this question out to all of you. If I can start with you, Lisa, and then move it along to the panel before we go to the recommendations. Because look, again, the outsider's view that the humanitarian architecture has been blindsided by events that are not necessarily recent. So very briefly, how much of this current crisis was predictable? Lisa.
Well, I think what we've seen is evidence that 30%, not necessarily of this current, but 30% of overall needs can be predicted. We can look at climate. We see less so anticipatory approach being able to be applied to conflict specific. It can be applied to climate-related disasters in conflict areas or in fragile spaces. So I think that we can predict some, we can act earlier, and I think that's something that we need to do, and we've spoken about quite a lot during this forum.
Okay. Okay, thank you. Jesse.
Look, I mean, I think we've heard over the last 2 days a lot of the answers around what we need to do to deal with the current situation. And I think we all know in our own lives that working together is imperative for us to arrive at solutions. I don't think where we've arrived was a surprise. I think this is why we're here today. I think we knew that this was coming, and that oftentimes we really need to be able to be pushed against the wall in order to start making these big changes within ourselves, within our organizations, and with our partners. And I think now we have the tools in order to start to address this new future that we've arrived at.
Okay, so some optimism there. Ben?
No, I think some is predictable. I mean, a lot of around climate change is predictable. It's clear. Many conflicts are predictable. Some were totally unpredictable. COVID-19 was pretty unpredictable. Yet it's clear that many of the systems that were in place helped respond. And we can see how even if we have totally unpredictable crises, if you have certain systems in place, it can help respond. And so I think the response to COVID-19 for me, on the one hand, gave me a lot of hope because countries responded, and you could see how they responded, and it was in a very powerful way. On the other hand, a crisis like COVID-19 just really heightened and underlined the extreme inequalities, let's say, and the incredible effect it has in terms of setting us back in time in terms of on many aspects because of the unequal impact, right? So particularly women's rights, women's participation in the economy, it was set back decades, let's say, and in a number of dimensions. And so there's both optimism as well as
Okay, but look, thank you so much for that, Ben. And Maria, can I get your take on that question, please? My final question, in fact, that the humanitarian architecture blindsided by events that are not necessarily recent, so how much of this current crisis was predictable? If you could be brief, please, so that I can move it along to the rest of the panel.
To me?
Yes, thank you.
If you look at, from a health point of view, I mean, a humanitarian crisis related with a strong health component, I think we can predict many of the outbreaks related to the weather conditions. I mean, the collaboration with the World Meteorological Organization is telling us where the conditions are preparing for a cholera outbreak. When you have a lack of access to safe water and sanitation, it's not difficult to predict. When you have a problem of malnutrition, it's not difficult predict that you will have a humanitarian crisis. So that's why I think, again, we need to invest on the basic of using as much as possible all of those predictive mechanisms that we have for health, having a system for preparedness, readiness, but as well investing on what will be prevented at the source. And it's the causes of climate change. We need to reduce emissions. We need to invest on sewage systems. We need to invest on water and sanitation. And we need to invest on renewable, clean sources of energy that will reduce that dependence and will ensure us that in case of an emergency, we will have our health sector functioning more resilient to climate change, because no matter what now, climate change will be affecting all the humanitarian preparedness, response, and predictability as well.
Okay, thank you very much for that, Maria. Elke.
So let me be a little bit provocative. I've been a humanitarian practitioner for a very long time, and I would think that the humanitarian architecture is ever evolving. Where we are now is not where we were 10 years ago, and I think it's doing a fairly good job overall, but also keeps learning. The scope of the challenges is such that it's really difficult for the humanitarian system alone to be able to respond to it. And where I want to be provocative is, I think what we see is also a bit of a failure of the development system in many ways. And often when we hear preparedness, we think automatically humanitarians. Preparedness does not happen at humanitarian level. Yes, we can preposition and all of that, but it's really the push it back to governments, how are governments prepared when it comes to disaster risk reduction plans? How do they integrate the response? How do you build a system? If you have a supply chain system that even at the best of times is not working, it will not work during a crisis. And it takes us back to the nexus. I think humanitarian response works better if there's a strong level of preparedness from the development side, and if we can also phase out and hand over.
Okay, thank you so much for that, Elke. Kit.
I don't think there's much I can really add. The comments have been, every time I come up with something, somebody else has just said it.
It's called telepathy.
I really pity the people down the track. Anyway, I absolutely agree with everything everybody said, and I think I'll come back to the comment I heard on the first day, which honestly I should have known from ECHO, that 80% of people affected by crisis are affected by a crisis of conflict, not another kind of natural hazard. And that makes me think, wow. I think we are to a degree doing the job that we need to be doing as the humanitarian architecture, as the humanitarian sector. But there's a big elephant in the room, is the people who should be doing their job to stop the conflicts. I know it's not that simple, but there's a lot of work that can be done outside our sector to make our lives more effective and to do what we're supposed to be doing.
Okay, thank you very much for that. Manuel.
I don't think the problem is the architecture.
No.
The issue is that we are not listening to the architecture. A lot of the problems we face today are predictable and preventable if there is enough interest and political will and cooperation to make it happen, right? I'll give an example. In the International Panel of Climate Change on Annex 10, there's a map that says that between 2041 and 2061, a large center of the planet will be more than 100 days a year with temperatures above 35 centigrade. Large numbers, very large numbers of people in humanitarian settings live on these. We are being told that it's going to be impossible to live outside for 1/3 of the year. This is a graphic on an annex on the most important scientific report we have. What are we going to do about this? So it's not about the architecture. It's about the information we have and where to prioritize the most strategic interventions to save lives and prevent people to be in distress situations that stress the humanitarian environment and funding.
Okay, thank you very much for that, Manuel. And can I have the final word, please, from HISRA, if you could be very brief, because we are about to close out.
Okay. Thank you. هناك كثير من المقترحات التي قيلت.
There are so many issues that have been discussed and explained. The first point I would like to speak a little more about the Arab world is the humanitarian response, rapid response, because as of the crisis started in the Arab world, there was a regional response by the United Nations, and based on which, of course, there were local responses. After that, where are the local responses by the Arab countries, and not conditional to be like only the hosting countries? There are so many natural crises because of the climate change and others. So the question is, where are the local responses by the Arab countries, that they should always be the first country to respond across the Arab world, the entire world. The other point, I see that across the Arab world, there should be a joint action mechanism that we are always calling on, but I hope that this forum will produce a strong recommendation that there should be a joint action mechanism for Arab humanitarian action. We have so many regional organizations. I hope that they will all work under one umbrella, but based on which, of course, they should always work in tandem and cooperation in unison and in concert. Thank you so much.
Very much. I think it's fair to say that your remarks actually resonated with the audience. Can I just close this out now by looking at some of the takeaways which come from this, from the individual answers to the questions which I posed to the panel at the beginning, and also the responses now. First up, we need to increase international efforts to ensure serious commitment against obstacles at the humanitarian level in order to reduce the growing risks in conflict zones, emphasizing the importance of solidarity and strengthening partnerships in humanitarian action to meet the challenges of humanitarian work, so that a strategy for humanitarian intervention is developed in this regard. And the final thought, strengthening partnerships and also developing innovative solutions in the field of humanitarian action to reduce the repercussions of natural disasters, conflict, food insecurity, displacement and refugees. All of this can be addressed by developing mechanisms to deal with this challenge. Panel, you have your work cut out for you, not just for today, today, but for the rest of the year, over the decades to come. I wish you the best of luck, and hopefully if we meet again in a decade's time, perhaps even less, we can actually do a check on your progress. And I'm sure that the audience may also be involved in discussing this to see how well or badly you are doing, but I have great faith in you. Thank you so much. Please show your appreciation to our panel for a brilliant contribution. I'm so sorry to have rushed you all in your answers, but you were magnificent. Thank you so much for covering so much ground. Please, if you could remain where you are, because there will be another panel in a few moments presented by my colleague Liz Munro. Thank you. Oh dear.
which will be focused on data collection and analysis to support humanitarian work. We've seen with the recent earthquakes in Turkey and Syria that one of the biggest problems is figuring out data collection and the actual number of people who need humanitarian help. So the objective of this panel will be promoting innovative solutions to humanitarian challenges based on scientific evidence, best practices, and research. And with that, it is my pleasure to welcome Liz Monroe to the stage, who will be moderating this panel, and she will introduce her guests, and we will have a very informative session. Thank you.
Yeah.
Yeah. Yes, ma'am.
Risky, yes. Mr. Risky? Yeah.
The lights up.
Okay. Hello and welcome to this session of the third Riyadh International Humanitarian Forum. I'm Liz Monroe and I'm your moderator at this session. The session's called Data Collection and Analysis to Support Humanitarian Work. Now, I'm sure that when the average person in the street thinks about humanitarian action, the first thing that probably comes to mind is urgent food and shelter, water, medicines, doctors maybe. But probably the last thing to come to mind is the idea of data. Mobile phones eat data, but people can't eat data. They can't sleep on a bed of data. So the question is, exactly what is data in a humanitarian setting, and why should it be prioritized when people are hungry, homeless, and forcibly displaced? What makes it important? And how does it help populations living through a crisis? You know, drought, floods, earthquakes, or, as is usually the case, man-made crises such as armed conflict. Well, according to my panel of experts, whom I'll introduce to you shortly, data collection and analysis are actually pretty crucial tools. It made me think of this proverb, which I hope some of you have heard of. For want of a nail, the shoe was lost. For want of a shoe, the horse was lost. For want of a horse, the rider was lost. For want of a battle, the kingdom was lost. And all for the want of a horseshoe nail. So maybe data is that nail, and without it, there would be grave and unintended consequences. It's an important cog in the machinery helping to assess humanitarian needs, create solutions, and design programs, and measure the impact, the all-important. With unpredictable events like the recent COVID-19 pandemic thrown into the mix, already sophisticated methods of collecting and analyzing data have had to evolve. So with that, let's introduce the panelists. They're experienced, they're leaders in their field, They're distinguished, and they're also busy, but they've made space in their schedules to come here today and to contribute to this event, and we're really grateful. Thank you, all of you.
Thank you.
So they'll answer some of these questions, share good practice, and make recommendations for the future, which hopefully will benefit those people served by the wider NGO and humanitarian community. This will be out of order because I didn't know that this is how people are going to be sitting. Dr. Adam Moniem is currently the World Health Organization representative and head of Mission Saudi Arabia. Among his previous country offices were Yemen and Iraq, where, among other things, he was tasked with setting up healthcare infrastructure from scratch. We have Ambassador Mohammed Afi, who is the UNHCR envoy for the Horn of Africa, where there are currently more than 1.5 million refugees. He engages directly with refugees, regional governments, and political institutions, as well as the greater international community. And he advocates for continued international protection and increased inclusion of refugees in the countries in which they reside, and for more global investment in the region. None of this sending migrants back to Rwanda, as some Home Secretaries have been advocating. Balthazar Stierlin, after serving as the ICRC's Director of Digital Transformation and Data and being in charge of the organization's operations in the Middle East, Balthazar is now the organization's special envoy for foresight and techplomacy. Yes, that's right, techplomacy. Hopefully we'll be hearing more about it in a while. I'm really looking forward to hearing more about that. Too many bits of paper, sorry. I was doing so well. Doesn't help to have things printed both sides. I'm sorry, I'm going to ask some of the other people to... All right, Rain Paulson is Director of the Office of Emergencies and Resilience. He has a wealth of experience from various UN roles as far afield as Panama, the DRC, Haiti, and Rwanda. By the way, he studied at Warwick in the West Midlands in England. I'm from Birmingham, which is not very far away. So I've got a special greeting for him from Birmingham. Hello, Bab. Leith Baker leads a USA disaster data assessment and information management team. After 20 years serving in field operations for the United Nations and NGOs, he now provides technical guidance on data coordination and technology to improve humanitarian outcomes. Mohammed Rizki, welcome, is Global Coordinator at the International Organization for Migration and Displacement Tracking Matrix. I'm looking forward to hearing more about the tracking matrix. It sounds like something out of a film. Data responsibility and aspects of accountability to affected populations around data works are key issues for the IOM. So that's our panel. And my first question is in your, all your areas of humanitarian work. What is data and how do you use it? What are the benefits? I'll kick off with you.
Okay. Thank you so much, Liz, and I'd like to thank King Salman Relief and the organizers that despite the not so big number of sessions, data and collection was a standing point in the agenda here. As you mentioned, I served in two big humanitarian emergency countries, Iraq and Yemen. And the first thing I do when I took office on those two locations is I say always, health information system and data is my right arm, and communication and visibility is my left arm at the onset of emergency. Everyone wants data. You need data to be collected adequately to quantify the impact of the problem. Donors need data and ask them about us rigorously to, first of all, measure the size of their support, and also follow up the impact of their support by establishing a cross line of where did we start. But it's not that easy as you think at the onset of an emergency to collect accurate data. The speed, granularity, the source, and the volume of data that is required at the beginning of each humanitarian operation really not only depends on the situation on the ground, but also depends on your ability as an organization to access, your dependence and reliance on local sources of sometimes data that you have to rely on, and your ability to validate and triangulate this data to ensure its quality, because every stakeholder that you meet at the onset of an emergency, sometimes some of them want to magnify and amplify the problem for more gains and more donations. Some of them want to downsize it for their own benefits and downplaying the impact of the emergency. But where is the reality? It is up to agencies like the eminent figure sitting here, UN agencies and others, to really reflect what's actually happening on the ground in a very constructive manner. Now, if we're going to rely on regular methods of collecting data, the normal ones that we usually do by, surveying and or having handout questionnaires, or, sometimes this is not achievable. As I said, there could be problems of access, there could be problems of triangulation and quality. We have to have another avenue of doing that. Our ability to collect data in any emergency setting starts very limited and increases with time with the use of innovative technologies. And I think many of you can see what happened that at the beginning of an emergency, that we don't have that sizable amount of data, and this happens that this leads that most UN agencies and most humanitarian organizations start, sending things, supplies and kits and equipment and drugs at the onset that we see sometimes. Some of them are irrelevant, there are duplications, some of them are not used properly. So with proper analysis of data, you will be able to support and use the resources in the very most efficient way to help that country come out of this crisis or that. So I really, and maybe in a follow-up question, will mention how much innovative technologies have improved the lives. And I can mention one thing before I give it back to you, Liz, is that you remember all what happened during COVID-19. Probably without having the daily number of injuries, death, the locations, on a graphical information system, together with using the mobile technology on sending SMS, sometimes, medical messages for people, sometimes messaging them using SMS or mobile applications for collection of data. Without these innovative technologies, our ability to quantify the problem would have been less and less. After collection of data, we do have the analysis part, which really needs to be done by professional, adequate, in an adequate manner. In WHO, we have tools, and we will come up to those tools like the HIRAMs and others, by which we can quantify the problem. But to be able to analyze using those tools, we have to have a good collection of data, adequate enough for the tools to reflect real data on the ground. Thank you so much, Liz.
Okay, thank you. So the need for professionals to avoid irrelevant stuff being sent out to the humanitarian zone, and the importance of data. Balthazar. The ICRC works in the main war zones around the world to protect and assist affected populations. What's specific about the use of data in armed conflict?
Thank you, Liz, and allow me first to thank the King Salman Center and Dr. Rabea, to the ICRC and for the organization of this great forum. It's an honor to be here alongside many friends and colleagues from the Red Cross and Red Crescent movement. And the topic is extremely important. We live in a data-driven society. We live in a data economy. It has reached, many years ago, the humanitarian sector. But allow me to start with a provocative thought. And it's a thought informed by our reality, that is the reality of war zones. Data, clearly, is the new oil, it was said. It is potent, it is power, it allows us to act. But data, unfortunately, is also the new asbestos. So the way humanitarians use data, and here I take a perspective of an organization that doesn't only work in humanitarian aid, but seeks to protect people, is incredibly important. So the ethical way of using data, of ensuring that the data isn't used against people, seems absolutely crucial from our perspective. I think my colleague gave good examples of innovative technologies, and I think we must embrace them as humanitarian sector. If I think of our practice, we try to reunite families separated by war. We use, for instance, digital matching. We use machine learning, artificial intelligence to find incomplete and sometimes fuzzy data sets, to find missing persons. This is a fantastic use. We use satellite imagery, deep learning to look at displacement pattern. We look at the post-seed distribution. We can look at the indicators of the vegetation on whether this distribution had humanitarian impact. These are all examples, and I could give many more, where humanitarians, I think, have to lean into technology and use the data. And it's incredibly important. But the power of data means also that data can be used against people. In the humanitarian sector, we often talked about the do no harm principle. It was a key principle for decades. And I think as a humanitarian sector, we have to translate the do no harm principle in the do no harm in the digital sphere principle. And I'm afraid that discussions on that dimension, which I would like to add to that panel, need to be led with great seriousness, because if in a peaceful society data falls in the wrong hands, it can be embarrassment, it can of course harm, but if data on prisoners, on people fearing persecution, on minorities, on victims of sexual violence fall in the wrong hands, it can be really a matter of life and death. And that means our trust that the people have in us, but also in war zones that the belligerents have in us, hinges, I'd say, on our capacity to manage the data in a thoughtful, responsible way for the people, never against the people, never allowing that these data are used against the people. I can come back perhaps with greater details on also how the Red Cross and Red Crescent movement thinks about it. What does that tangibly mean for our way of managing data, the data protection standards, the policies, perhaps certain legal questions that we ask ourselves, but I didn't want to be overly long in my introductory remarks and give it back to you, Liz.
Thanks very much, Balthasar. So basically, in parts of the developed world, our biggest fear is privacy in terms of data. But you're saying, on the one hand, it's the new oil, and on the other hand, it could be as lethal in armed conflict because it's used as a weapon against the vulnerable.
That's correct.
Okay. Rain. Your area is food and agriculture, where interventions are time-sensitive and require storage and transportation. How important is data collection and analysis in that sphere of emergency provision?
Liz, thank you so much. And let me just start by expressing profound thanks to the Kingdom of Saudi Arabia for hosting this important event. And congratulations to Relief for the leadership you're providing in this space and the great collaboration. I'd characterize data for FAO and the work that we do as lifeblood. And in fact, without it, what we try and do in support of vulnerable households and in support of assuring food security is not able to live. It's not able to function. As my colleague Dr. Davis was mentioning in the earlier panel, there's a specialized agency that leads international efforts on fighting food insecurity and fighting hunger. We work on multiple levels. Some of that work is at the policy level, normative work. You obviously need key data to provide support to member states and members to guide decision making, whether that's around what to do in the context of challenges around fertilizers at the moment. We map soil data around the world to understand the right type of application of which mix of fertilizers will have the optimal impact to allow crops to be grown as we'd like them to be grown. We track key commodity prices through the agricultural market information system to support policy decisions at that level. So all sorts of applications. I mentioned just two at that sort of level. The area that I focus on for FAO around emergencies and resilience work, for us too, in an operational sense, data really is the lifeblood. As you mentioned, Liz, agricultural interventions are time sensitive. We're led by cropping calendars, by seasonality, by different seasons and their impact on livestock and what's required for those livestock to thrive, be healthy, and survive in those types of contexts. Understanding what's happening is vital. Data then is indispensable for us in that regard. Let me maybe just say quickly a few things about different types of data needs in advance of a disaster event, during a protracted crisis, in the aftermath of disaster, and also some reflections on data and information from programming. So we think about data for programming to inform decision making, and also data from programming. If I think about the imperative need for data, and here I should say it's not just any data, it's obviously quality data with the right type of granularity that's shaped and packaged and positioned in a way that allows decisions to be made from an operational perspective or from a policy perspective or from a donor financing perspective. In advance of a disaster, we had reference in the earlier panel, in earlier discussions, to anticipatory action. An ability to understand what's happening with rainfall trends and patterns allows us as FAO to work with partners to inform communities that may be impacted by an excess of rain, to take the decisions that they need to protect their crops from flooding risk, to make the right decisions to allow livestock to survive. So it goes without saying that you can't have good operational practice without good data, and from an anticipatory action perspective, that's certainly true. During a crisis event, I'm thinking, for example, about the work we're doing at the moment in drought-affected areas in the Horn of Africa. Understanding what's happening to rangeland and what that means for the interventions that we need to put in place to provide fodder for livestock to enable them to survive, or indeed access for water for livestock to allow them to survive. All of these things are driven by an understanding of rangeland changes, in particular geographical locations. Again, we can't program in the blind. It doesn't make sense. It's just simply not possible. When a disaster strikes, thinking about these terrible, tragic events with the earthquakes in Turkey and the impact that is taking place there. Understanding what that has meant for productive infrastructure, for irrigation systems, for market access roads, for all sorts of different parts of a system that are indispensable for an agri-food system to function. Data for us is indispensable in this regard. On the FAO side, we have a number of different tools, best practices. I know all the organizations here place a premium on these. In FAO's case, we have a particular flagship tool called the Data in Emergencies Information System, which is really a space to bring together data in advance of an emergency, historical data that allows us to do disaster impact modeling, as well as information that tells us about a specific event and its consequences. It's a space where we collect the information that allows us to make decision making. I would say that I think key to all of our success in future, and this has certainly been at the heart of the way in which FAO has designed the Data in Emergencies Information Platform, is this question around interoperability, right? If data is important for us, it's important for all of us. We are also hungry for quality data from other organizations that can complement or triangulate or even, modify the information that we have. And so data is important in and of itself. It's important for us for our operational decision making. I think we really need to understand data also as a global public good with all of the ethical responsibilities that come around that too. So again, there's much more I could say on these points, but I think it's really important that in these 2 days, this particular topic is one of the ones that's been prioritized for some of the reasons I've mentioned. Thank you, Liz.
Yeah, thanks, Rain. So essentially, data is the lifeblood of food security. Who knew that soil data was so important in the sort of nexus? I suppose that because of what's happening in Ukraine, it's sort of brought to the fore the subject of food security and insecurity, and it's sort of challenging us all, isn't it? You mentioned the Horn of Africa. Ambassador Afi, could you just build a picture of what things are like there and how you interact with data that's been provided?
Thank you very much, Liz. I would like to join my colleagues also by paying tribute to King Salman Center.
Is your mic working?
Yeah, it's okay now? Thank you very much. I'd like to join colleagues also in thanking for the honor to participate in.
Just to be nearer. Okay.
Okay. I think it is it's important to underscore this topic and the importance it has for UNHCR. In the Horn of Africa, we have 5 million refugees, nearly 5 million refugees. We also have nearly 13 to 14 million between IDP population in the Horn. Now, if you look at that, that is nearly fairly a quarter of the global displacement. And what we are talking about is people fleeing homes in search of safety across borders, or people who get internally displaced. Now, data is very central to the work of UNHCR. And yesterday, the High Commissioner spoke about protection of refugees globally, but more particularly now in the Horn. And the use of data is very central to our work. From the time people flee cross borders, from registration of those people who come to seek for support and protection across their borders or even inside as IDPs, from profiling them in terms of trying to understand who they are, where they have very unique circumstances and needs, and sharing that with the receiving states. This is quite central, and as UNHCR, as you know, we are a lead agency in terms of providing and supporting protection for refugees. And we know now that the biggest protection tool to support refugees is inclusion. Now, inclusion in the national budgets, the national plans of countries receiving this population, be it in education, be it in health, be it in livelihood opportunities or employment. Now, all these efforts to provide support to refugees, to IDPs, require quality data. And we have used this in a very, very significant way. Now, there is evolving technology, and therefore I think there is need for all of us to work very closely with the researchers, with the scientists, because every other time there's evolving new technology in terms of advising the use of data or even collection of data itself, the analysis of data. And I'm sure that the researchers in this room or the private sector, particularly partnership, is quite crucial in this. We have also understood that the use of data can be able to help in early warning systems. We are dealing with a region which has climate shocks. Now in our region, in the Horn, we are facing the worst disaster in terms of drought in 40 years. Now, if we carefully used modern scientific data, perhaps we could be able to mitigate some of the difficulties now we continue to see to receive. For instance, the use of water resources, the use of facilities that can be able to cope up with health facilities or even farms. And we continue to partner ourselves now with agencies like the World Bank. So now in Copenhagen, we have a joint partnership between the World Bank and UNHCR, where we have become a catalyst for states in terms of providing them with up-to-date data for their planning purposes. We have seen in most of the countries, particularly in our region, the use of data has been very significant, particularly in Kenya recently, where we had the first census in the country, which had categorized a whole column on those people who have been displaced, so that once the country begins to plan, the ministries of treasury or education, they know the significant number of people who are non-Kenyans, but who live within the country as refugees. And therefore, it has been very significant in terms of the use on the relationship. So it is quite significant. And I hope that we can be able to help member states in trying to improve the capacity and the management of their data systems. Thank you very much.
Thanks very much. So you're at the sharp end of it, and you're seeing benefits already from the use of data, whether it's the census in Kenya or, finding solutions for displaced people.
Absolutely.
It's in operation right now.
Thank you.
Okay, Leith. Data in your world, how is it helping?
Thank you, Liz, for the question, and thanks to KS Relief for organizing this panel, which in my opinion, is on one of the most important challenges facing the humanitarian community, and that is the evidentiary basis upon which we make all of our decisions. My colleagues have given a number of excellent examples of how data is informing their operations, and I want to take it a step forward and add on some of that. We've seen tremendous progress with humanitarian data over the last decade. The investment, I've been in this in humanitarianism for long enough to really notice the investment in monitoring and evaluation systems over the last 10 years. All of our partners now have very mature, robust investments with staff and systems and technology to monitor their programs. That wasn't there a decade ago. We see new technology, mobile data collection is now very common. We've got a lot of digital data available very quickly in operations. We see more and more staffing. We've had some great descriptions of new teams. At some of our partners, we have more data scientists, more data analysts being hired into the system. And there's more standalone projects and organizations that are dedicated to creating data. So it's tremendous progress. But we may be at a moment where it's a good opportunity to step back and assess, kind of take stock of where we are. And I feel like we're at a bit of an adolescent phase where we've got all this new capacity, we've got all this data, we've got these tools, we've got this staff. We don't always know quite what to do with it and how to make it add up to what we need. I work for the Bureau for Humanitarian Assistance at USAID, and my team is looking at the Bureau's investment in what we call the humanitarian data ecosystem. So all those projects and partners that create the data assets that humanitarians use to be situationally aware and stay coordinated. And we've been doing some reflections on what's the ideal state of that ecosystem? What are all the services and tools and frameworks that humanitarians need in order to be properly served, in order to properly have the data that they require? And in that reflection, we've come up with sort of three opportunities for effort. And the first is around leadership, coordination, and accountability. As we've been trying to work out for ourselves, what are the priority gaps in this ecosystem, we see that really the whole humanitarian community at a global level would benefit from more leadership and forceful coordination to ensure that we're all pulling towards a common set of goals for a comprehensive and coherent solution. Second, we see a lot of opportunity for data literacy. There's been tremendous conversations here the last couple of days about anticipatory action, about the use of evidence and data. But there's a reality that our decision-making processes and the humanitarian workforce don't always lend themselves to using these new systems, using the data, using the evidence, and so there's a body of work to be done there. And then finally, we see, again, in this adolescent phase, there's an interoperability challenge. My colleague mentioned it. And interoperability is this idea that the data that we have from many of our partners is locked in spreadsheets on people's computers. It's locked in systems that are sort of special to these institutions, and it can be very challenging to bring that data together across time, between projects, across partners. And that inability to bring the data together is inhibiting our ability to do predictive analytics, to create the frameworks and decision thresholds that will drive anticipatory action. And there's just tremendous opportunity to resolve that. We see three kind of exciting opportunities in that space. One, many of BHA's partners are investing in internal systems. The DTM, the Displacement Tracking Matrix, is making some really exciting, deep, under-the-hood investments in their databases and their tools. That's going to mean that their data within their systems is interoperable right off the bat. We see that with lots of other partners. That's a really important and exciting investment. We also see an opportunity for common technology platforms that the humanitarian community can use for common business processes. Action Against Hunger Canada is creating the Smart Plus platform for SMART surveys, are the malnutrition prevalence surveys that are done all over the world. And right now, in any country, they're administered very locally with local technology, local questionnaires. They're building a platform where those surveys will be administered on a common web platform. That's going to promote interoperability right out the gate. It means that all those results will be discoverable. They can be checked over time. Lots of great opportunity there. And then third is the softer area of data standards. We talked about doing no harm. There's a lot of opportunity to create standards around data protection, interoperability standards, and again, it brings us back to that governance and coordination and the conveners that can bring us together to find those standards as a community.
Okay, thanks a lot, Lee.
Thank you.
So basically, there's a wealth of information out there, but there needs to be a bit more coordination and sharing and a better way to exploit that information.
Mm-hmm.
Okay, and now we come to Risky. The displacement matrix, tell us about that.
So the DTM, Displacement Tracking Matrix, we collect and analyze data in crisis situation to inform evidence-based response, basically. We have currently over 90 countries of operations where we collect data regularly. We have a large network of around 7,000 enumerators, so data collectors that are connected to hundreds of thousands of key informants at community level. So we try to bring data right of the affected populations for analysis. And the work that we do, I mean, the way I see it, like from our perspective, data is what's driving evidence-based response. It links very closely to the accountability to affected populations. We're trying to answer the needs, the actual needs of the affected populations. In that sense, all the different agenda that supports on accountability needs to be part of the mainstreaming of the data work, the whole data supply chain, so to say, including localization agenda, bringing the agency back to the affected population themselves, including going on extra mile in terms of validating humanitarian analysis back to the community, for example, asking them questions. Look, we asked you the questions before, we analyze it, this is what we found, you think it's right? Yeah. So doing that, extra miles approaches that will strengthening the agency of the people. One side of looking at the accountability to affected population, the other side is looking at the accountability of doing data work itself. The whole data supply chain has associated risk to the affected population. We are now in, I would say, uncharted territories because the technology advances is increasing at a very fast pace. Accessibility to technologies are immense, more than a decade ago. There's a lot of things you can do with data and analysis using new technologies, but there's also a lot of risk in terms of causing more harms to the affected population. So, responsible approach across the whole, I mentioned data supply chains, but the whole processing of designing, collection, analysis, storage, all the way to the use of data needs to be scrutinized, and it needs to be done in responsible way. More questions need to be asked, more demands of transparency, accountability, inclusivity, and so on needs to be there the whole way. And the most important thing is what I was saying, like we are in uncharted territories. So we know the risk, but we don't know the full extent of the risk. There's no way anyone can do this alone. We have to do it together through partnerships, through connections with all the different initiatives from different agencies and governments. Because we are in this together.
Yeah, thanks a lot, Rizky. So essentially, it's all about reiterating the message of sharing information for the greater good in a humanitarian context. You mentioned there accountability and risk. I wonder if we could, each of us, just talk about what that means in your particular setting. What risks are there associated with data? So I'll start from you.
Yes, again, Liz, let me just engage the audience in some of the practical things that we face. One of the main tools when we rush into a setting is that we want to measure the health resources, the service availability of different facilities on the ground. In terms of health, that could be primary health care centers, hospitals at different levels and different specialities. And in order to do that, we need to collect data from those places. And my question to you is that sometimes it's very tough to go into places. So therefore, as I mentioned before, the use of innovative technology helps us to present transparent, efficient, and honest data. And I'll give you some examples. We use graphical information systems to display the geographic locations of the problem, to quantify and shape our proposals to donor to specific locations. We use satellite to overcome the problems of internet disruption and the unavailability of reaching people in some isolated areas. Satellite technology is crucial for us. We use biometrics sometimes to make sure that whoever is intended to receive the service is the one getting it without fraud or listing some false names in the process, which happens in many settings when we face them. We use sometimes crowdsourcing to sense the general feel of people and their problems in places that we cannot reach. Without those innovative technologies, we couldn't move further. And finally, we sometimes use predictive models like using artificial intelligence, machine learning, to predict sometimes the future needs of some places based on what we have collected. All of these enabled us to populate this HIRAMS, what we call the HIRAMS, the measurement of service availability and resources. And I remember very well when we were meeting donors on monthly basis in Yemen, when we first met them, they were really concerned about data. You know, donors, agencies, they love data. Without them, they feel that they are not getting sense of what's happening on the ground. especially these types of stakeholders, apart from governments and NGOs and others, those stakeholders sometimes are not able to be on the ground to see what's happening. Yeah. So there's always a doubt, either exaggeration or downplaying from both sides of what we are reporting. And the only way to prove that what we are collecting is right is our ability to not only collect adequate data, but to update it frequently. So can you imagine when we went and the first, I think we did this service availability monitoring 2 times, once in 2015, then on 2020. And we kept keeping the same message that this service availability, the results of it in Yemen was 50% of the health facilities are functioning. And it stayed for that long, for 2 years. And every time we meet the donors, they say, it doesn't make sense. We are pouring money into your services. So when we started using those innovative technologies, relying on other sources to compile a new service availability monitoring to update frequently, everything opened up. We were seen as transparent. Quantification of the problem happened. Donors became more open, and we stopped using the quote 50% because it has improved, and more than 70% were operational. This applies on, and when we mean operational, we measure power, we measure water, sanitation, payments for healthcare physicians, the building status of the health facility, so they get well informed and start believing in our data. So therefore, I really recommend that not only the collection of data or the analysis of data, but the frequent, honest, transparent update of the data over time enables us to judge our work and enables donors to evaluate the impact of their donation and enable agencies like Chaos Relief to really choose the places and the countries and the services that they are able to make a huge impact and maybe get a better grip on the indicators or the health indicators of this country. Finally, I will just end up by saying that all what we've mentioned in many countries sometimes cannot be updated or even collected in the way we want. But we will try and we will push, because without data, without proper, honest, quality data, you will never be able to fix the situation on the ground. There will be a great waste of resources, a duplication of efforts, and we will go nowhere. So please, my advice to everyone here in the room, if you're working in an emergency setting, first focus on collecting the data, quantify your problem before making the intervention. Thank you.
Yes, thanks. And the thing that you haven't mentioned is the fact that you set up a health infrastructure in Iraq and in Yemen. Could you just tell us very briefly about that?
Yeah, I mean, this was, sorry for that, I don't know if this is working. Maybe you took the mic, yes. Now, when we started working on COVID-19 in Iraq, the whole thing blew in our faces. Everyone was in disarray and we didn't know exactly what happened. I brought up the health information manager in the team and I said, listen, I need a platform, an honest platform of the number of fatalities, injuries, the locations, the epidemic, the contact tracing, and so on. And we began building this together, but we need another arm, which is the Ministry of Health. So we went into the Ministry of Health and we had a gentleman agreement at that time that we will report exactly the numbers. Because, you know, COVID-19 has an economic tail attached to it. When you spread fear, you know, people stop working, economic conditions become worse, people are afraid to report sometimes numbers. So we had this gentleman deal, and I told him, if you get me the right numbers as a ministry, we will put it on a platform, digital, accessible by everyone, donors, embassies, stakeholders, people who are interested. And not only this, but we will also use machine learning and predictive technology to maybe estimate the future number of people who can be infected given the current trend. And we did that. The digital platform of data brought us a lot of funds, was able to estimate the number of vaccines required, and at the same time was even our regional office, you know, when they looked at the platform, it was really replicated among other countries as well, and it became the norm in reporting this. I'm not saying, but the key was honesty, transparency, as you mentioned, Liz, between us as an agency and the Ministry of Health on the other side. Same thing happened on vaccines in Yemen. We had a gentleman agreement with the ministry that we will try to vaccinate despite the misinformation and disinformation, the anti-vaccine campaign that was happening. But because of the agreement that we had and the push that we made, by putting the number of people to be vaccinated on a platform, on a similar platform, people are seeing how many people are vaccinated, how many are against infected, and where are the locations of infections against those locations of people who are being vaccinated. They came to their senses, especially in the southern parts of Yemen, that vaccines is doing the trick, and number of vaccines began to improve. So these are two classical examples of my experience there.
Yeah.
Thank you.
Honesty and transparency making a difference
Absolutely.
to data collection. Balthazar, this is one of your areas as well, isn't it? You're, you know, in the West, as we mentioned, privacy is a big issue, but as far as you're concerned, the risks are very different. How high are the stakes?
Thank you. And to echo what panel members said, data absolutely crucial for prioritizing, for decision making, undisputed how vital it is, and the progress we have, I think, made in the humanitarian sector over the last decade also, as Leith has said. But I think for this discussion, we probably need a different granularity when we talk about data. And allow me perhaps just to say two words on what type of data do we talk about. I think if Rain mentioned, for instance, soil quality, the sensitivity of soil quality is, of course, totally different than if a tortured prisoner talks about what he endured at the hands of a detaining authority. So I think humanitarian data as a big bucket is perhaps not precise enough to talk about the risks. There are different data sets, and that leads me to really talk about personal data. And the ICSC, with our work, we have a lot of personal data that are incredibly sensitive, and we need to ensure that we have standards, and here I echo what you said on transparency, by which people who give us the data can hold us accountable to. They give us data. If I give data to an application and get free services, that's my choice. I live in Switzerland. The risk is limited that anything happens. But if people in an extreme vulnerability give their data to humanitarian actors, they do not always have a choice. I would even argue they mostly do not have a choice. So the responsibility that the people who take the data, that remains the data of the people, and here we have to be people-centric, is engaged and requires on the personal data verifiable, strict, clear standards, due diligence, and I think humanitarian actors that collect personal data must have verifiable standard. That is just, in today's world, an absolute professional requirement that I would plead for. This people-centric approach to data means also that we shouldn't only talk about data, how do we use data? It's not about us. I mean, it's also about us because we try to have impact, but it's essentially putting yourself in the shoes of the person whose data we take, or data that has an impact on them, and how we then manage the data. So we do have to think, especially in war zone, not only what we do with the data that people entrust to us, that trust is incredibly important, but how could that data be used by others, negative perhaps actors, or actors that could have an agenda against certain populations. Biometrics, incredibly good example. We have also biometrics policy. We use biometrics, but very carefully. Why are we?
Could you just explain biometrics to people?
Biometrics is basically elements related to the physiology of it can be pupils, fingerprints that allow you to identify a precise individual. It's very important. Facial recognition. You have different elements that would help you to identify people. It is used for relief distribution and others. But we have seen that, for instance, in Afghanistan, after the withdrawal of the coalition, the biometric machines and probably data sets fell in the hands of the Taliban. I don't know whether anybody was put at risk by that, but I think it just illustrates that if you collect data, you have to think what happens to that data, and you have a responsibility that is engaged. We live in a world where also cyber attacks are on the increase. People may just blackmail you, ransomware attacks, distributed denial of services, but we do also have, and we suffered an attack at the ICSC, targeted, sophisticated attacks of people who want to get you to your data. Is data only personal data? No, there is other types of sensitive data. The ICSC speaks to warring parties on conduct of hostilities. We are in dialogue, we have 23,000 people on the ground. They see things, the conduct of hostility, possible violations of the rules of war, negotiations with armed groups, etc. That's not personal data strictly sensu, but it's incredible sensitive data. So I would sort of say, namely organizations, and there are different degrees of sensitivities and responsibilities, because we have very different organizations with different mandates sitting here. But I would nevertheless say that we have to be incredibly thoughtful about how we use technology, how we the chain. I think Rizky mentioned the whole chain of data from the collection to the management to the use. We have to be incredibly thoughtful, transparent, in order that as a collective, we can really ensure that the way we use data and the way we avoid that others use data for negative purposes is in the interest of the people. It's about the people. It's not about us. And perhaps to conclude, the Red Cross and Red Crescent movement that brings together the different components recently adopted a resolution in its meeting where we basically put forward a policy request. And I hope that others in the humanitarian sector will embrace that policy request. And that policy request is relatively simple. It basically says we would like that humanitarian data is only used for humanitarian purposes, which means never for other purpose that would go against the people. And I hope that we will be able to carry that forward in our dialogue with the states at the next International Red Cross and Red Crescent Conference. Thank you, Liz.
Yes, okay. Rain, is risk something that, is that a factor that you take into consideration in your area of work?
Without a doubt, and in fact, if I could build on these very good comments from Balthazar, I mean, indeed, organizations have different mandates and collect information for different purposes, but any organization that collects information down to the household level and the individual level has moral, ethical responsibilities that need to be delivered. And it's also the case for FAO. We collect a significant amount of household data for obvious reasons. To inform programming, we need to understand what the impact of disaster situation is on particular households. But also FAO, for this reason, has made some strong commitments. Indeed, just last year, July 2022, we updated our data policy. And I wanted maybe just to mention the 4 guiding principles that we have that run through that. And in fact, touches on a number of the points that have already been mentioned. The first of those principles is around fairness, right? That we collect data for a specific purpose. I think we need to understand data is not something essentially neutral, right? There is power that can be used for good or for bad in data. And so, we talk in another global sense often in the world around a need-to-know basis. Really, we should only be collecting data for specific purposes, right? There's a reason why we're collecting this, and we need to have integrity around it. So collecting a minimum amount of data, using it for that purpose, and with the consent of the respondent, although I think these power dynamics that Balthazar was mentioning are very important considerations. A second key principle around integrity, which is the obligation that we have to ensure that our data is accurate. If we are made aware of the fact whether it's through triangulation with other sources or through other means, that information that we have is not correct, we need to correct it or we need to delete it. Again, all of these principles speak to the obligations that we have, the duties that we have around the data that we're curating and that we're stewards of at a point in time. Thirdly, security. With some of these data risks and challenges that Balthazar and others were mentioning, we need to make sure that we are doing everything we can to protect the data that we are storing. And the fourth key principle is around transparency. Be clear about what we're doing with the data, why, and communicating that openly. So again, there are international standards around data protection. I know many organizations are signing up to them. I mean, really, perhaps a headline message here is just to say this is not something around which we can afford to be anything other than entirely rigorous and extremely principled, regardless of the specific operational mandate that our organizations have. The data that we use is important on a number of levels in that regard. Thank you.
Could I just ask one question about accuracy? What are the risks around inaccurate information?
Well, I mean, there can be any number of risks, but if we're collecting information to support, for example, the delivery of certain types of assistance, to support delivery of certain types of assistance to vulnerable households, it's incumbent on us to make sure that indeed people receiving support need that particular type of support, that they are the most vulnerable in a particular community at a particular point in time, that what they're missing is commodity X or asset X, or that they have a certain type of challenge at the household level that needs attention. This is I mean, I don't want to suggest these are medical diagnoses, but we need to make sure that the right medicine is being prescribed for the right types of activities. And so, again, accurate data is absolutely indispensable.
Yeah. Okay. Ambassador Afi, you know, as somebody out in the field in the Horn of Africa, have you seen any of the impact of, some of the downsides of data?
Some.
Have you seen, we're talking now about accountability and, the safety of information, the protection. Are there any issues that you've seen in your area to do with, data being misused?
Yeah, of course, first of all, I want to agree with the colleagues about the integrity of the data that is collected and conducted. And, for us, the experience we have had sometimes is much more the figures around populations. For instance, in some countries, there's always a debate about the numbers that we have and the numbers that they perceive to exist. For instance, in the case of IDP population, the numbers that we conduct and assess in most cases is not the numbers that the government confirms as true, because it's also an indictment on the part of government that this large number of people could be displaced internally. The reality is that people live and go to places within the country that they feel safe, but then we have a debate within governments about the numbers and the integrity of the data that we have. Yeah. So I think there's more role to collaborate with institutions and partners in order to really find the exact figures or the quality of the data that we have. Yeah. The second is, for us, we use data for planning purposes. Yeah. And you see, they say if you fail to plan, then you are planning to fail. Yeah. So you need to be having accurate data in order to plan for interventions. And here I think we need to see how best we can use modern technology to be able to have quality, verifiable data for use. Yeah. The final one, and I just want to mention this, is the Global Compact envisages a situation where there is solidarity with the states, particularly hosting refugees for a long period of time. Now there, I think, in terms of the interventions, be it in inclusion policy, be it in protection of populations that flee, be it the safety of the information, because we, by virtue of interviewing people who come to out of difficult circumstances, yes, we have access to very sensitive information. Now, therefore, that information needs to be protected from everybody who doesn't need to know it. And sometimes that becomes a bit of a controversial issue. Yeah. And I think we need, therefore, all of us here, and partners need to work together with the states with a view to establishing verifiable, dependable data for planning and execution.
Yeah, thank you. Leith, I know that accountability and, security are two of the things that are kind of very close to your heart. Can you just tell us a bit about that?
Absolutely. There was a good point made before that we need to be cautious not to treat all data with the same brush, that there's all different types of data. But when we're talking about data that can identify individuals or communities in some of the most sensitive contexts where we work as humanitarians, it's very hard to overstate the risks. There's just tremendous, tremendous risk to those individuals and those communities, and we have a huge responsibility to protect that data. 18 years ago, in another life, I was managing a field office for an NGO in Afghanistan, and we were closing that office, and we had all of our sensitive personal identifiable information in paper folders. And my team and I spent about a week, and we burnt all of it in these big oil drums, right, before we closed the office. And that was it. It was gone. We burnt it. That's just not the case anymore. All that data is digital. It's not even in that field office. It's in the cloud somewhere. And so it creates a whole new set of responsibilities for humanitarians. The only way out is through. We have to mature our systems. We're not going to go back in technology. We're not going to go back to burning stuff in a barrel. We have to mature our procedures. We have to mature our technology platforms. We have to mature our staff capacity so that we have the systems in order to successfully protect the data that has been entrusted with us. The risks to the individuals and the communities are very, very important. At BHA, we see another kind of aspect of this, the other side of the coin, where we see our partners struggling to collaborate, struggling to create programs that can treat the whole person, that can break down some of the silos that we see in humanitarian assistance, because they can't figure out how to share data, because of these concerns about sensitivities and the lack of frameworks, the lack of trust in each other's systems. We were unable to come together and do the kind of programming that's going to treat the whole person. And that's another problem, and we need to overcome that. There's some great work happening. There's a lot of bilateral data sharing agreements between organizations that are being signed. I think there's tremendous opportunity for some sort of universal humanitarian set of principles around data protection. We're getting there. We're chipping away at it, and I think that will enable more data sharing in a safe way, protects the individuals, protects the communities, but enables multi-sector programming that addresses the whole person.
Yeah. So, I mean, one of the recommendations that I'm getting from, all of you is that data is crucially important, but safety is also important, and maybe that could be worked into the recommendation as well. So I thought we'd talk now about some of the innovations that you're using. Who wants to go first to big up some of the methods that you're using at the moment? Something which has, proved to be effective in the humanitarian sort of outcomes, the impact. Who wants to go first? Do you want to talk about the displacement tracking?
Yes, I mean,
its effectiveness, really.
yeah, I mean, like in terms of data act are innovating every day, because the humanitarian ecosystem, or the places where we work in, puts us in all these challenges in terms of trying to get the data as soon as we can to be able to serve the purpose, because the dynamic during the emergency situations are very dynamic. Things can change on daily, weekly basis. So the data is as good as it can serve. And again, like, our ultimate objective is to save life and alleviate suffering from those affected by the crisis. So innovation is a constant part of the job, I would say. On the DTM side, we tried, with every new emergencies, we tried to use new techniques and methods to bring the data out sooner than before. Just to give you one example, for the Ukraine crisis response, for example, we managed to pull out estimates of internal displacement in Ukraine in the space of, I think it was 2 weeks.
Were they accurate?
From the now, accuracy is a word. So what we did in Ukraine is that we did a general population survey at sub-national level, so it's between national level to the province, so we have regions, and we use a representative sample through a computerized automated telephone interviews and extrapolate that with census data from UNFPA. That was actually the beginning of the work on interoperability that Leith was saying. And the results came out. Like, it was a scientifically sound, statistically sound results. It's still an estimate, so to get into like the more accurate it can get is to really go down and collect data at community level. Yeah. But for what it's worth, that estimate served the purpose at that point, especially for planning of response and operations, that then guides the whole movement of different sectors of assistance for that matter.
Yeah. Innovations that are in use at the moment that you're particularly proud of?
So, I'd be happy to share a few thoughts. I mean, we've mentioned a few of the technologies, and I think what's interesting is when these technologies are used, to deepen the data that we have. And so, what we do with remote sensing using satellite capabilities, how we use that to complement distance surveys, even things like computer-assisted telephone surveys. It's remarkable just how much saturation there is for telephones, even in the most unlikely context and environments, and how you try and ground truth that with crowdsourced information is important as well. What I think is perhaps some of the most interesting work now is actually beyond the data collection piece, more of the crunching and analysis elements and what the possibilities are with artificial intelligence and machine learning capabilities around that. I mean, back to Leith's point, I think we're very much adolescents collectively in terms of tapping the potential of that work, all the while bearing in mind these various protection concerns and ethical considerations that have been mentioned. So I think there's a huge amount of progress that's being made. Can I just make one quick caveat, which isn't to do with innovation, but just to say we've talked about data collection, data analysis, just to say that a piece that we continue to need to work on is the extent to which decision making is based on evidence, right? And as obvious as it sounds, others can speak more compelling than I can to the Horn of Africa, but we had early warning information for 4 successive failed rainy seasons that were telling us what was happening and what was unfolding. We were not collectively able to trigger the type of at-scale anticipatory action needed to prevent the risk of famine that was unfolding. And so there's something, yes, we need to improve the quality of our data. Yes, we need to make sure the analysis is strong. The connection to decision making and understanding what's blocking the right types of decisions based on this ever-improving quality of data, I think is a key topic, but maybe for another day, Liz, I'm sorry.
Okay. Balthazar.
Thank you. I think like many other organizations present here, what is particularly promising is indeed the combination of artificial intelligence and satellite imagery that allow us to automatically count displacement, household numbers, to know in a way what we will find in terms of need before our teams even go there, to know also whether roads are practicable, bridges still up. So I think that is something we all use and learn and try to improve. I think then we have probably at the ICSC, we recently in an innovative effort opened actually a delegation to cyberspace. So we have in Luxembourg now a research and development hub that actually tries to connect ICSC to all the different research questions that are in cyberspace. And I think here it's not only about data collection, but it's really also how do we, for instance, route data. As an ICSC car in the real world would probably very carefully think where it goes in a war zone, which roads it uses, what is dangerous and what is not dangerous. I think we think hard about data routing to actually have our data to control where our data goes through. It's a question of trusted execution environment. It's also a question of how do you use cloud services, hyperscalers, whilst having what I would call an ambition of a data sovereignty, which basically means that the data we collect, and that's our ambition, and it has a technological, legal, policy element, because you can't just fix it technologically. It needs a juxtaposition of legal policy measures and technological measures, and there is no silver bullet, so it's a combination. What we would like to have is total control over our data, and that means control against unlawful access, which means, of course, hackers attacking us, but it means also control against lawful access in terms of privileges and immunities that we enjoy in the real world. So in countries where we have a headquarter agreement, governments can't come into our offices and rifle through our papers. Now, once we lift that into digital space, there is a number of new, I would sort of say, challenges on how can you ensure that the data is really under your control.
Yeah, thanks very much. Adam?
Yes. First of all, thank you so much. The panel was really informative, and it helped sharing some of the ideas on the ground, real practical ones. But I just wanted to say that while we spoke about data at the onset of emergency, then moving forward, and there's definitely a directly proportional relationship between the use of innovative technologies over time with, of course, the accuracy and quality of data that we require. But the use of those technologies have prerequisites. We need a digital infrastructure, definitely. We need a comprehensive legal framework within the country to be able to use them, which looks into privacy concerns. And that's very important. We need to, look into the interoperability and the complementarity of our data into different systems, and we definitely need trained human capital to collect properly and adequately the data that we require, and we need a standardized data formats, because you can imagine that there are sometimes data collected differently from different parts, and the way to aggregate them sometimes becomes really problematic. And we need to triangulate and ensure the quality of our data. And finally, data collection, colleagues, can cost sometimes millions of dollars. And I look into surveys that some agencies are doing, and the allocated amount of money to conduct that survey is huge. So in order to ensure continuity, we need to have sustainability of such financing, but it's a money worth investment. But it needs to be financed, and it needs sustainable financing to be able to move forward. Those are some of the suggestions to overcome the implementation problems and the data collection and analysis on the ground. Thank you, Liz.
Okay,
thank you.
Leith, you had something to add.
Sure. I wanted to challenge the word innovation.
Okay.
We're very excited about a number of methods that are not traditional surveys knocking on doors. And many of them have been mentioned here. We're also excited about some of the work that can be done with cell tower data to make population estimates. And there's lots of other examples. I think we're at a point now, though, where those technologies are proven. When the light bulb was invented, there was some iterations. There was working out how to do a light bulb, but now they're everywhere. They're in every grocery store. They're in every home. I think we're at a point with some of these innovative approaches where we need to work out, make them part of the toolkit. When are they used? When are they appropriate? What problems do they solve? Do they need a specialized, agency that's always going to deliver that in a certain context, or is it a capacity that every organization should have? There's an opportunity to mature this space and stop talking about it as kind of innovative stuff on the margins, but just part of a toolkit. And when we have a challenge in context we can't access, we bust out the toolkit, we start using some of these other things. We know how to do it. We've got the handbook. We've got the specialized resource. I think we're at that point with many of these approaches.
Right. Okay. Thanks very much. I just want to say thanks very much to the panel. Rizky Mohammed, Balthazar Stalin. I had to practice that specially. Ambassador Afi, thank you very much for taking the time to come here. Rain Paulson, Leith, Adam, thanks very much. Just one final word about the recommendations, from what I've gleaned today. Basically, we should be looking to strengthen humanitarian and development cooperation, share information more, find a way to do that, and improve the capacity of humanitarian institutions to collect, analyze, and disseminate data to develop evidence-based policies to meet global needs and ensure informed decisions and humanitarian interventions. That's one of them. Prioritize data collection and analysis for marginalized groups such as women, children, orphans, people with disabilities, and evaluate the ability to use predictive data analysis technology in relation to humanitarian action to enable more efficient and flexible evidence-based decision-making. But along with all of that, caution, make sure that we're trying to use some of the standards that maybe we use in the rest of the world. Privacy is not where, privacy is the issue, but it's got, there are more dangers in some areas of the world. So caution. Hopefully everybody's learned something from the discussion today, and hopefully it will continue as well. But thank you very much to all of you for taking the time out to come.
Thank you.
Thank you. All right. Pleasure.
We take it out. Yeah, thanks. Yeah, I hope we had a good enough.
Mic check. Yeah. Can I have everyone please take your seats? We are about to begin our final panel, last but definitely not least, our final panel of the conference, which is going to be focusing on volunteering towards new horizons, and it will be moderated by Dr. Ali Al-Gharni. Thank you.
بسم الله الرحمن الرحيم. أصحاب السعادة، أصحاب الفضل المتسمين بالبذل والعطاء من المتطوعين والمتطوعات، أيها الحضور الكريم، السلام عليكم ورحمة الله تعالى وبركاته. نرحب بكم بأطيب التحيات وأسمى العبارات في رحاب وجلسات منتدى الرياض الدولي الإنساني الثالث.
Events of a third Riyadh convention on a forum on humanitarian aid that comes with the reflection of the seven principle of aid work. So donation here is not only with oneself or education or learning or knowledge and time, but it's with the combination of all. On behalf of the Center of King Salman Humanitarian Aid and Relief Center, and on behalf of you, all of you, we would like to welcome the Excellencies, members of the panel, Dr. Excellency Dr. Adel bin Hamad Al-Zinaydi, the Vice Governor of Training, Vocational and Training Center. He is interested in volunteer work and philanthropist and social initiatives. He also has initiatives in strategic planning and innovation. We would like also to welcome Excellency Dr. Volunteer Adel bin Abdel Aziz, and he is Secretary of the Philanthropy of Vision organization, and he's a volunteer and he's a doctor in eye medicine. He has so many awards in the term of preventing blindness and the care of eyes, and also a lot of volunteers and philanthropist activities. We would like also to welcome Dr. Abdullah Al-Matrafi, and he is the head of Zamzam Philanthropy Charity. He also contributes a lot, and he's an author in this field. We would like also welcome Ms. Inas Hamad, and she is the regional advisor of UN program for volunteer in the Arab world. We will not miss to welcome the volunteer Dr. Najla Ad-Dosari, and she is a pediatric doctor, and she has so many field experiences in the Yemen and in the Syrian refugees places. You, dear volunteers who are here existing in this hall, or those who are watching us via the online broadcast for this event, you are the ambassadors of humans, and everyone who knows you must be proud of you. Allow me to welcome you using the poet's word when he said, "You're welcome and peace be upon you, and greetings from us to you." How beautiful is this word with you, and the word is always be beautiful with your existence. If you allow me, and if the speakers allow me, I would like to present some of your achievements through the project performed at King Salman. Since this program started with only 4 projects in 2018, and then to another 30 projects on the other year, and then to another 52 projects in 22, and then to 99 projects in 2021. Last year we performed 160 projects, volunteer projects around the world. This were 307 and a lot countries that they benefited from them. In a number of measures that are specific measures, such as open heart surgery and also brain and veins and nerves surgery. Also, the surgery of cosmetics. There are huge projects with the program of Volunteer NABT in Al Yemen, signed yesterday with a number of that exceeded 31 million Riyal Saudi. Also, the project of Haya to save those who are affected by the earthquake. Also, the project of Noor Volunteer to prevent blindness and its causes that will shed the light later on by Dr. Adel Al-Marshood. In terms for volunteering projects that are non-medical pays, we are talking about vocational and crafts project that enables people to depend on themselves in order to find a craft that will help them to train their society. And it will shed the light by Dr. Adel Al-Zinaydi. And we shall not forget the volunteer project that is specialized for refugees among the world. In this world, we are aiming the volunteer in King Salman performing 360 projects around 54 countries around the world that will reach out and benefit more than 500 million people. According to the directive of King Salman and His Royal Highness the Prince Crown, we will talk about volunteer, and maybe we will start with Dr. Adel Al-Zinaydi to speak about the impact of volunteer.
بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله.
With extend thanks to you, Dr. Ali, and the Center of King Salman for allowing me this chance. We are happy to show the experience of the public institution for vocational and training. Maybe someone will ask how the public institution for vocational training on the human aid around the world. It was an idea that came up from of the trainers. He communicated with the King Salman Humanitarian Aid and Relief Center, and he gave the idea of how to present the training and vocational for some of those who are affected. So this idea were adopted by King Salman, and in the year 2020 we started drafting the action plan with the center. In 2021, in October, we signed a memorandum for the international institution in order to present vocational and technical for some countries that are in need for such skills. The first stage was training the refugees at Zaatari refugee, where the number of population were more than 77,000 people. We started working on several skills and for the children of that one. It was so important to measure the experience and expand it according to the needs of each country and each society. We started with easy and simple measures that doesn't need a lot of cost, and we sent a group of specialized people in order to train, for example, electricity, carpenter carpentry, sewing and cloth design, renewable energy, maintenance of electrical devices, computer and mobile phone. The first experience in the tent was welcomed by everyone, and it was successful on a very high, big scale inside the public institution of training. After the first training, we found a huge support from the center to present different programs in other countries. So we started presenting other volunteer projects that are similar to what is presented in the Al-Zaatari refugee. The international training requires a huge efforts from the trainers, and also it requires tools for training and budgets, and also to give the space for some of the trainees, like in terms of workload, in order to perform such a training. Thanks God, today we have reached out to 5 countries that are performed by vocational and craft training. These countries are Yemen, Jordan, Pakistan, Bangladesh, and Indonesia. And the plan is in 2023 is to expand to another 5 countries in addition to the previous countries, and also to expand in different training fields. King Salman Humanitarian and Relief Center, he provided all the requirements for these trainers who contributed to the volunteer work, starting from the day one, which the trainer leaves Saudi Arabia, until he comes back his home after performing a whole program of training. In 1 year, we have performed 14 training programs in 5 countries through 66 trainers, male and female. We targeted the 2 genders of the trainers. We performed internal platforms for these people in order to contribute in these projects. The very strange thing that we have not expected at all, that the work was for free, and the message was for the whole employees of the institutions, that exceeds more than 10,000 trainers of both genders, that there are a need for training for some of those fragile and under crisis countries. So the target at the first stage was 30 trainers of male and female, and after we have established the electronic platform, we reached 540 trainers of both genders are wishing to do volunteer work under the umbrella of King Salman Humanitarian Aid and Relief Center. So now the demand on volunteer work even exceeds the need. And this is a source of pride for us, and shows that our community, Saudi community, respect and evaluate the volunteer work. And this causes us to start thinking of more projects that might help and contribute to the help of Arab and Muslim countries. The programs performed before, we consider it as a pilot project and under measurement and analysis. After we have performed the 14th program, the next step is to expand in performing technical programs. I heard that in Bosnia and Herzegovina there is an upcoming project, and in Djibouti and Mauritania We also showed our interest in the institution to present new skills that will benefit the people in the market. Our ambition is very big, and the institution ambition is very big. We daily receive volunteer participation work, and by the way, this work is presented by the trainers is for free, and it wasn't not even counted as hours and volunteered. Now it will be a credit to them as volunteer works in the platform. This is in brief the idea of the public institution for training and for vocational training, and we hope that we will have more fruitful cooperation and that we exceed the measures, technical measures, to another trendy and modern measures. Thank you, Dr. Adil. The details you mentioned by him based on the plans cooperated between King Salman and Humanitarian Aid and Relief Center, and also the public institution for vocational training. Since King Salman Humanitarian Aid Center is the only authorized center and the only gate for volunteering externally. This refers, Dr. Adil and dear honored guest, about the quality of work that we want to disseminate abroad externally. Not everyone who wants to volunteer is capable of volunteering. In order, we want those who volunteers to reflect a good image with good quality and good efforts. Now with the volunteer Aziz bin Abdulaziz Al-Rushud to speak about the institutional international humanitarian work and its impact on sustainability. Thank you, Dr. Ali, and I'd like to thank you, King Salman, for allowing this chance. Since there's a look at the institution of vision, or al-Basar, and Basar in Arabic is vision. This institution established 33 years ago, where the World Organization, World Health Forum said that every 5 seconds, each 5 seconds or every 5 seconds, someone loses his sight, and in every minute a child becomes blind. So, dear ladies, now within our session that will take 1 hour, 720 people loses sight, and 60 children, they lose blindness. This caused an international problem in the term of blindness. It caused having more than 36 blind people around the world, 36 million, more than 217 million who are vision disabled and vision. This they can see, however, they cannot do their daily life activity easily. This number is increasing every year. 1 million to another, at the average of 1 to 2 millions. Then we have a problem, and that is increasing. And the volume of the work is done annually is way less than what we need. The bad thing that is 80 people of these numbers live in the 30% of the numbers is in the developed countries. In this context and under these circumstances, the Vision Institution were established in more than 30 years, and they try to defeat and fighting blindness on four sides. First one is to have a medical campaign, mobile medical campaigns that they go in Asia and Africa. We covered 49 countries. They examine, they give glasses and operate on those who are in need. Second component is to establish specialized hospitals in medicine, the sight and vision medicine. First site is totally free. However, the second one, the other one is to have to pay self-funded by paying very slight or small fees, and then by using these small fees we can continue giving. Third one is care with the workforce and the measure of those who work with the vision, by establishing colleges and institutes that they take care of this category. We have a college in Sudan, we have an institute in Pakistan. The first one, they serve those who speak in Arabic, in English, and the other two ones, those who are speaking in French. And we have another one. And the fourth component is to take care of the health. These people that their disability and vision will be an obstacle for their advancement in education. We go to the schools, we examine the schools. If they need glasses, if they need therapy, is given therapy. And those who need to be admitted into hospitals are sent to hospitals. We were enabled to do performing a lot of programs that care in the health of kids. And we reached out to the Center of King Salman and we adopted the project of volunteer. Youth, Saudi, male and female, and also as ophthalmics participate in these campings that they wander from the highest land of Mauritania to Philippines, passing through all of these areas. And the project of volunteering, we found two things. Maybe I conclude with it. Or more than two things. First one, a lot of participants among us, we find ourselves there. And we found another thing. We found that a lot of participants, they find blessing in doing this work, that it reflects on their time and their kids. It's something that will add value to your work. And we can see the impact. I have to say that we can see people say that I was not being able to recite Quran for 5 to 10 years, and the glasses value is only $1. So by giving him this $1 value glass, we can make him be able to recite Quran again. For the glaucoma operations, we can say we ask the donor to give us $100. Some of them, they come guided, and when he exited from the hospital, they are driving. He comes with disability, and then he comes back doing good things. When you feel this experience, of course, it leaves an impact on some of the volunteers from in the internal and external. They bring their kids with them. These kids, they say that the lives of our kids, of children, has changed when they could observe the life of these people in need.
So we, through King Salman Relief, we are all extending our hands to you. Everyone, whether in this auditorium or elsewhere, or listening to us through virtual webinars or any way they can volunteer, this place will have such a great return on investment for those receiving services and for those volunteering. So why not we work in tandem for the sakes of Allah, so that our efforts are all become more blessed. Thank you so much. Your attention is highly appreciated. Your Excellency Dr. Adil Al-Rashid, thank you so much for your contribution. Everyone is aware of the fact that Vision 2030 of the Kingdom of Saudi Arabia, this ambitious vision, which makes volunteering as one of the most important target to reach up to 1 million volunteers by 2030, and also it has standardized and unified the donation channels through the official channels, and also standardized the volunteering track through King Salman Relief. Dr. Adil, thank you so much for your own insights and contributions and inspirations that have gone for so many years. Moving ahead to Dr. Abdullah Al-Matrafi to further speak about the way to, or the ways to enhance volunteering across local non-profit organizations. The floor is yours, Your Excellency. In the name of God, the most gracious, the most beneficent, most merciful, blessing, prayings, and household Prophet Muhammad and household the company. Thanks for this great efforts to organize this forum, and big thanks go to King Salman Humanitarian and Relief Center. In fact, to speak about the importance of charity-based and volunteering action across local communities makes us further to speak further about different issues. It is very important to speak about this. Charity and volunteering action is part of the social legacy where all the countries, all the cultures, civilizations come together on, because it is something that is based on our human nature, and also it has a humanitarian sense and the sense of Muslims. It has another ethical dimension, and also because we always do this for the sake of Allah, for the sake of God, because when we do charity, whether for humans or for animals, will be well rewarded for this. And we still remember the story of someone coming from the Israel, someone who came to see a dog very much thirsty. When she gave it water, she was rewarded. So ethics always are there at the center and the core of our human actions, particularly when it comes to the Muslim societies. It's the culture that is based on our everyday attitudes and behaviors, and so many teachings that enhance volunteering to further enhance charity, making this issue as something that is taken for granted. And the way we love philanthropy, and these kind of philanthropies, these kind of charities, this kind of magnanimity, benevolence, are all based on ethics and morals, as been referred to by Dr. Adil. How it can play such a great role. It creates something that is self-satisfaction, because you understand the needs of the people, the needs of the poor, and the needs of the needy. And there are so many stories yet to retell and narrate about the needs of the people. So when we are calling people to engage in volunteering, the figures and the numbers reflect a model in something that is relating to vision or insight, but the need is so huge. In the same token, volunteering is not just based on one person or is limited to one person. It is also limited. It's also made available to families, households, and societies, because it is something that is called upon by so many communities, so many societies. It is a very active factor for development and the growth. In Vision 2030, we see how volunteering is placed at the core actions because so many targets have been developed based on this big numbers, and of course Vision 2030 will do so. So with this in mind, of course, this is something that we always feel, and all the people, of course, in this society can see this, how important it is. So we as charity organization and society, we see how important it is. So many people, of course, come into play to see how important it is and to see the opportunities that can be enhanced. But again, it's a call, it's an invitation to encourage people, and I wish that attracts much interest. I may call it a strategy, or may call it like number one or priority number one issues, and we may call them like things that can be considered or looked at. Or we can look at volunteering as part of their everyday life. It is something that we can look at, and how we see how we can join volunteering even at the healthcare system. We look at this as a way to be engaged. We have, like, for example, to do a kind of volunteering per day, for example. It is healthy, and economically it is healthy. There are figures and numbers that can tell us how important volunteering or volunteerism as a core important point, and be part of their everyday life, and be like a volunteer for a more strategic action to share and do more and more and be proud of, and also for such organizations and entities to adopt such concepts and better understand the benefit of this, of course, and the outcome that comes into play. Again, volunteers need to be a core interest, because volunteers need a lot of issues to be understood by him or her, where he can be further supported and helped to be further engaged. And also it has such a great impact. What is mentioned by Dr. Adil and the other speakers, it is said, and we hope it is a statement that is being hung, that the creativity and innovation of volunteers are unlimited. So each and every one can play such a great role in volunteerism, and be creative, be leading, of course, through the different organizations. It is equally important to work through an organization or society to play such a great role, to have such a great impact, because if he or she works in silos, he will not be as efficient and effective as when he works or she works in collection with others, in collective work or in collection with others. Volunteers are in dire need to be always engaged. When we look into the humanitarian and relief organizations, and the organizations engaged in volunteering need to understand the reality of their population, the demographic composition of any given societies. And this is very important because based on which, of course, a lot of things are being based, where we can learn more about the culture, the practice, and the mindset, the attitudes of the local community where he or she is volunteering for. And he may be doing like something that can reduce the outcome or the yield of what he or she aspires to. Of the things that should be considered, there are sometimes conflicts or differences that cannot be visibly shown. It can be tribal, it can be like sectoral. If he or she goes to a village, he may create a volunteering action, and he needs to ensure that this village do not have any kind of sensitivity with other villages, because there are certain issues where it can trigger tribal differences, tribal compulsion, and tribal repulsion. So he or she needs to understand the demographic composition where such a voluntary action can be provided. Again, he or she should also lead this kind of volunteering and should make more efforts, of course, so that he can realize the results. And this is very important for volunteers, particularly when they work through organization. When he or she understands the demographic composition and culture, they understand the needs of the people. If people, for example, suffer from famine, they need to understand what kind of food they need. For example, he may bring sources or resources of food, but they don't use, or they are not used to having always. So it is very important to understand this. And also, volunteering-driven organizations should also encourage those people who can provide better services. Because I don't have time to further speak about this, but I need also to speak a very important issue, which in our own business and in our own action, volunteers need to understand, need to adopt values, principles. Values are a red line. Those who ignore such red lines or violate such values, it means these are not core values. There are core values that should be honored, respected, and humanitarianism and volunteerism are very important to be always working with each other or working in tandem. For example, humanitarianism is very important because the action that we do out of volunteering seeks to reduce and mitigate suffering faced by people who have been suffering for a long time. So he will put a lot of efforts in order to maintain their lives and their own livelihoods. So it is very important to further focus on this, and of course they also need to take care of this. One more thing, not to be biased or prejudiced, because if you go somewhere, it means you do need to provide such a service based on their dire need or based on their need, because you don't have to look at the tribal considerations and this kind of need. You need to see what and how much they need, where of course you feel that these kind of things should be provided regardless of the other is independence, where their work should be humanitarian, far away from any socio-political or socio-political issues or socio-economic issues. It should be out of heart, out of volunteering, and also should be, as I said, out of, or it should be free from any kind of bias or prejudice. And volunteers should pay attention to when they conduct and carry out their own campaigns, particularly in poor countries. When we deal with a certain entity, they may feel offended and they may feel unhappy, because it is very important to look at such kind of services critically, immaculately. So it is very important that we understand the system, regulation, laws, and the sensitivity of a given given society. Providing such a service should be provided without any kind of bias or degradation, and should also understand the laws of the humanitarian action, particularly in crisis impacted societies. But again, in 1 minute, ladies and gentlemen, I would like to say that charity is our nature, And we do need to program ourselves how to conduct this kind of action, how to enhance volunteering through working in societies. Equally important, it is very important for us to work on this and to take the experience and the expertise from the people in charge. And it is very important, of course, to see how important it is. What we feel is so those who see reality of people can better understand how much volunteering should be provided. One of the doctors, he was training, or he was under training in Canada, and a professor. So when he came back with an organization, when this professor was retired, he he joined him in one of the volunteering actions. So he told him that this is the most important action. This is a good model how to change reality, how to change yourself, and to better understand, like, for example, how the result of this can come into play and can see it as a fruit. Thank you so much. Dr. Abdullah, thank you so much. We all agree that those who are listening to us and are here around are or should or will be involved in volunteering actions, and it is all triggered and motivated by ethics and not out of bias or not out of prejudice. And the pleasure and passion of volunteering is always there, no matter where he goes or she goes in impacted areas and carry out such kind of actions, volunteering actions, just out of humanitarian purposes. Dr. Abdullah, thank you again. Moving ahead to Inas Hamad to speak about a comparison in volunteering through global and local organizations. Please, Mr. Inas, the floor is yours. Thank you so much. I would like to express my appreciation to King Salman Humanitarian Aid and Relief Center, which goes about volunteering. It is a humanitarian action. Two important numbers I'd like to tell you about. There are about 438 million people, volunteers. This is a big number. The other is 15% of the world population provide volunteering actions over the 3 years, recent years. This big volunteering efforts, I believe that this will share efficiently to achieve the SDG. These two big figures were issued or released recently by the UN volunteering officers. Back to the question about volunteering in United Nations organizations and local and civil societies, organizations and societies, is to integrate volunteers in offices, programs, and projects, and a project sponsored by the UN. Now we have 12 volunteers. Of course, they work 24 hours, 7 days per week, and for years. And this, of course, makes this volunteering experience unique because they work with the UN. It is a professional experience where, of course, volunteers can be or actually are integrated and merged into the team members, starting to be engaged more in the programs, projects, meetings, and start to formulate policies. And after that, of course, he or she will be prepared and developed for the labor market. Now we have 3,500 for the UN development program, and with UNICEF, more than 1,000 for the refugee organizations, the World Health Organizations. This refers to the fact that volunteers play such a great role. The second role that UN Refugee Affairs, in close cooperation and partnership with the different entities and governments, put strategies and policies, and this is very important so that we can develop policies, principles, foundations to give them opportunities so that they can have like priorities in the labor market. Of the partnerships that we feel proud of is King Salman Relief, King Salman Humanitarian and Aid and Relief Center, to integrate volunteers in the different programs and projects. King Salman Center in its own leading role when it comes to integrating the volunteers is that it has an initiative that was launched yesterday, Hayat Initiative, the Saudi volunteering initiative. It is a leading initiative. It is a model example to follow, not just in the Kingdom of Saudi Arabia, but elsewhere actually, and also to integrate volunteers of the different platforms is to volunteer online, which proved its importance. But again, he or she, they can, or they did prove actually how we can prove ourselves to be volunteering always. I don't want to take much time. 1 minute. At the end, I would like to make a message to you all, to all volunteers, particularly for those around us here, this Invest Forum. I'd like to give them a big and warm applause. Thank you so much. Thank you so much. We are very proud of you as volunteers. The Saudi platform for external volunteers, we have made more than 44,000 volunteers readily to volunteer from for outside. Big thanks go to them. Thank you so much from the depth of our hearts. Moving ahead to speak about enhancing the Saudi women in external volunteering, the best to speak us is by Dr. Najla Al-Dosari about medical volunteering, particularly to treat dermatological diseases in camps of refugees. Peace, blessing be upon the Prophet Muhammad, household and company. The Syrian poet Khalil Murdam Bek, people, if they do not give each other condolences, they are very much like stones, if we cannot call them humans. If you do not feel passionate about something, then about poor, then it is better for you to replace your heart with a stone. It is this life that either you be live or you die if you have no passionate. My name is Najla Al-Dosari. I am volunteering and I am a dermatologist. I have such a great experience in volunteering with King Salman Humanitarian Aid and Relief Center. I hope it would not be the last one. One was in Al-Zatari camp and the other one in Yemen. I spent 5 days in Zatari camp with the Syrian refugees. Me with a Syrian nurse and some trainees from the Faculty of Medicine in Jordan, we diagnosed more than 200 dermatological cases, 3 of which, of course, are known as skin cancer. May Allah forbid this, and we refer this to, of course, specialized centers to be paid by the center itself. We noticed certain burns not because of the war, but because of crowded houses, residential units. We provided them recommendations, we provided them different medical pieces of advice and advisory services, and also to better enhance the safety procedures in the camp. In Yemen, things were different. Big hospital, but it was almost ramshackle. It was almost falling down, lacking a lot of medical healthcare supplies and services. It also lacked specialized services, and also it lacked medical first aid. So the skin team members were so big. We provided the treatment, medical treatment for so many patients. We treated so many medical cases, skin cases, of course, but they were such as eczema and other issues, and also like plagues was so common, and also the center was able to provide medical treatment for the patient and for the household as well. Our own medical team also provided different awareness courses and programs about the most important contagious and common diseases, how to treat and how they spread, of course, by master degree students. And for those interested, to give you a panoramic picture about the campaign, the skin team was not the biggest one. The surgery team, which had like surgeons, cosmetic surgeons, children surgery, and also urinary tract surgery and other specializations, all worked perfectly. I hope to express my appreciation what I have seen. Saudi surgeons, males and females, Saudi nurses, who of course were fully dedicated and did their best. They didn't look at time, they looked at achievements and to provide better services for the patient. Humanitarian actions was at the highest, and creativity and innovation was the best achievement they did, of course, even though a lot of challenges came into play. The question is, what is it that these kind of experiences provided me? Well, it enhanced my self-confidence, making sure that I can do always. At the hardest time, I learned to be very much creative, very much innovative, even though resources were almost limited. These experiences gave me a fresh breath of air and gave me hopes, unlimited excitement, thanking Allah and appreciating the support I am endowed with by Allah. And I learned also that the Kingdom of Saudi Arabia has per excellence and beyond compare can never be except at the head of the leading country. Thank you so much. Dr. Najla, thank you so much for the great achievements. We always feel proud of volunteers, and we encourage others to join, and we are always excited, happy and proud to speak of our own external volunteers platform. If you have any questions relating to this, of course, you can further communicate us through the media or the website. And would like to conclude with 1 minute for each speaker to our own volunteers. We'll start with Dr. Adil in 1 minute, please. Please. Thank you so much. First of all, is to be rewarded by Allah, to accept the challenges, the difficulties. And I ensure again that it has such a great lovely impact if they do well enough. This is a very important. Thank you so much all. Dr. Adil Al-Rashid. My message is to everyone, no matter who he is, regardless of his job, learned or literate or illiterate, will play such a great role in this big caravan of volunteers, whether at the core, forefront, or at the end. And we don't know where the best reward is. It could be at the end. And the end members may be the reason why this caravan made its way all the way up. So we don't have to devaluate or underestimate the efforts of each and every one. So it is very important to move to provide all that we can do. Thank you so much, Dr. Adil. Well, need to make volunteering is part of our way of thinking and how we make it. Again, it is possible that I can volunteer through different methods and modalities, not necessarily that I cannot go there. We can volunteer through different ways. But if we adopt this kind of approach, then of course the impact will be higher and higher. Do it once and live it for hours as a volunteer. You will see the difference. And you will see your own way of thinking will be much changed before. So I am calling all those who are listening and seeing us to be engaged in volunteering and see the impact of this, of course, how it is. And rest assured that your work will be much better and also feel rewarded by Allah. And because you are volunteering in your time, efforts, your family, your thoughts, your ideas. And now, because many doors, many windows are now widely open to volunteer locally, regionally, and globally, it is just for you to be engaged more and more. Dr. Adil, thank you so much. One message in 1 minute. My message is that volunteering is an opportunity to give and feel the passion of volunteering and the passion of giving, and to make our resources to make them available for those who are in dire need for the future. Volunteering is really a chance. It is such a great passion. It is such a great thing. Thank you. Thank you so much. We need to conclude now. My message is very short. Don't feel panic and fear. Don't hesitate and don't feel worried. You can be a creative no matter how difficult it is. Thank you. My message to volunteers: so by your own efforts, we always make such a great impact for better humanities through King Salman humanitarian aid and relief in the kingdom of Saudi, the kingdom of generosity, the kingdom of growth and development and prosperity. We now have come to the end of this panel discussion. Big thanks go to the great speakers and the great audience, and for all those who are with us here or there. And we hope to see you in other upcoming forums. Big thanks go to the speakers. Big thanks go to the audience. Thank you so much. Your attention is highly appreciated. Thank you.
Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized movement to help each other. We will have to work together to achieve the UN Sustainable Development Goals, SDGs, and take responsibility and cooperate to achieve the goals of our organizations, conferences, and forums to reach the desired goals. This is how we can change our world, as much as possible, for the better. Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups. Crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized movement to help each other. We will have to work together to achieve the UN Sustainable Development Goals, SDGs, and take responsibility and cooperate to achieve the goals of our organizations, conferences, and forums to reach the desired goals. This is how we can change our world, as much as possible, for the better. And slow down the deterioration to replace it with positive change to ensure a prosperous future for humanity. We are here today because we are responsible and we are able, together, to create a world we have always imagined. Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized movement to help each other. We will have to work together to achieve the UN Sustainable Development Goals, SDGs, and take responsibility and cooperate to achieve the goals of our organizations, conferences, and forums to reach the desired goals. This is how we can change our world, as much as possible, for the better. And slow down the deterioration to replace it with positive change to ensure a prosperous future for humanity. We are here today because we are responsible and we are able, together, to create a world we have always imagined. Wherever we look, we see the world around us making spectacular progress, but still suffering. Endless challenges, crises and problems here and there, and the biggest losers are the most vulnerable and needy groups in the world. And because we are empathetic and compassionate human beings, we must move in an organized
bite of food. Only those who are suffering from thirst will appreciate a single drop of water. Only those who have been forced to sleep without shelter will see a tent as a palace. Only those who have been forced to leave their homes understand the burden of alienation. Only those who are ashamed of their ignorance fully realize the importance of education. Only those who are sick will consider good health to be the greatest blessing. Only those who have suffered from weakness can rejoice in finding empowerment. Only those who have lived through disasters can truly understand their horror. Only those who have lived in fear can truly value even a single moment of safety.
بسم الله. تبي تست على بسم الله الرحمن الرحيم. بسم الله.
First English. Excellencies, dignitaries, ladies and gentlemen, based on the major themes discussed at the 3rd Riyadh International Humanitarian Forum, the following recommendations were developed to further our collective efforts in the following areas. 1. Partnership, evolving humanitarian needs and responses. Recommendation 1. Promote open, transparent and effective partnerships by sharing information, accurately assessing the needs of affected populations, and defining appropriate humanitarian interventions to better anticipate, prioritize, prepare, and respond to evolving humanitarian requirements. Recommendation 2. Adopt a results-oriented approach to ensure the efficiency of implementation and maximize the impact of humanitarian interventions. Point 2, assessment, data collection and analysis to support humanitarian work. Recommendation 3, enhance the capacity of humanitarian actors to collect, analyze and disseminate data to address humanitarian needs and advocate for informed decision-making on humanitarian interventions in a timely manner. Recommendation 4, assess humanitarian needs and monitor interventions that result in a meaningful impact on affected populations by using innovative technologies, researched and evidence-based approaches, data collection mechanisms, and big data analytics. Point number 3, localization, anticipatory action, strengthening the resilience of local communities. Recommendation 5, build the capacity of local actors to better respond to crises by strengthening the adoption of a people-centered approach in identifying needs, increasing access to innovative tools, and improving preparedness for response mechanisms. Recommendation 6, establish effective, structured, systemic communication and cooperation channels at the local level in conflict and disaster-prone areas to enhance performance and accelerate response. Next recommendation, 7. Accelerate localization to strengthen community gains through proactive action to provide better outcomes to protect and restore lives and livelihoods. Point 4, nexus. Achieving SDGs, Sustainable Development Goals, through humanitarian development and the peace nexus. Recommendation 8. Promote complementarity between humanitarian development and peace actors and approaches to strengthen joint programming and effective coordination. Recommendation 9. Operationalize the Nexus approach based on lessons learned and best practices and develop practice-based guidance for wider dissemination and replicability. And Recommendation 10. Design interventions across sectors for vulnerable communities in fragile contexts to strengthen resilience and adaptation. These are the recommendations of the 3rd Riyadh International Humanitarian Forum. Thank you.
أصحاب المعالي، أصحاب السعادة، أيها الحضور الكرام.
Ladies and gentlemen, peace and blessing be upon you all. We are honored and delighted to announce the final recommendations of the Riyadh Humanitarian Forum in its 3rd addition, based on the major themes discussed in Riyadh International Humanitarian Forum, the following recommendations were developed to further our collective efforts in the areas. First, partnership, evolving humanitarian needs and responses through promoting open, transparent, and effective partnerships by sharing information, accurately assessing the needs of affected populations, and defining appropriate humanitarian interventions to better anticipate, prioritize, prepare, and respond to evolving humanitarian requirements. Adopting a result-based or oriented approach to ensure the efficiency of implementation and maximize the impact of humanitarian interventions. Assessment, data collection and analysis to support humanitarian work through enhancing the capacity of humanitarian actors to collect, analyze, and disseminate data to address humanitarian needs and advocate for informed decision-making and humanitarian interventions in a timely manner. Assessing humanitarian needs and monitoring interventions that result in a meaningful impact on affected populations by using innovative technologies, researched and evidence-based approaches, data collection mechanisms, and big data analytics. 3. Localization, anticipatory actions strengthening the resilience of local communities. Building the capacity of local actors to better respond to crises by transferring the adoption of a people-centered approach in identifying needs, increasing access to innovative tools, and improving preparedness for response mechanism. Establishing effective structured systematic communication and cooperation channels at the local level in conflict and disaster-prone areas to enhance performance and accelerating response. Accelerating localization to further strengthen community gains through a proactive action to provide better outcomes to protect and restore lives and livelihoods. 4. Nexus, which means achieving SDG through humanitarian development and peace nexus, through promoting complementary between humanitarian development and peace actors and approaches to further strengthen joint programming and effective coordination across the different actors and sectors. Operationalizing the Nexus approach based on lessons learned and best practices and developing practice-based guidance for wider dissemination and replicability. Designing interventions across sectors for vulnerable communities in fragile contexts to further strengthen resilience and adaptation. And now, with the ceremony of honoring in line with the Al-Marifa University, which contributed to achieving and conducting a lot of research studies provided in the forum, which will play such a great role in coming up with effective recommendations will enhance the quality of the humanitarian work. Equally important, the hackathon that went along with the activities of the forum to further and enhance innovation and creativity for sustainable development. Appreciating the contribution of Al-Marifa in research and development, we are asking His Excellency, President of Al-Marifa University, is kindly requested to come to the stage by the Senior Consultant at the Royal Court, Dr. Abdullah Arubai'a. And now, Hackathon awards will be given to the winners in close cooperation with Al Mara universities within the activities of the International Riyadh Humanitarian Forum in its third edition that went for 2 days for the graduates of universities, institutes, and the promising technologies for sustainable development. The first ranking winner, the needs of the countries for food security, for alternative solutions, by Sarah Al-Khalil and Omar Al-Humaydan and Hayazin. The second ranking position, which is the smart intelligence for the needy countries, provided by Abdullah Al-Zamil, Saleh Maili, and Bassam Al-Anizi. The healthcare track for humanitarian work and sustainable development, the first ranking position, AI program for heart diseases by Layan Ali Al-Sagaf and Muhammad Umar. The second ranking position is the rainfall technologies by Lubna Al-Shu'lan, Abdelaziz Al-Shinqiti, Sultan Al-Farraj, and Al-Dawsari. The third ranking position, the thermal care for emergency rooms by Amani Al-Ja'fari and Balqis Al-Jarrah and Yasir Al-Asfar. The humanitarian action and the sustainable development for the needy people, for autistic by Asma Asiri and Samira Shafi. position, IKHA educational platform that is based on volunteering by Iftikhar Al-Qurashi. Third ranking position, volunteering application by Amira Al-Maimouni. And now, ladies and gentlemen, the Humanitarian Lens competition, it was launched by within the activities of the Riyadh Humanitarian Forum in its third edition 2023 to further create spaces for the media professionals and photographs. The first ranking position by Hisham Al-Ahmed, and the name of the picture is Raghda. The second ranking position was by Mr. Muhammad Al-Kharari Rawnaq, to be received by Ali Al-Garni, the head of the volunteering programs at the center. The third ranking position, Osama, known to be received by the director of the volunteer programs. The fourth ranking position is Fahad Al-Ouda Takatuf. The excellence competition for the humanitarian lens, camera lens, in the fifth positions, Ahmed Assaif. Adib Al-Hamad. Nasir Al-Nasir. Hussein Al-Abdul Latif. And Muhammad Al-Falih. Ra'id Al-Malki, to be received by the head of the volunteering programs department. honoring the universities, emphasizing the efficient role played by the Saudi universities in participating with the Riyadh International Humanitarian Riyadh, and the contributions made to further enhance the panel discussions through documenting the discussions and also conducting parallel workshops to communicate such knowledge to students and further discuss the most important challenges and come up with recommendations and innovative solutions to enhance the humanitarian work. His Excellency, the Deputy President of the Organizing Committee to honor the Saudi universities participating in the forum, Al-Marifa Universities, represented by Sarah, the head of and the Dean of the Faculty of Pharmacy. Al-Majma'a University, represented by Dr. Abdullah, Assistant Professor of Surgery in Faculty of Medicine. King Saud University, represented by Hala Slim, Associate Professor of Psychology in Faculty of Education. Muhammad bin Saud Islamic University,